So much, Chair. I'll proceed to ask my question, and this is directed to the CEC on, please tell us how many casual workers do we have, contractual and volunteers do you have in your department, including those who are working at the sub-county?
Thank you. Thank you. Chair, I've tabled a report indicating all the staff that we currently have in the department, all including permanent and casuals, not casual, actual contractual employees. We do not have currently any casual employee in the department. All that we have, the staff we have are all engaged on contractual basis. Thank you.
And you, CC, please proceed to state how many do we have? It's contractuals and volunteers. And just be very, state the facts as they are, because we're aware that people are still volunteering in your department.
Thank you. Chair, I've tabled, the report I tabled includes the two departments, that's the Department of Public Works reports. In total, the department has 98 staff.
Are those contractual?
Yeah, I'm making my point.
Please don't mention the permanent. Okay. They are not part of our research right now, investigations.
Okay. So we have a total of 41 contracted staff in the department.
These are contracted. You don't have any volunteers? Casuals? Total even in the sub-county?
Yes, we don't have any casual staff.
Alright. Chair, you can proceed to...
And before we proceed to the next member, Waziri, there was a lady who came here during our sessions last week. I can't remember her name, but I'm sure you saw her. She said she works at your department, probably at the reception, but I'll confirm that name in the due course, so that we are able to know if she is casual or volunteer. Probably maybe she's not working on your department. Honorable Martin, proceed.
Thank you. My question is, what is the total budget that is used to pay casuals, contractual and volunteers in the department?
Thank you, Chair. We have, as I indicated, we have 41 casuals. They are in different job groups. I may not be outrightly able to tell you exact amounts at the moment. I need to check with the payroll master. That question will not come to us. Can I respond to that question at an opportune time? Yes.
Okay, maybe Chair will guide, then you will furnish the committee the same.
At one point, during this session or after the session?
After the session, Chair.
Honorable Mati, are you okay with that?
I'm okay. Okay. Another question is, what is your role as CEC in the recruitment of casuals, contractual and volunteers?
Of staff and staff, volunteers, be it with volunteers or any staff, is entirely responsibility of the Public Service Board. Our only role as a department is to give our intent or our requirements as a department. I don't play any role in the recruitment process.
Okay.
Honorable Atandimo.
Thank you, Chair. I just want to ask you that when last did you pay your contractual staff their wages?
Thank you, Madam Chair. That one, the payment was done. I think they received their last paycheck in the last month.
Yeah, because we have complaints that most of your contractual staff did not receive their wages for almost 7 to 8 months. Is that true?
Waziri, before you proceed, you said you're not involved in the recruitment of the contracted staff. You're the head of the department. Are you aware who does that?
Yes, Madam Chair. I said we only give our indent, we only advise or we submit our requirements at any given point and from time to time.
Well answered, and to who?
We give our indents through the county secretary to the Public Service Board.
Well answered, Waziri.
Yeah, Chair, I think I will continue. Bwana CC, we are asking, when last did you pay these people? The contractual staff.
Madam Chair, I did answer that, and I would like to repeat so that the member that our payment to the contractual staff is up to date. They received their last payment in the last month, including some of, we received our pays as well.
Because we are getting information, there are some staff, especially those operators, plant operators in their sub-counties. They have stayed for more than 8 months without payment. So that's why we wanted to know, why were they not paid? Here there is a budgetary allocation to them. Remember, you have taken an oath, and when you give this committee a false statement or a false information, then it is wrong. So just tell us, when last did you pay them? Because we have an information that most of the contractual staffs have not been paid for more than 7 to 8 months.
Chair, I'm not aware of such a complaint. I'll need to find out, and I'll need to check with the payroll master and the HR department, because as an office, we've not received such a complaint.
Before you proceed again, I would like the CEO to tell us who that person you saw in that picture. Is it from your department?
I have two chief officers. Would you clarify which chief you want to respond to that question?
Kosgei.
Chair, in regards to the photo, she is not a member of my department. Thank you.
But at least you said you know her. Which department does she come from?
She's not a member of my department.
But you said from the face, you know her.
I have not said I know her, Chair.
Then he can proceed to help you because he is also aware of that person.
Okay. Okay, thank you, Chair. Sorry for the delay. The mic was not on. The lady in question is called Celestine Kiborei. I think she was invited to this committee last week on the issue of volunteers.
I want to know which department does she come from?
Public Works, Chair.
Is it under transport and public works and infrastructure?
It's the Department of Public Works, but under the Ministry of Transport.
But your CEC is Lekonaya?
Yes, Chair.
And that lady is a casual worker?
No, she's not a casual worker.
She's what?
What probably I can give a background of that.
Before you give me the background, I want to know, is she a casual worker? Is she a volunteer? Is she a contracted person? Is she a PNP person?
The report that came to the House, it's indicated that she's a volunteer, Chair.
Not the report. As per you, who is she?
Well, people come to the department for attachments.
Waziri, bring your CEO to order.
Okay.
Thank you, Madam Chair. What my chief is trying to say is that she's a volunteer.
As per now, I can tell you, Waziri, if I say you're lying to this house, it's true. Because the CEO for Public Works is your immediate CEO. And you've indicated that you don't have a volunteer, you don't have a casual worker. Members proceed, Sharon, Honorable Sharon, on that note, as we proceed on that matter, so that we close it. I don't know if it's a point of information to what relates to the lady, Honorable Sharon. Yeah, okay, proceed so that Honorable Waziri answer comprehensively so that we close that matter.
It was relating to the lady, and I'm really disturbed, Waziri. These are the people who are working under your department, and at this point in time, I don't think it's proper for you to say that you don't have a volunteer. This is a lady who has been working in your office as a volunteer for not 1 year, many years now. And even as you go, as you answer that, please, so that you don't make us feel like you're lying to us, even on that issue of contractual stuff, they've not been paid for 7 months. Please don't try to go around in circles, because on this matter, you'll make us mad and agitated on that issue by lying to us on oath.
Waziri, proceed and be guided. The mic, you will always wait. We have somebody who gives you the right so that you don't press many times, it will go off. Waziri, proceed.
Thank you, Chair. I'm of a contrary opinion that somebody is indicating that I lied before this honorable committee. I said we do not have any casual staff. I did not mention that we do not have any volunteer. Point of correction.
Honorable Sharon, proceed.
My question to you, and I read to you clearly, I asked you, how many contractual staff do we have? How many casual workers do we have? How many volunteers do we have? And you said that we only have contractual staff and those who are on permanent and pensionable basis. I asked you, do you want us to go back and see the question?
Waziri, be guided, you're on record. If you go back to the questions that member are asking you, they are there, and I'm here also as well. You ask about the casuals, the contractual staff, and the volunteers. Probably maybe you say you didn't get the last point, but don't say you are not asked that question.
I was asked,
proceed.
My apologies, I was asked that question, my apologies. I did not mention anything about volunteers. I mentioned only on contractual staff.
You know, Waziri, our points are just straight. Okay. When you say you didn't say about the volunteers, you said you have only contractual staff, meaning you don't have the two. You have contractual, you don't have the volunteers. When you indicated even in your documentation, that is what I was able to give Honorable Sharon this document, because I knew it will bring something different. And she is able to know what kind of people are in this paper. They are contractual staff from your end. Okay. But we don't have volunteers and we don't have casuals. So let's go back to that point. Tell this committee if you have casuals and volunteers as we proceed to know that lady in question.
I go back to, let me go back to that question, and this is my statement. We have 41 contracted staff, 1 volunteer. Just give me a moment, madam.
Okay, put off your mic, Waziri. Proceed, Waziri. Wait, you be on record.
I'd like to make some corrections. I've conversed with my two CEOs. We have 3 volunteers, not 1.
Give us the names. And Waziri, did you receive the letter that we indicated? Was it about casuals and volunteers? Do you have any casual, or they are only the volunteers?
I seek your indulgence, Chair, because the letter we gave you, the response we gave you earlier on, did not conform with actually what you asked us. That is why today I tabled a report, updated and reconciled with the number of staff as you had guided me. So the report is with you.
I want to make it clear so that we move on. I don't know if you have this document with you.
I do.
I want you to read that question so that we proceed. Then we get to know exactly what was asked from you.
Okay, just a moment.
And clearly, Waziri, I was not wrong when I said your CEOs are not serious. It has come out clearly that even this morning you're not prepared, and you're giving false information, and even your letter that it's signed by you, it has that volunteer staff. So I don't know what would you want us to do, because if it goes back to the members, the questions are very clear and they are there in your letter. So I don't know what you want us to do. I want you to proceed with your comments that you wanted to make. I would even not want you to read this letter because it's from your desk. Just proceed with your questions, with your answers to Honorable Sharon, and then we proceed.
Thank you, Madam Chair. I stand guided on that matter, and the rest subsequently we will try to be very precise. As I mentioned, we have 41 contracted staff and 3 volunteers from our earlier letter. The letter that we amended and brought it to the House today do not include volunteers.
So you're saying in the previous letter we'll get the volunteers?
Correct.
The lady in question that was here, it disturbed me because she said she's been volunteering for many years, and the lady who was acting on that position, she retired. Is it right? I think it's by the name Nora. The CEO on the other end can help you because it's directly from his department. You can give us information about that lady, and don't tell us you want to give us stories. You want to just hear about the lady in question and why is she acting for all those years in your presence.
Okay, thank you, Chair. The lady in question is called Celestine Kiborei, and she was, how she came into the department was through there was a program for internship in the last regime, in the last county government regime. And their contract, the internship contract was for a year. When it lapsed, some of the people, some of the members who are in that program opted to stay behind to probably get more experience, get mentored, and mainly because of their being residents of this town. So they stay here, and at that time, where the wisdom of the people in the department agreed to continue mentoring them. That is why the name volunteer came in. She worked at the front desk, assisting as a secretary. At that time, the Department of Public Works did not have a secretary. As you have rightly said, the one that was there before had retired. When we came in 2023, we had a discussion with a CEC member on the reorganization of the department, and we saw it fit because a receptionist or a secretary handles sensitive documents and also does a lot of communications, that we get someone who is within the county. And we got one, Betty Sergon, who is actually a senior administrative officer, to come into the department and to take up that role. So from 2023, we've not been having anyone acting on that position. We have filled it substantively, and that is the position, Chair.
Is the lady still works with your office?
What has happened with Celestine is she went back to school last year, and I had a discussion with her, because part of the work of our department is to mentor and train staff in various fields, especially the technical staff. And she comes to the office once in a while to assist, to get experience. Betty is helping her, especially now that she's also doing exams in secretarial. So that's why we have allowed her to come to the office. But we have not in any way encumbered her to stay with us. She is always at liberty, and any other person who has come in through training, and we have so many attaches chair from our local polytechnics who come when they finish. And since we don't have an internship policy, sometimes some come to us and ask just to, to stay on and get some experience so that they can be competitive when they are job openings. And also we can give them recommendations when they have applied for jobs elsewhere. So I cannot deny that she comes to the office once in a while, but at the moment she's in school here in Cabernet.
CEO, as the accounting officer, do you see how painful it is in Baringo? How you keep a lady for 4 years? Does she earn anything from that office?
No, we don't have any kitty or any budget to pay.
Members, let me allow you, if you want to ventilate on that issue, I would want members to make their comments so that we proceed to close that matter. And those are the painful moments that Baringo has really inflicted on people knowingly. Like the way you're just talking about that lady very casually, that she just comes in and goes. How do you allow somebody to come to your office, to come at your office when she feel like coming? And she's been there since 2022. Members, proceed.
Chair,
Sorry, Honorable Sharon, proceed.
Chair, I've heard the way the CEO, Timothy Kiborei, has explained to us, and I think, Chair, that is a really big issue, and I think it's time that we get to have the policy. And also, I'm just wondering, we might need to really look at that thing, because no one is supposed to be on volunteerism for more than 12 months. It doesn't make sense at all. Probably we could just go back and check that particular issue, because he has given a very good explanation. But again, I was wondering, when you are bringing in the lady Betty, you said Betty, you didn't think it was prudent, now that this lady had been volunteering and working with you and with experience, the CEC, don't you think it was prudent for you to have done probably a proposal to the service board to bring the lady on board now that she has been volunteering for a long time, so that she can earn a salary, probably even on contractual terms, now that she's been there for a minute?
Before Waziri proceeds, I want to make sure that members, you don't have any point on that issue, so that when he goes back to answer, we close that matter. Honorable Ayengwa.
Thank you, Madam Chair. This issue of volunteers, Madam Chair, is actually it is a two-way. It's a double-edged sword, Madam Chair. When somebody, because once I had a plan operator on attachment, and then after completing his attachment, he requested to continue getting more experience, Madam Chair. It took long. I think it is something like the way my colleague Honorable Sharon has said, that we really need a policy so that the departments do not look like they are taking advantage over the volunteers, Madam Chair. And at the same time also, we also want the departments to put on a human face so that actually, at a given time, they should be able to guide, discontinue, or actually pay them even some stipend, Madam Chair. I think it is good that it is high time that we relook onto volunteers, more so, even if they are getting experience, but we should have a time limit. And at the same time also, we should not have others getting in and be paid when the same volunteer is still rendering what? Service. So I think it is cutting across all the departments, Madam Chair. Thank you.
Waziri, proceed.
Thank you, Madam Chair. I really thank the members for the in-depth thoughts about these people. And I want to extend an invite to honorable members that we need to bring our heads together, because these are all our people, these are all our children, so that we put in legislation, as the honorable member, Madam Chair, has mentioned, that we need to have policies so that we see how, when we have these volunteers, can be absorbed into the system. And I really agree that such a policy is long overdue. We initially had volunteers, interns. That is when these volunteers started coming in. And Madam Chair, I would want to make a clear indication that a volunteer is not somebody that we are forcing to come to the office. A volunteer is somebody who is saying, I want to be attached, or can you give me something I do? I get experience as I look forward, probably in the short term or in the long term, I may get an opportunity to work with you or to go somewhere and get employment. Madam Chair, the honorable member, Sharon, mentioned that why bring another person instead of just absorbing that one. I would like to clarify that the lady in question that came from another department. It's not somebody we hired. We made our intents that we are short of staff, and a very long list we gave out. We have budget constraints and stuff like that. So when we really requested that we needed support to public works, public works cuts across all the departments, then we were given, Betty was reassigned duties to public works.
Honorable Sharon has a point of information, but you allow Waziri to finish so that you can bring the information.
So she came in from another department. We've made policies as head of the department. I came in, we've regulated some of the things that were happening. Like the honorable member said, some volunteers come, they want to be plant operators and stuff like that. But we've made it very clear, our policy, our machinery can only be operated by qualified individuals who are either on contract or are fully employed by the county. So we are doing these policies, and we are polishing day by day, and we invite such views so that we can help each other and govern this county and help these people in good faith. Thank you.
Honorable Sharon, as you proceed, Waziri, I think this is the department that has really done good on the machinery. They have people who are on contracts. Unlike the other departments who've come here, volunteers do the driving of our machines. Honorable Sharon, proceed. And then after Honorable Sharon, Honorable Cialo, you take up to proceed with your questions and any point. Okay.
Engineer Lekonaya, For someone to work as an engineer, do you require to be a member of a board?
Correct.
Correct?
There are different levels of.
Okay, among the engineers here, do you require to be a member of a board?
Correct, yes.
All right, so now I proceed to ask my question to one that is acting as our county engineer. What did you say your name is?
John Kiborei.
John Kiborei. Are you a member of the board?
No, I'm not.
Engineer Dekonaya, who appointed him to be our county engineer?
It's not an appointment per se.
Okay.
It is a position because, as I said, and I mentioned several times, and if you are keen and if you're listening, that I've said.
Lekonaya, I'm very keen and I'm listening. Please don't accuse me of having a deaf ear.
No, I'm not.
So my question is that you've stated that just now,
yes,
that among all of you here, including somebody who is acting as our county engineer, must be a member of the board and is acting in that position. My question to you is that, do you think that is exempted from being a member of that board? That is a yes or no answer. That is no, is not exempted. So all the BQs, who signs these documents? Who signs them?
Chair, I'll make this clarification so that we are.
No, just allow me to lead the questions, kindly, Honorable Lekonaya. And you know I have so much respect for you. I don't want us to. So, who signs the BQs?
Chair, I'd request for your protection.
There is no protection when you're being answered.
Honorable Sharon,
I think this is not
Waziri, don't be mischievous. Just answer questions. You are an engineer, and I want to applaud you. You're up to date on your board, and you're the boss. So please proceed to answer the questions from Honorable Sharon.
We have 7 engineers, all of them diploma holders. We are only 2 registered engineers.
All of them, including the acting
yes,
county engineer.
Yes. And if my explanation was allowed to go in, I'd probably shed more light.
We'll get there.
We will allow those to come at the end. Just allow Honorable Sharon to finish, and then you can.
Who signs our BQs?
The BQs are signed. The final signature is the chief officer.
Is the chief officer?
Yes.
So who collects the data?
The engineers.
The engineers. Does that include the acting engineer?
Correct.
My question is that, now that he's holding that position, is there any explanation on this planet that can make him act as an engineer without a license? With all the explanations that you want to give, you have 2 degree holders, the members of probably the board, and then the rest of them, they are not qualified. Can that still make him exempted from being a member of a board?
It is not a requirement. The position is holding.
You remember you've just answered 2 minutes ago that it's a requirement.
Can I respond?
2 minutes ago, when you start to justify that, you'll be lying to us and trying to defend yourself on issues that cannot be defended. Issues of qualifications.
The position of an engineer at the level of engineers I have, those who collect data, there's no requirement that they must
and
be
him,
registered.
as the acting engineer?
There's no requirement.
There's no requirement.
Yes.
Can you stand by that? Even the ESCC when they come here? The ESCC when they come here?
Yes.
Can you stand by that?
Okay, I'll stand by that.
Why is it that you're having somebody who is not an engineer, acting engineer? Why do you have somebody who is an acting engineer who is not an engineer per se?
Honorable Sharon, probably maybe we'll ask him what are the qualifications of a county engineer?
Yes.
If it was supposed to be advertised. And on that note, allow Honorable Sialo to say something about it.
Thank you.
Thank you, Madam Chair. I think everything is clear. Probably the reason why the engineer is acting and is not a substantive engineer could be the reason that he's not registered. So I think that one is clear.
Honorable Sialo, you are out of order.
No, let's be.
You are out of
Madam
order,
Chair, you must be
Honorable
objective on what you
Sialo. Honorable Sialo, you are out of order. Honorable Sharon, proceed as we move to Honorable Waziri.
My question is that what are the qualifications of a county engineer?
Point of clarification, Madam Chair. In our onogram, we don't have county engineer. To be clear, is acting as superintendent engineer, county engineer. Number two, Madam Chair, the thing that is there is that why we have him acting is when I came in, we do not have a substantive engineer in the office. And we recently recruited. I'm not sure, I'll allow my chief to clarify, they are still on probation. And for continuity, we could not hold the office still until they finish their probation. They are up to speed and in the processes, the government processes. So I'll not want to give so much information to dwell on that. It's not one of the questions that you had sent to us.
Lekonaya,
I need to prepare for that.
Let me read to you a qualification of according to what I've gotten and what is right. A county engineer must be a person who has a degree, a bachelor's degree in civil engineering or equivalent qualification from a university recognized in Kenya. Isn't that okay? Isn't that true? Registration with the Engineers Registration Board of Kenya, ERB, as a professional engineer. A current valid annual practicing license issued by ERB. Corporate membership with the Institution of Engineers, and so on and so forth. That is the qualification. You've stated that you've recruited one recently?
Three.
Yeah?
Three.
How long have they been acting on probation?
I'll allow my chief to answer that. And FYI, for your information, I've put all of them on program to be registered. The ones, when I checked, I came to office,
okay.
And all of them are in the process of registration and getting those registration with those professionals.
How long have you been in the office?
3 months, 3 years.
3 years, so you're still in the process. 3 years down the line, you're still in the process of putting them as registered engineers.
Madam Chair, registration to be a registered engineer in Kenya takes more than 1 year.
How many years have you been in office?
Can I answer, please?
3 months, 3 years.
Can I answer, please?
Yes.
The registration.
Honorable Sharon, let's allow Waziri to give you an illustration of what should be happening on that point of county engineer, so that we close on that matter. And I think, Honorable Waziri, you had said you want to give a picture of that issue, and I think it's an issue that is it's a serious issue, Honorable Sharon, and let's allow him to give us a true picture of that issue. Or I can see your CEO is up, want to say something?
Yes, I'll mention something and then I'll give the CEO to proceed on that response. Is that we recruited 3 engineers and they're in the process of registration. And registration is a personal initiative to be registered as an engineer. And I'm grateful the honorable member is a lawyer, and I'm sure she initiated a pupillage training or process. I am not so sure if it was by the officials or if it is because she's been recruited or she's in the position she is in. So it's a process and it is personal initiative. But mine, as a policymaker and as head of department, it is just to encourage and tell the staff, take these courses and register as these position and this one. We have only one registered engineer, of whom we recently seconded or requested us. She works across the two departments, that is public works, roads, urban planning, lands, and urban development.
Okay.
So that is
the CEO.
That is an engineer now we've put in, and we are putting, these people are just new in the office.
Okay.
And we are putting them through the process.
And
for that office to have been able to operate, we needed somebody who has been in the office to act in a position.
According to your understanding as a policy maker,
yes,
somebody who is acting, don't you think he must have and hold a position of a substantive person?
I'll allow my chief to
No,
answer.
just answer. You're the policy, you're the head.
I'll ask my technical team to assist.
The CEO, Kosgei, kindly proceed. Okay.
Thank you, Chair. I think to just add on what Waziri said, when we came in, we appreciated the shortage on the side of the technical staff across most departments in the county government, which the Department of Roads, we were seriously understaffed. And that time, we are still understaffed. And that time, we really forced, because we had budget constraints, and we employed three engineers, which we employed last year. And when we raised the indents and the advertisements, it is very worrying to know that even those who applied, we could not get a registered engineer. And that is what's happening in the country. And we advertised it widely. So the few we caught them, like Waziri said, it's a personal initiative, but we push them. We tell them kindly, because it is a process. And within the Engineers Board of Kenya, there are some requirements that should be met for one to be a registered engineer. And within that pool of engineers, pool of the technical people within our department, we were short of graduate engineers. And we had to take personal initiative as the senior team here to even invite to assist the board to make wide publicity so they can apply for these positions. So you also understand what the department had undergone in the past 2 years, what we had. It is as a result of those gaps, staffing gaps, and the technical shortfalls. But for the last 2 years, we have improved.
Through the chair.
We are in the process.
Through the chair, can I
allow him to finish?
Let me just finish.
I feel like we are not going direct to the issue.
Let me go direct now. These three engineers, they have been in probation.
How long?
They are waiting for confirmation letters from the board so that we can engage them. We can seriously engage them substantively in our
As per now, the three engineers are working as
the
casual workers, contracted.
I wanted to say
the PNP.
They are staff under probation, and they are waiting for confirmation letters to permanent and pensionable terms. And our staff establishment.
Kindly, Honorable Sharon, kindly CEO produce those documents that you're saying they're on probation, and the one to the service board through your CEC, and so that you're able to know exactly what that means. And the CEC, let me make this make it simple. You've known what an acting engineer should be. So probably Kiborei is acting because he's been there at the department, and probably he's the one who is in charge. But we do as per the law.
Chair, allow me to just state something that will guide us and take
Okay,
us
Honorable Sharon, and please let's.
And I'm very specific. Kosgei, these people that you're calling, they're what again? Probation employees.
Waziri, you had your time. It's time for your CEO.
These are staff of the county government.
They are brought in as.
They are staff of the county government. They are employees of the county government.
Yes, they are brought in.
They are in different cadres.
Which ones?
And we have assistant engineer.
I'm asking, are they coming as permanent and pensionable?
Yes, after a certain period.
So, when we all understand how people come into office, you advertise the job, they came in, right? Maybe as an engineer, and they came in now, they're supposed to go on probation for how many months?
For 6 months.
For 6 months. How long have they been in office right now?
They are past the 6 months.
Past 6 months.
Yes.
What is stopping them from assuming the office of the engineer?
I have written to the board to confirm them.
Okay.
Because they have completed the probation period.
So we are still having letters pending at the Public Service Board?
We are waiting for their confirmation letters.
Okay. And what stops somebody who is on probation from taking the position that he or she has been...
Chair.
Can I finish the question? What has stopped these engineers from taking up a position that we have somebody who is not qualified to act, to take the position? What has stopped that person to take the position even if the person is in probation?
Chair, we have this position of county engineer, and from time to time we revise our staff establishments and our structure of the departments. And when we check the latest restructuring of the staff establishment, the position of the county engineer has been abolished. And there is a new structure now that we've revised our staff establishment in the last financial year that guides us. That's why we want to bring these 3 who we had employed.
These 2 establishments started which year?
We revise after every 3 years.
So it was revised?
Yes, recently.
Honestly, Chair, you can see where we are. It's just people trying to circumvent issues. And let me just make my submissions. There's nothing that stops the CEO and even the Public Service Board to have somebody who is on probation to take up that position. Let's say that position of the acting engineer. And there is nothing under the law that can justify, just because that can make an acting person not to justify non-qualification of that person. Like, for example, the person who is acting as our engineer, just because he's acting, you cannot just get anybody. We must have somebody who is actually qualified for that person to even act is for that position. And let's just close that case. We can go around in circles, but will not make him qualified.
Honorable Lekakimon, proceed with your questions.
Yeah, thank you, Madam Chair. I think I asked the first question on the wages of the casuals, that they stayed long time before they are paid, but the department said they are paid, but this committee received complaints that most of those plant operators have not received their salary or their wages for 7 months. Waziri, you are saying you have paid them?
Waziri, proceed.
Yes, I indicated that all our payments are up to date. However, I invite the honorable member, if he has any information of whoever is complaining, to furnish us with that information so that we can follow it up. So, one thing that I am sure probably you should mention, that those who are recently recruited maybe have not received their pays, but I'm made to understand by the CEO that it is up to date. So
it is up to date.
Yes, it's up to date. If you have information or when these payments are due, for which period, please furnish us with that information so that we can act on it.
Yeah, the second question, you have something to add to CEO?
I wanted to answer.
CEO Kosgei, please proceed.
Okay, I wanted to answer Member Honorable Kakimona that among our list, the 41, there are some staff who were engaged late last year by the board, through the board, especially from Baringo South. And the delay in payment was as a result of the processes of getting them into payroll, which took some time, up to I think 4 months. But as of last week, all their dues had been paid, And unless on somebody who has wrong or missing account number, but all of them have been paid their dues for the last 6 months. Thank you.
So thank you. I have the second question. We have seen your list of all the contractual employees, especially the operators, plant operator, and the drivers. Are they entitled to lunches, lunch allowances? If yes, how promptly do you pay them?
Waziri?
Once you are on payroll, that is your dues, and lunches and anything else outside that payroll, maybe when you are on DSAs. Thank you.
No, I'm talking of lunch allowances. Are they paid lunch allowances to these plant operators?
No.
Or the drivers?
No.
They are not paid.
It's what you are entitled to, you get through your payslip. They are not entitled to that unless you are on DSA. Thank you, Madam Chair.
CEO.
CEO Kosgei?
Chair, maybe I can add, it is true what Waziri is saying, but you see most of our plant operators, the machines are all over. And the policy of the government is saying beyond 40 kilometers from your workstation, you should get some DSA or night out allowance. But what happens with our plant operators, when we send an operator, for example, to Barwesa from Gabarnet, it is beyond 40 kilometers, or to Mogotio, Kisanana. What happens is that we've pushed for these allowances, for especially plant operators, to be in form of extraneous allowance so that they can come with their payslip. But all the efforts that we've pushed for the last 2 years, the SRC are saying it cannot work that way. And what we normally do, we encourage them to settle where the machines and where the work plan falls within a certain period so that we minimize on those. They are really suffering. And we agree to what Kakimon is saying. But it is an SRC and an HR issue. Thank you.
I think as a department, you all know what kind of work these people do. And for them to be effective, you should also design a way of motivating them. Because if you don't give them these lunges or some stupid to motivate them to do the work, they may not work. We are on the ground, Waziri. Most of these plant operators report to job at noon, and they work for 2 hours. So the work that is allocated to do, there are complaints that they are not given lunches, they are not given anything. How do they work on those difficult situations if they are not given lunches and allowances, at least to make them work? So as a department, you should see what to do with those plant operators and the drivers. So I think I raise my question there, Madam Chair.
Thank you, Honorable Lekakimon. Honorable Sialo, can you take up your questions?
Thank you, Madam Chair. And before I proceed asking my questions, allow me to give an opinion about the acting engineer. I think as a committee, what we should have found out from the engineer and the CEC is whether this person is in office, formally acting in that position through a formal letter, or it is just verbally. But otherwise, in that...
Honorable Sialo, on that note, they can proceed to give you the answer because it's a valid question. Waziri, please proceed. And because you've opened the same question, Honorable Sialo, it will still generate some questions if we go to that direction. Because Honorable Sharon is still having some burning...
I stand guided.
Yes.
I just wanted
so I want you to
out
proceed, Engineer Kibor. Proceed to answer Honorable Sialo that question. I want him to answer. He's an engineer, and remember, he acts as the county engineer. So allow him also to speak.
Yes, I've got a letter.
So your drawings, allowances on that capacity? And for how long have you been acting in that capacity?
I've acted since 2023 November.
2023 November. So
Honorable Sialo, he has not answered the question. Does he draw the allowance that comes with the kitty of being acting?
No, I don't.
Honorable Sialo, proceed. If you have any other question concerning the same issue, so that
Thank you. Maybe to Waziri and the chief officer. I remember we had an employee, an engineer, who acted in the same, I think, capacity for about 13 years. So I want to ask, for how long is he going to be acting in that capacity? And is it allowed by law for someone to act more than a year in the same capacity?
Madam Chair, let me answer that one. As we indicated earlier on, we've recruited 3 engineers, and I think I'll summarize very quickly, including the honorable member, Madam Chair, that she was asking about this, how long should and why somebody cannot act. We are rotating these staff, and they're still new in the office, so they soon will be in their position, and all of them we have assigned their duties. Thank you.
Waziri, I'm not an engineer, but you're taking us into your own circles.
Okay,
if you appointed someone and you want them to act, why can't they just act? And they are qualified, so that when they are acting, they can be rotated. You cannot tell me they cannot act and do the job.
Madam Chair.
Waziri, you want to...
Okay, stand guided, Madam Chair. Let's proceed.
Thank you, Madam Chair. I have 2 questions. You talked about the volunteers that you have in the department, and there's another term that came in, the employees who are in industry attachment. So what is the process? How do you engage them? And for how long is one supposed to be a volunteer in an office? And do you engage them formally, or it is again verbally?
Waziri, through your guidance, I can see Timothy, the hand is up. So Waziri, proceed to answer, and if you still want to donate your time to the CEO, you proceed as well.
Okay. I think Madam Chair, allow me to be able to pick which one of my technical staff to assist on questions as they come.
Proceed, Waziri.
Yes, we have interns. Interns comes, they are on attachment for 3 months. Officially, yes, we engage them. Officially, depending on the scope of works. We have, at any given time, we have attachees attached to every engineer sub-county. So we take minimum so that we don't overstretch. We attach each sub-county engineer with 1 attachee for 3 months only.
How about the volunteer?
Volunteers, volunteer is a volunteer, so we don't really have a specification of how much one can volunteer. And as I said, we've limited, and I invited this house that as we regulate these policies, we bring our heads together so that we see and we come up with policies and regulations that legislates around how long we can have a volunteer.
So now you want to tell us you can have a volunteer as long as 10 years?
We are trying to avoid not have any volunteer in the offices.
And do they even come formally, or you again invite them verbally? The volunteers, I'm speaking about the volunteers.
We do not invite volunteers. Volunteer is volunteering by self.
Yes.
It's a self.
So someone comes into the department, handles the machineries, handles everything, the BQs and everything, as a volunteer. He's not there formally.
Madam Chair, I had shed light on that one before. I think the honorable member was not in. These volunteers occurred because earlier on we had interns. And then when the time lapsed, these people remained in office. And I agree. And I mentioned earlier on that we all need to bring our heads together. We see how we can handle these situations and legislations around this. We have tried, we've pushed off.
No, Waziri, just a minute, let me cut you short. I'm asking about this because for someone to be in a government office, handling government equipments and documents, and is not there formally, in an official way in that office, is really a risk. It is not a question of even a policy. But someone being in the office as a volunteer for 4 years, and he has no letter containing him in that department, is a risk. You are risking government equipments, you are risking government documents, and that one is not allowed, Madam Chair. So, Waziri, I think that one should not be the case. Even if you do not have a policy in place, I think.
Madam Chair, let that be a take home. We will respond that one appropriately at a given time because these people will phone in office. Can I be allowed to respond at a later stage to that question, please?
Thank you, Madam Chair.
Waziri, you know you're on record. And we cannot just allow you to answer questions at your own time. It has to be, you have to tell us at what point, because already you've told me you have three of them.
Yeah.
I'm not sure whether they are casuals. You've considered Celestine as one of the volunteers. And I would want to see that report about the casual and the volunteers, but probably maybe there are others in your department that you are not aware. Maybe your chief officers are aware. So please proceed to produce a documentation about the volunteers and the casuals. And number two, I would like to know, you said you have 2 engineers who are qualified. It's you and who?
Myself, and there's an engineer called Engineer Millie.
Engineer Millie.
Yes.
Thank you. And I will want to close this session, honorable members. And before I close, let me allow you, if you have a question, members on your side, I can see Honorable Sharon is up, and Honorable Sialo, and we have our Mr. Katejo.
Okay.
Kindly give us your full names and your responsibility in this department, so that we are able to know you as well. So Katejo, proceed.
My name is Daniel Gatejo. I'm a registered quantity surveyor, and principally assisting the Chief Officer Public Works. Thank you.
Honorable Sharon, proceed, and then Honorable Sialo, you take up so that we close this session.
Okay, I'll still go back to the acting county engineer. Now that you're a diploma holder, are you a member of the Kenya Engineering Technicians and Technologists Board?
No.
You're not a member. Are you supposed to be a member?
Yes.
Thank you. Let's go back to, I don't know, Geoffrey, you want to take up these questions, or Lekonaya, whoever would decide to take up this question. On Millie, the only engineer, you and Lekonaya. Lekonaya and Millie are the only engineers that we have, qualified engineers, according to engineer Lekonaya. This Millie Odhiambo, she came in, when you advertised this job, what was the position that she applied for?
Roads Superintendent.
And what is her current position?
The same position.
Waziri, as she proceed, she's supposed to be a member of the engineering board as well?
Yes, she is.
Okay, you will proceed to give us our details so that you're able to confirm that indeed she's a member.
Sure.
Okay. Honorable Sharon, please. Honorable Engineer, what prevents Millie from being our engineer now that she's duly qualified as an engineer?
Nothing. They were on probation, Madam Chair.
Are they still on probation?
Yes, because we have not received their confirmation from the Public Service Board. Yes, they are.
As a learned person, how long does the probation, when probation ends, what becomes of that employee?
Upon confirmation?
No, when it ends, according to the law, when the probation comes to an end, what becomes of that person?
Kindly guide me, I am not a lawyer.
Okay, when the probation comes to an end, that person becomes an employee. And it's the duty of the employer now to give that person there. Because how long have they been in this place as our employees and under probation? How long?
They've been close to a year now.
Close to a year. So, is there anything, when you've done your letters, have you gotten any response from the service board?
Nope.
As to why they've not been confirmed?
Not, we are waiting.
Do you have any letters that you forwarded and you asked for their confirmation?
Yes, and my chief said that earlier on.
Lekonaya, do you have the letters and can you produce them here?
Yes, and we asked, Madam Chair, we asked that we will produce the letters.
Honorable Sharon, I made a ruling that they will table those documents to this committee before the close of the day.
Before the close of the day. And Lekonaya, now that someone who is acting and is supervising a project and is acting in the position of an acting engineer, what becomes of any mistake that is done probably in the project that person handles and is not a qualified engineer?
Madam Chair, I did indicate that all these staff work hand in hand and we rotate through the departments. In fact, all approvals, all supervision works are assigned to individuals depending on their qualifications. And most of the time, all structural works that needs a registered engineer has been done by 3 newly hired engineers. So I did make it very clear that these people are on rotation and are practicing. It is not that just sitting in office waiting for the letters, they are working. They are attached to several projects. And Madam Chair, I did make an indication that the engineer in question has been seconded for World Bank program under Ministry of Lands.
Understood. Understood.
And
my question is, you've not answered my question, Lekonaya. I've asked, just in case somebody who is not an engineer and is supervising a project, what happens to that project?
Madam Chair, I can only answer these questions if I am allowed to answer.
You're going to answer my question as I ask Lekonaya.
Honorable Sharon and Waziri.
And if you don't want to answer my question,
allow me, Honorable Sharon, let's allow Waziri. I would want us to have a very clear of what she's asking. It's not part of the questions, but it's also important in this department. On this issue, I think we are going around the circle. To me, Honorable Waziri, it's wrong for Engineer Kiborei to be acting as the acting county engineer. And it's prudent that you correct this issue from today, because it's now out of it's now in the public domain. So please, Waziri, you're an engineer, a professional one, and even the questions that you're running away, it's clear that you know what you're supposed to be doing. Go back to your department and clean your house. Honorable Sharon, let's allow that point.
Let me just make one comment.
Okay.
And then I finish. Engineer Lekonaya is the head, the CCM of the roads department. The person who is acting as an engineer that is not even a registered member of Kenya Engineering Technicians and Technologies Board. He has said, and is the head, and he understands that if anything goes wrong and we lose public funds, it's because of his negligence and his failure is to show leadership in that place. Engineer Lekonaya, how can you have somebody who is acting as an engineer and is not even a member of a basic board called Kenya Engineering Technicians and Technologies Board, even though it's a personal decision? Remember, you're a leader. You're exposing the county. I can tell you for sure, even when I worked as an advocate, the people who I was working under and my bosses, they ensured by the time I'm going to court, I'm a registered member of law society, so that I don't expose my employer. So you're here just saying that it's a personal initiative, and you're the head. Remember, you're the head of that department. And lastly, there is no reason that Millie or Odhiambo cannot take up that position of an acting, of the county engineer. And if the establishment, if there is that establishment that has since abolished that particular position, and was there an advertisement that was made for someone to fill up that position in this county recently? No? Okay. So I end my submissions by saying that Lekonaya cannot run away from his role as a supervisor of that department. and he cannot expose this county by saying that it's up to them to do whatever they want to do, whether they want to be registered or not. They cannot expose. No wonder our roads are in the way they are.
Waziri, you can see it clearly that you've not taken responsibility, and at least it's fair enough that you brought on our board that you have 3 engineers who have been employed by our county. Please take charge, and in the next live, we don't meet you at the same point, allowing people who are not qualified to act, and you're not even, it's unfair for Engineer Kiborei that you are acting as the county engineer without even benefiting from that position. It's not even fair to him. So I will end there. Waziri, thank you for coming. Sergeant Atam, please work them out, because the issues that have been raised in this house, engineer, we will meet you in the next live. And you know what has happened with you in the earlier engagement in this house. It's only that we came maybe on the wrong hand, but now you're on the cross. Thank you. Proceed, Sergeant Atam, to work them out. Sergeant Atam, walk them in. CEC Health and Services and your team, welcome. I'm the chair, Jeruto Kiptala, to the ad hoc public service. My members, kindly proceed to introduce yourself.
Thank you, Madam Chair. My name is Max Yalo. I'm MCA Mogotio and a member of this committee.
Chair, I am Aingwa John, member of this committee.
Wesley Lekakimon, MCL James Ward, member of this committee.
My name is Sharon Keter. I'm a member of this committee.
We have our member of the House. Kindly introduce yourself.
Thank you, Chair. My name is Honorable Sitoi David, MCA Bartabwa, a friend of the committee.
Waziri, proceed to introduce yourself and your team. As the clerk, our Wakili, prepare yourself to help them take an oath.
Thank you, Chair. My name is Dr. Solomon Serma, the CEC Health Services, and I've come with my chief officers, the Director of Medical Services and the Medical Superintendent, BCRH, the Administrator. I would allow them to do self-introduction.
Thank you, Chair. My name is Evans Ruto, Chief Officer Public Health.
Thank you, Chair, and other honorable members. My name is Nancy Chesire, Chief Officer Medical Health Services. Thank you.
Thank you, Chair. I'm Dr. Joseph Kangor, Director of Medical Services, Baringo County.
My name is Dr. Gershom Abakalwa, Medical Superintendent of the County Referral Hospital, Baringo.
Chair, my name is Michael Rotich, Administrator, PCRH.
Wakili, proceed.
I, Dr. Solomon Serma, do solemnly swear that everything that I say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I, Evans Ruto, do solemnly swear that everything that I'll say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
Kindly hold your Bible with your right hand.
I, Nancy Chesire, do swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. Help me, God. Thank you.
I, Dr. Joseph Kangor, do solemnly swear that everything that I say before this committee shall be the truth, only the truth, nothing but the truth.
Can the God kindly be audible? Because you are on record.
I, Dr. Joseph Kangor, do solemnly swear that everything that I'll say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God.
I, Dr. Gershom Abakalwa, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth and nothing but the truth. So help me God. Thank you.
I, Michael Rotich, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God.
Waziri, proceed to tell us about your academic qualification and your work experience. And you tell us how many casual, contractual, and volunteers do you have in your department, including those working at the sub-counties, and also provide the list of those working in the health facilities in the county. Proceed, Waziri.
Okay, thank you, Chair. I'm a medical doctor by profession, and I've specialized in a field called obstetric and gynecology. My work experience is more than 25 years. And I've worked in various areas. I've worked as an intern at Kenyatta National Hospital. I worked as an MO at NTRH. I did masters in University of Nairobi. Thereafter, I've been a medical superintendent at Kapsabet District Hospital. And I've been a consultant and a head of department at Provincial General Hospital, Nakuru. I've been a director for 5 years at Nakuru County. I've been a chief officer in Nakuru County for medical services for 4 years. And currently, I'm the CEC Health, Baringo County. Okay, now, I have a list of summary of casuals. That is, we have level 4, which are 352. We have level 2 and 3, they are 378. And we have a total of 730 casuals in the health department. The list.
Proceed to table the list, Waziri.
So I want to table the list of all the 730 casuals which have their names, IDs, and somewhat the remuneration they get.
Honorable Sialo.
Thank you, Madam Chair. I think I wanted Waziri to categorize those casuals per sub-counties so that we can be able to make up, have a clear picture and even do a follow-up as per sub-counties, like Mogote sub-county, Eldama Ravine, and that is.
I have for Tier T, both East and West, we have 18 casuals.
Waziri, I think it's in order. If you're in your list, it's categorical. It's stated clearly. These are from Mogotio. These are from Tiati.
Yeah, it will.
Then you be on record as well that all of them are categorized. That
Yes.
Mogotio, Ravine.
For all the sub-counties, the 6 sub-counties.
Okay, proceed to say how many are there in Mogotio.
Okay. Koibatek, which is Eldama Ravine. Okay. And although they have not enumerated for Koibatek, but according to my count, I'm getting around 54. And Baringo North, you know, these are for both the hospital and the health centers and the dispensaries. Baringo North is 24. No, sorry, it's Baringo North is 72. Tiati West, 27. Marigat, which is Baringo South, is 31. Mogotio are 36. We have Eldama Ravine Sub-County Hospital. We have 58. And then we have a list of Mogotio sub-county rural health facilities, 65. Baringo Central. This Baringo Central sub-county, we have 53. And then we have Baringo County Referral Hospital. We have 193. And we have, at BCRH, we have 28 volunteers.
Waziri,
sorry,
let me allow you.
Point of correction.
Okay.
For sub-county of Koibatek, the first level 2 and 3 are 56, not 54.
Waziri, let me allow you to table the document as it is. Okay. Then we'll go to the details later. Honorable Sialo, proceed to ask your questions.
Thank you, Madam Chair. Waziri and your team, we would like to know the total budget that is used to pay the casuals, both the contractual, volunteers, and the volunteers I mean in the department. What is the budget that you have for the payment of this stuff? That is my first question. Second question is, what is your role in the engagement of these CEC, engagement of these casuals and volunteers as a CEC? And even the contractual staff, what is your role as a CEC? Is it your role to engage the CECs engage the volunteers and casual and contractual staff as a CEC? Is it your role? I think you can answer the 3 or 4 questions, then I'll come with additional questions.
And before you proceed, Waziri, this document is not signed. It's not stamped anywhere. Please do the necessary as you proceed to answer your questions.
Waziri, I think you can respond. Those ones you can sign up when other questions will be proceeding. So proceed with responding the 3 questions from Honorable Shalo. Honorable Shalo, do you have any additional?
Yes, but I wanted him to answer the few so that we don't probably confuse.
Okay, proceed, Waziri.
About the budget, I think the available budget is now for BCRH alone, but I would like my 2 chief officers, the one of public health for the health centers and dispensaries, and the chief officer medical services for the level 4 hospitals.
Thank you, Waziri. Thank you, Chair. From the list you just tabled, we have an average of 730 casuals. And the average pay for casuals is between roughly around 10,000. So if you do the math, 730 times 10 is around it's an average figure. So 730 times 10,000 per casuals. Which is coming to around 7.3 million for both the sub-county hospitals and the level 2 and the level 3. Thank you.
Maybe through the chair, chief officer, you want to say all the casuals are paid flat rate of 10,000. For you to arrive at that figure, you want to tell us, is it flat rate? Are they all paid 10,000?
Thank you. Through the chair, that is just an average figure. There are some who are paid more, there are some who are paid less. Because most of them are contracted or need-based. Like, for example, like groundsmen who do the maybe clearing of or slashing the facility. They normally come on need-based. So it can, I'm just doing an average figure. Thank you.
Chair, I think I'm really disappointed with this department because we've asked them, we need to know the number of casuals per either the sub-county and the level 4 hospital that we have across. But you have not that data. We've given you enough time, you had the entire week to provide the data. We're asking you about the budget that you have for these casuals. You are not even aware. You're giving us a flat rate of 10,000, which is not the truth. And this is the kind of the information that we wanted so that it can inform this committee whether you are doing the right thing or not.
I think there's some clarification here.
I think Waziri, what Honorable Shallow is saying, he wants to get some clarification on how you arrived on the 10,000 average. And therefore, you need to convince the committee that this is the reason why we arrived on the 10,000. Alternatively, you can give per cadre, because you have nurses, you have those working as security. Those work, you can of course break down so that, because these are issues about monetary and it is a motive issue. Therefore, the people of Baringo are watching and they want to see exactly how much are we spending on casuals in all our level 4 and our dispensaries. Therefore, I think Honorable Shallow is very clear. He wants some figures, yes, and how you arrived on those figures.
Absolutely, figures.
Thank you. Wazir, I think you are now guided on what the member wants and the committee wants.
That would guide us, through the chair, will guide us to know the Department of Health, the casuals that are being engaged through the Department of Health, the ones who are working under the clinics and dispensaries, we will get to know their budget and probably their number. And then those who are working under the sub-county hospitals, we will have to know the budget. So that one, it is not even the matter of convincing. We just need figures and it will be clear for us. Just numbers, yeah.
I think
Waziri, you may proceed. May proceed.
Before the end of this session, I think we'll be able to get the total numbers or the amounts once it is tabulated, because we have the figures, but we have not done the total. And what the chief officer was talking about was the total number of casuals in both level 4 and level 2 and 3, which is 730. But for the level 2 and 3, there are 378 casuals. And they are paid according whether it's a technical office, technical staff, there is a watchman and a cleaner. There are 2 categories in level 2 and 3. The figures that we'll have exact is from BCRH, but before the end of this session, we'll be able to get for all the level 4 hospitals because we have the figures. It's only that we have not given the total numbers.
Through the chair, I think, CEC Sirma, you know, our casuals have not been paid for so long.
Yeah.
And that is why we are here. We are trying to find out what is the reason behind this. As an hospital, you collect revenue. And before you pay these casuals, as a chief officer, definitely you know, every month for my casuals in my department, this is the amount I'm paying. But unfortunately, you have no idea, as the chief officer, public health and medical services, you have no idea of the amount you're paying, the budget you're paying these casuals. Who knows, out of these 730, we could be having ghost casuals. And that could be the reason why you do not want to disclose the budget that you have in every department. So, Madam Chair, I think we need your guidance on this, because this is a risk. There's a suspicion there, probably. We have casual workers who are being paid and we are not aware. So unless that information reaches our desk, I think we will treat that as a...
Honorable Local, let's proceed.
Chair, I think when you are away, there is this issue of how much are the casual paid. Their total number, of course, the CEO and the CEC are on top of the issues. They should be able to tell the committee how much are they paying per month, because these are money from the county coffers, and we must get exact figures so that we cannot assume that we are paying 7.3 million per month. Yet, if we go deep and get some figures, we may get even more than that 7.3 or less. Who knows? Therefore, Madam Chair, I think the committee must substantiate to this committee, the CEC and his team, substantiate to this committee so that the members of the public and this committee should be able to be convinced on the amount vis-a-vis the number of casuals they are being paid. That 730 are many people. Then we want to get some figures, in fact, clear figures. Clear figures. Thank you, Madam Chair.
I think on that point, it's in order, Waziri, we can give you time. You do a comprehensive report about that. And how long are you going to take? So that you may bring the issues about the number of casual workers, how many are they being paid, and probably on the issue of Honorable Sialo, that you categorize them under their own hospital. Like if it's Mogotio, it's Mogotio only. When it's an health center somewhere, it's as it is. Proceed, Waziri.
No, I'm sure you will be able to give the response before the close of the day today by 5.
Noted, Waziri. Proceed, Sialo.
The other question, Honorable Ciel, was asked whether I have a role in the recruitment of casuals. What I'll say is that I have got no role as a CEC in the recruitment of casuals. Casuals are recruited at the facility level, and there is a procedure that is followed by the in-charges in recruiting casuals.
Okay, Dr. Sirma, you want to say in the department where you work, you do not have casuals. All the casuals are based at either the sub-county hospital or the dispensaries.
You know, we have only, you know, in our offices, I can't really say that these are staff that I met and they are still there and I have no role.
They are casuals in your office?
Maybe 1 or 2.
Waziri, you're not sure of your staff in the office?
No, I've been confirmed. We have got no casuals.
Really?
At the office.
Okay, whose responsibility is it to engage, to employ these casuals at the hospital level?
At the hospital level, it is the, you know, we have, in level 4, we have board members of the hospital. Those are the ones who usually engage these casuals. And at the facility, level 2 and 3, we have health facility management committee who do the recruitment.
Okay.
On the issue, Honorable Sialo, of casuals, are you aware of 2 casuals from PCRH who are at your office?
Casuals. You know, those ones, unless they were seconded, but they belong to BCRH.
But the point is they are casuals and they're in your office.
I know of an accountant who is a casual paid by BCRH.
And they are working in your office or BCRH?
They work at the accounts department.
At the PCRH?
One is at BCRH and one is at our office.
Honorable Sialo, proceed.
Thank you, Wazir. You've said you have no role in the employment of those the casuals, and you've stated how they are being engaged.
Yes.
Recently, when
Yes,
we visited our BCRH, we found the MedSup, Dr. Wabakalwa, and we noticed that there were some strangers in the hospital.
Strangers?
Yes. But if I may quote the medicine, because he was on leave for about a month or so, and when he came, he realized that there were new casuals who were strangers to him. And when he asked him, whom do you think is responsible, he was like, I don't know, because he has not received any communication on the engagement of those new casuals, but they were already at work. So that means it was not the board, because we investigated and we realized that the board had not sat. So it was either Wabakalo himself or the admin who is before us this afternoon. So the admin can even shed more light that who brought them on board and on whose instructions were they engaged. And did we have budget for the strangers in the hospital?
I think the BCRH or the administrator. Yes. I think you should shed more light on it.
Mr. Rotich, proceed.
Thank you, Chair. I did mention that the strangers which were mentioned, there were 4, and these were purely people who came to volunteer. They were not engaged by the hospital.
Are you sure?
Yes.
Admin?
Yes, I'm very sure.
So they came acting through your office?
They came as volunteers. They were not. They have not been engaged. Yes.
Do you have
they were
formal
not
letters? Do you have
yes, the
formal
letters are there.
For the 4?
Yes, the letters are there.
Can you table before this honorable house?
They are in the office. It can be tabled.
Through the chairman,
day.
if we can table the letters by end of day today, I think we will be comfortable with that.
I think, admin, you'd also be specific that there are 4 volunteers and they were engaged by who?
Yes, they were nurses. There was a requirement because some nurses left.
Mr. Rotich,
Yes.
I've just asked a question. Who
Yes.
engaged them?
They were engaged by the Department of Nursing because there was a shortage. There was a clearing shortage.
Who specifically?
The matron.
Okay, Honorable Sialo, proceed.
So, Mr. Rotich, you want to tell us the matron has powers to engage casuals at his own wish and volition?
When those ones who were there, honorable member, left, there was a vacuum in the specific department, so there was need to put people to cover for that period when there was work must continue. And especially a place like maternity, if one officer leaves, then we get exposed if there is no replacement.
So you did not consult, she did not consult as a matron, she did not consult you?
We consulted those who were present at the time of work. We consulted, and we saw there was need.
Did you inform the MEDSUP of that action and the consultation?
The MEDSUP was on leave.
Yes, even if he's on leave, you are supposed to consult.
We normally meet every month, and a meeting was coming up, and he was going to be well briefed. There was a report which had been done, so he was going to be well briefed because we review these casuals every month. So we were to have a meeting.
Okay, let me cut you short a bit. Cherotich, you heard Waziri say, it is the board that does the recruitment. Did you even engage the board yourself, the chair? Or you just consulted with your matron and you ended up employing these people?
Every time, honorable member, we had a meeting and we shared with the board that there is a very big shortage. And the board was aware that the shortage is there of both nurses, of medical doctors, and the board was kind enough to say if you see the decision that you make, they will stand by it.
Let me ask you, Cherotich, as an admin.
Yes.
Do you have the board's resolution giving you instructions to hire?
We have the minutes. We have the minutes to that effect.
When was the last board meeting of the BCRH?
It was in April. April, I think. Yeah.
April. And when did the medsup went for leave?
We had a meeting shortly before we left for leave.
So through the chair,
we had a board meeting.
Through the chair.
We had a board meeting in Jeptebo. It should have been the first week of April, and then he left for leave.
Through the chair, I think the admin should table the minutes and the resolution of the board giving you instructions to employ those nurses. But if we don't find them, then that means you'll be in trouble. And if I may ask you again, admin, for how long have you been the administrator of the BCRH?
1.5 years.
1.5 years.
But I was there also for 2 years. So it is in total is 3.5 years.
What was your previous work before joining the hospital as an admin?
I was the municipal manager.
Municipal manager?
Yes.
So you moved from being a municipal manager to the administrator of the hospital?
Yes.
You went there formally or it was verbally?
It was done officially.
Officially, you have all the letters?
Of course.
So kindly table them. And finally, do you think you're suitable to be the admin of a BCRH hospital?
Very.
Having no experience elsewhere as a hospital administrator, you've just been taken from a municipal to being an admin of a serious hospital in Baringo, BCRH Baringo, as an admin.
I have been in management, Honorable Chair, in various capacities, both in national government and in county government. So I have the requisite qualifications to be a manager.
Honorable Sial, on that note, Mr. Rotich, since you've noted that you're in national government, which department were you then?
I was in Trade, Minister of Trade.
Thank you. And Waziri, I would like to know, before engaging any casual or volunteer, what is the procedure at the PCRH? Because noting enough that a matron can just wake up one morning and just call people to volunteer in a very serious hospital like that, and there are only 4.
The procedure is there should be a request, a formal request from the heads of department that they need of a particular healthcare worker, and that one is usually presented at the hospital management team meetings.
Who are these management team?
They are heads of departments.
Yes.
Of the hospitals. From nurse, the head of biochemistry, the head of dental, head of lab, and so forth. And then when they meet, before they request, there should be a budget before recruiting. They should demonstrate that there is a budget, and that one is presented to the board during the board meeting. If it is agreed that there is a budget, they usually write to the chief officer requesting to recruit an healthcare worker. From there, the chief officer will seek permission from a county secretary and head of public service, requesting the county public service board to give an approval for engagement. Once they give the approval, then they engage. Thank you.
Honorable Sialo.
Thank you. Waziri, you've heard what your staff, who is the admin of the hospital, said. Do you think, in your opinion, do you think that was right for him just to sit with the matron and decide to engage those nurses? Though he's calling them casuals, but they are nurses. Do you think it was right?
He's calling them volunteers, not even casuals.
Yes.
But I've said of the procedure, if that procedure was not followed, that is not right.
Okay. Admin, how many casuals do you have in BCRH? Sorry?
193.
193.
Yes.
When was the last date you engaged casuals?
Should be April.
April. After the board sat and gave you the approval?
Yes.
Okay. Waziri, I know you're aware that these casuals have not been paid for long. Why is it that they've not been paying for all that period of time? Was it the issue of a budget?
Yes, usually it's the issue of the budget. You see, when you talk of casuals at the level 2 and 3, where the budget comes from are two areas. There is the Danida Fund from the Dutch government, where they usually allocate funds to a facility according to their workload. And there is the monies from the county government, which is called the foregone use fee. That is usually given to a facility. And there is funds that is called counter matching. When they need, like for example, this financial year, this will be their last engagement, they'll be contributing 40%, the need funds, and the county government contributes 60%. These monies is usually for operation and maintenance of that facility. And at times, it do delays in the disbursement.
I need some more clarification. These donor funds that we get, the Danida funds and what have you, I think they come to the county with specific specific assignment.
Yes.
Not to pay casuals. Probably some are for the drugs, probably some of something else or equipment. But do we use the funds that we get from the donors to pay our casuals?
Yes, cumulatively. We don't buy drugs with them. It's for operation and maintenance.
Okay.
Yeah.
Now, Waziri,
small repairs.
Waziri, these casuals are very informed. I've heard what you've said. Yes, thank you. These casuals are very informed. We went through, round. They are aware of the FIF bill. And they said, we were told, as soon as the FIF bill is passed, we will get funds and the hospital will be paying us directly. But unfortunately, we've not been paid. And they were asking us, does it mean that you did not conclude passing the bill in the assembly? Now, we were told them, no, we cleared on it. Then it was clear that there was something in the department. So Waziri, I want you to explain to us, why is it that the FIF bill is not working? Why is it that BCRH have not received their funds and these are the sub-county hospital up to this moment?
To make it clear, initially there was no FIF for level 2 and 3. Services have always been free. But for level 4 and level 4, there has been a FIF even before devolution. Things were working well before devolution because counties' monies used to go directly to the account of that level 4, particular level 4 hospital, which was ring-fenced. But after devolution, all the county revenue money goes to the county revenue account fund. That is why we were advised to do an FIF Act so that money can go directly to that facility and it is used without being swept or swiped to the county revenue account.
Okay, Waziri, so that we don't take much time on that matter, why is it that the FIF is not working? Okay, we've known before devolution there were historical things that happened, but why is it not happening now?
The FIF Act,
why is it not working?
We passed it. It needs to be implemented, and the people who need to assist us is county treasury.
that they need to assist us to operationalize, because signatories of the FIF collection is at Treasury. Now, I've written to the CEC Treasury to assist us to operationalize FIF.
What was their response?
Good enough, he has appointed a committee to work on operationalization of the FIF Act. We are waiting for the regulations, how to go about it. We have it with us now.
Okay.
So I don't know, and the chair of operationalization is the Chief Officer Chief Officer Public Health. I think he should tell us how far he has gone.
Maybe, are you aware, Waziri and your team, that FIF is functioning in Mogotio? And why is it functioning in Mogotio? Not in Cabernet, especially BCRH, and these are the level 4 hospitals. And we want to let's be sincere. If you think that problem lies with the finance department, then you be sincere to us so that we can assist our people to get medication and drugs at the right time. Someone must take responsibility of this. So we want to know, is it you or the finance department? And if it is finance, who in particular can respond?
For Mogotio, you know, the account was opened much later than others. And the person usually does the swiping of funds from the hospital revenue account. There are 2 officers at Treasury who are in charge of that.
Mm-hmm.
Yeah.
Who and who?
One is a director, and the other one is somebody in charge of revenue.
Waziri, you know them. Just mention them. I think we say
There's Mr. Rerimoy and Siror.
Siror, Director Revenue.
Yeah.
So these are the people who should take responsibility.
I think they need instructions from the CEC Treasury.
Okay.
Yeah.
Madam Chair, Waziri, we have medical officers who've been going on study leave. Currently, how many of them are on study leave from our county? How many returned and offered services within the required period of time? And how many of them left? And what actions did you do against those who left without completing their probation period?
Okay, now the doctors are directly under the supervision of our Director of Medical Services. I think he has all that information. I think I want to give him the chance.
Before he proceeds, I think Honorable Sialo should get answers from the CEO, Ruto, so that we move on. And please, as you highlight, tell us when did the FIF bill become an act as you proceed.
Chair, again, something in addition.
Okay, Honorable Locales, can you do the addition?
When Mr. Ruto will be replying on the issues of FIF under the committee which has been formed, I want also him to shed light on his role that he has performed so far to ensure that all the level 4s hospital have a working FIF. And it is clocking to now 5 months after we passed this FIF bill. With all that 5 months, what was the difficulty of the Department of Health to operationalize the FIF funds? 5 months down the line, no operationalization. Thank you, Chair.
Proceed, CEO Ruto.
Thank you, Honorable Chair. You have asked me 2 questions. And the FIF was gazetted in February this year, 18th. I have a copy with me. And we needed to FIF Act. I also have with me here a copy of the regulations which is ready. And the reason as to why we could not operationalize the FIF then was it is because it was close to a mid-year of the financial year. And some contents of this FIF here, the FIF Act, needed
The
to
media
run
you are talking about
February.
is when? February.
Yes, needed to run through a complete financial year. So even in the regulations that we have come up with, we need to operationalize this FIF Act as from 1st of July, because some of the requirements as per the Act is that we needed to.
And why is Mogotio operational?
The one for Mogotio is they are using the old, the National FIF Act. What we did as a county is that we have an hybrid FIF Act. We borrowed every from the national government that was passed by the National Assembly, but the one that we are operationalizing now as a county is an hybrid that we incorporated, you know.
So what will happen to Mogotio, which is operational on an old FIF?
They will have to use the new FIF Act because it's been passed, it's in law now, and we need to operationalize it from 1st of July.
So you want to tell me you're on the wrong that Mogotio is operational on a old FIF bill, and you're now saying the hybrid one is the one which is gazetted?
Honorable Chair, I think it is good to go on record that all our level 4 hospitals, the 7 sub-county hospitals, are using the FIF.
Madam Chair.
But Marigat is not, Marigat is not, the FIF bill is not working in Marigat. Be guided that we went round these hospitals. And when Honorable Sialo is making his submissions, they are factual. It's factual from the med subs from those hospitals. So as you made an illustration, be aware that we went there and we have their own submissions here and they are on record. CEO, proceed.
Interject. I think we have an officer who has worked there as a medical superintendent and is the one who opened our account. I think I want Dr. Kangor to shed more light why Mogotio is working and not the others.
Madam Chair, before Kangor probably comes in.
Proceed, Honorable Sialo.
I think from what the CEO has said, that Mogotio is using the F5, the national F5. So does it mean that the F5, the national F5 is not applicable to the other sub-counties, but it applies only particularly to Mogotio? You've said that F5 came mid-term. That's why the other sub-counties could not benefit. But I'm asking, is the national government F5 applicable to Mogotio alone and not on the other sub-county hospitals?
And Chair, so that the same question.
Proceed, Honorable Locales.
So that we can find out the same question, I just want to give an interjection that when it's half year, when it is mid-year, and funds are available in the accounts, was it a crime? Was it somewhere in the clauses that you should not spend this money when you are already a half year? Is there anywhere in that bill which prohibits the level 4 hospital using this money when it's already a half year? Money can be funded at any time, be it mid-year, be it early year, so long as by the close of financial year, you have done the balance of your accounts. What was the difficulty anyway? Was there such a clause so that you now are saying, no, we cannot use this money until 1st of July. This money, we will keep it there. We cannot touch it because the law says that. Maybe you tell us more about that bill, if it says like that.
Let me clarify. Apart from, I'll still give a chance to Kangor because for clarity purposes, and the issue of availability of funds in the whole dispensation before this FIF Act was enacted, we are usually given by Treasury a ceiling to spend up to 45. And since we came to the office, we have always surpassed the ceiling. So once you have reached the ceiling, if it is around, if we have, for example, 100 million, and we collect 20 million, we'll not be able to spend the 20 million unless maybe it is put in the supplementary budget, because we usually surpass our our ceiling. But with the enactment of this FIF Act, we shall be free. If we have collected up to 500 billion, nobody is going to give us a ceiling. Whether it is the end of the year or the beginning of the financial year.
So, Chair, which law now are you using? Are you using the old law that were giving you prohibition not to go beyond the ceiling, or you are using the new bill of FIF which was passed by this House, of course?
The old law, because we have not operationalized the new FIF Act.
CEO Ruto, I need you to finish your clarification about what you are being asked so that Kangor comes in to give us the issue of Mogotio.
Thank you, Honorable Chair. I said earlier, the act I have here with me, it was passed. It was passed in February 18th, and we formed a committee of which me and my colleague, the Chief Officer of Medical Services, are members, and we were working on the regulations, and the regulations are ready. And Honorable Chair, I think we will operationalize fully this FIF Act as from 1st of July. Thank you.
Proceed, Kangor.
Yeah, thank you, Honorable Chair. Allow me to comment on the FIF Act. We have two acts. We have the National FIF Act, which is Facility Improvement Fund, which has a limit. And actually it has never been repealed, so it's still on. And that's why some counties like Nakuru have been using that even before they passed their own Facility Improvement Financing Act, which is actually the one which was passed in Baringo County. So honestly speaking, the counties who actually continue with the National FIF Act, they are not the only customizing to suit the current dispensation. In terms of Mogotio Sub-County Hospital, that account has been on. It has never been. I actually found it on its own, and their funds have been coming through the same account, that is revenue. And for Mogotio, they have been lucky to be able to utilize the FIF funds to run the hospital activities, and it's been, to me, it's been a good example to the others. It's so unfortunate that hospitals like BCRH are not able to enjoy the privileges of actualizing the FIF Act, unlike Mogotio, which their funds come to the facility account and they're able to request for NAY and spend as per the FIF Act.
Honorable Sialo.
Through Madam Chair, I think for Mogotio case, we actually pushed for them to open that account. And that doesn't mean the other sub-counties are not able to open this account. So it is someone somewhere who did not want to do his work as required. Because I believe whatever we are enjoying in Mogotio should be enjoyed across the county. But because someone probably wants to be pushed around to do what is required to do, has brought all these problems. You can imagine what the BCRH Abakalo is going through. We have the reason why we are having several referrals in Cabernet is because they do not have access to the funds. So, Waziri, your department, yes.
Okay. Honorable Sialo, as you wind up, will allow Sharon to still inform you or about the issue of FIF probably.
We are done. We'll give him time, Madam Chair. There was this issue of the medics who've gone for study leave. You've not responded to that. And on that note, there's this issue of Dr. Chepchieng, who went to Uganda for studies, and he was released by the Chief Officer, then Chief Officer Bore, to go study. Unfortunately, you've recalled him at a point that he's spent his money paying school fees and is midway studying, and you are again recalling him to come back. Is that really fair? And in that case, who is supposed to give out this study leave? Is it the chief officer, or the med sup, or the county secretary, or even the board? What is the procedure of approving these medics who want to go for study leave? I mean, yeah.
Waziri?
Waziri?
First to answer about the medics who are on study leave, and then I'll give CEO Medical Services to answer the release of staff for further studies.
Through Honorable Chair, we actually have 18 doctors who are pursuing their specialization courses in various universities. And out of the 18, two of them, that is Dr. Lexon Kiborei and Dr. Intisa Said, were recalled, and they never responded, and actually they are on salary stoppage, courtesy of that. We have 2 pharmacists.
Sorry, through the chair. What was the reasons of recalling the two, the Lexon and Said?
They were supposed to report back by September.
So they've not reported back?
Yeah, they never. And actually we were forced to stop their salaries.
Okay, proceed.
Banning them reporting back. We have 2 pharmacists who left outside the country. One was to pursue a Doctor of Philosophy in Pharmacy, that is Dr. Chebon, in a university in Australia. But he made a special request to leave of absence. He requested for a leave of absence, which was granted, and that is why his salary stopped. So it's not on the county's, our county's cost.
So, excuse me, Doctor, who's giving out all these approvals?
They go through the normal process where they request for study leave, which we actually discuss at Department Human Resource Advisory Committee meeting. Once approved, it's actually passed to the County Human Resource Advisory Committee, that is the CHIRAC, for now approval, depending on the request and the need.
So you want to say all the approvals went through CHIRAC?
Yes, they went through DIRAC and CHIRAC.
And as a department and as a committee, you saw it right to release 18 doctors, medics, to go on study leave, leaving our BCRH hospital to be run by casuals.
Through Honorable Chair, they're actually at different stages of their studies, and I want to report that we are expecting around 4 of them to report in September this year, and others in the course of next year. We actually found some of them, they already gone present to school, like around, that's Lexon, Dr. Intisa, Abbas, around 10 of them. It actually presented to school even when we came into office. But they're actually almost completing their studies. My input about doctors going to school, it's part of development in the department. One, initially they are medical officers, but once they specialize, they become specialists. And I believe as a county, we still need more specialists on top of the current specialists which we have in our county.
Madam Chair, I think, Dr. you've said, imagine releasing 18 at the same time. You're trying to justify that it is a requirement. You're trying to develop their career. But unfortunately, again, we are developing their career, and they come and leave without working within that period that is required, the probation period. They don't serve within the county. Now, you also have to confirm how many of them did not follow the regulation, did not work with us within that period of time, and what are you going to do to them? Because they spent our government money, and they have not come back to give us services.
Yeah, through Honorable Chair, they are all bonded for a minimum of the number of years they've gone to school. If it's a 4-year course, they are bonded for 4 years. If it's a 5-year course, they are bonded for 5 years. And I believe once they come back, they'll actually give value to the investment we put in them.
Daktari, on that note, you want to say all of them came back and boarded for the number of years you're saying?
Yeah, like the ones who've come back, they've been bonded and they're actually serving.
We do not have some of them who went without even serving.
Except, I think there are 3
now
who actually transferred on what you call government to government service. Like I know of a psychiatrist who transferred to Ministry of Defense.
So that one is allowed even if they've not finished the boarding?
It's allowed by law. Through Public Service Commission. Yes. It's government to government service. So long as somebody is not leaving the government.
So that means these people can just come through Baringo, we pay them school fees, and then they leave.
No, not as such.
That is what is happening now. Because already the ones who've gone to abroad are 2. These are the ones you've said there are 3. Those are 5 out of 18. You've recalled 2 who did not serve within that period, the bonding period.
And we stopped the salaries, yes.
You've stopped the salaries. The ones who went abroad, they've been earning in abroad.
No, we stopped the salaries, the 2 of them.
So what is going to happen to the money they've been earning?
Actually, we utilized their pay to engage last year, the 6 medical officers on a 6-year contract, pending confirmation. Once we confirm that these officers are no longer coming back to our county.
Chair,
Probably, Chair, before my colleague comes in. We want the approvals of all the medics who've gone on study leave. We want to see the disciplinary actions that has been taken against those who went to abroad and they were still earning from our county. The ones you've recalled also want to see probably the letters you've written to them, recalling them, and the last action that you've taken, so that matter can be concluded.
Before we conclude, how long have you been in Baringo?
More than 2 years now. But I worked in Baringo even before I left to Nandi.
I'll just ask how long have you been here?
The last 2 years.
Honorable Localist.
Thank you. Thank you, Chair. I think I need to understand something, Chair. Just like a layman person who doesn't have a background of health in Baringo, that mama from Kisanana wants to know. You have 18 doctors working with you. And let's say 18 doctors, you have 18. Then this month, 4 of them request to go for study leave. You sit down, you approve. After 2 months, other 4 come, again seeking your approval. You approve. The others have gone for 2 months, and they are going for 3 years. Then other 2 come, after like 3 months, you approve. Then you approve for 4 years. And then another slot of 4 come, and you approve. When you are doing the approval, when you are sitting down, the CHIRAC, the board, and the county CCM, county CEO of medical services are in the know that they released 4 months ago or 2 years ago, they released these doctors and none has come back. And you go ahead to approve for more to go. What are you trying to insinuate to the people of Baringo? The BCRH or any level 4 hospital is left without a doctor. Then now again you come sit down and say, we don't have a doctor, will let us hire some contractual or casual doctors so that they can help us. You are paying the others still on leave. You are paying money meant for Baringo people. Then you hire extra one because of the fault or your own fault of approving for more doctors to go on leave. You use again taxpayers' money to hire more doctors, and you continue. When again you have around 2, you continue hiring. What are you trying to tell us? The normal person, there's ule mama mwenye anatoka huko Kirioko, ajue kwamba these doctors are living with your approval. They are not going by their own. Even if today I am applying for specialists somewhere to go and specialize in anything, and my time, I am told by my bosses, we have given many people to leave, and therefore we are rejecting your offer. So this board plus a CHIRAC plus a CEC plus a CS, you are just rubber stamping any request coming before you, rubber stamping. If I say that you must have been bribed by the same doctors so that you are approving anyone coming, you are using them to gain money so that anybody coming, his approval is just given. Can you give us an example of those you have turned down their offers today, if they are there?
Honorable Engo.
Thank you, Madam Chair. I think this is where the rubber meets the road. I believe in many cases, Honorable Chair, many of our referrals from Gabarnet to Eldoret is because one of the reasons is because we lack specialists who can attend to the patients here in PCRH. Madam Chair, I wanted maybe them to tell us, when you are employed today as a doctor in our county, is there a prerequisite time you are supposed to serve before requesting to go for study leave? There's one. Another one, Madam Chair, is how many doctors do we have in Baringo? And in Baringo generally, so that maybe you tell us per sub-county how many are there. And then also what informs the approval? What informs the approvals? I think that is when we can actually say you are in charge, or what Honorable Locales is saying is true. What informs you that we must release these doctors? Madam Chair, budgetary implications. Budgetary implications of doctors who go. And this is actually where we have suffered a lot, if I'm not wrong. We have suffered a lot because of this. I know development of career to being a specialist, that is all right. But we must have a sequence. We must have a sequence. We must have a procedure so that we don't go for further studies, leaving our patients without doctors. Maybe so that I don't deal so much. They should answer us.
Waziri, proceed with the answers of Honorable Ayengo and Leka Kimon.
Okay.
Sorry.
Chair, career progression is encouraged, not only in the county, even national government. And we should know that these doctors left at different stages. They were not all 18 released at once. And some of them, when they apply to go for postgraduate, most of them we don't release them. We usually request them to defer for 1 year. And they can be only allowed to defer for 1 year.
Before you proceed,
and then I want
to make
a
point of information so that you proceed, because you are digressing before you. We want to know at what level do they live. If I'm employed today as a doctor in Baringo, for how long should I work so that I start applying for study leave?
It's a minimum of 2 years. You should work for the county. And then we have gone ahead now that we just don't release anybody anymore. We have something called training needs assessment. We can only release somebody if we know those, if we need those specialized
Waziri, you are going
courses.
to defense and you are not answering these honorable members. Why are you going to defense? When you start saying we've started now regulating these doctors, you've not even illustrated the issue of Honorable Locales. You've not illustrated the issues of Honorable Laengo. They've just asked you, like the one I've interjected. I thought you will pick from there and proceed. Like, talk to me like a mama in Salawa. How do doctors transit to those going to further studies, finish, come back? Honorable Laengo, please go back to those questions so that you can stick to the question and give us the answers.
I think I asked how many doctors do we have in Baringo and Basab County, and then how long he has answered, how long they take before they request for study leave. And then another question I wanted to ask is, as we have that space of 18 doctors on study leave, maybe going on different stages, which is all right, but do you have a replacement of the same 18 doctors? And are they procedurally brought in to serve for areas the doctors have left? Or we just, that is it, Madam Chair.
Honorable Sharon, you add your point so that you can be able to answer.
Thank you, Chair. I've heard the doctor saying that nowadays they don't release, they've stopped. And I'm here wondering, they've stopped because we don't have doctors anymore. They have all been released. So, I mean, and one thing I want to comment on is this issue of career progression. It's something that is highly encouraged. But at what point do you balance career progression and the sustenance of the hospital? Because as we speak, we don't have those people that you're calling, we don't have the experts as you're saying, and worse still is that we are the doctors who are working currently are those who are in casuals, who are working in 1 year contracts, I think, and below. So at what point do you balance the sustenance and the running of the hospital and career progression? And also, a last question is that you said that there are 3 doctors who came back and left. These are people that they say that according to the law, they are allowed to transfer across. What if these doctors come back again and then they are transferred because the law allows? Is there anything that can be done so that we are able to sustain the BCRH? Because as we speak, the BCRH that was a referral hospital, it's a level 4 hospital, owing to this mismanagement of the office, of the hospital. So how can we balance this thing? Thank you.
Honorable Siala, then we allow them to answer so that we don't ask a lot of questions and
Yes.
they don't give us answers.
I stand
Proceed,
guided,
Honorable
Madam Chair.
Siala.
I thought that the question that I have is in regards to what we are. I want to know how much is, on an average, how much is a doctor earning? And number 2, those who are on study leave, are they paid their full salary? Or when someone is in study leave, is paid half salary? And then an issue that arose when we were in BCRH, there are these consultants that we have. How many of them do you have specifically for BCRH? And what times do they come? Because there was a complaint that some of them just come they visit the wards, and in fact, they even refer patients from our BCRH to their local hospitals that they own within Cabernet. So is that allowed? Thank you.
Proceed, Waziri.
Okay, I think Dr. Ngor, you'll answer how many doctors, because I don't have the numbers now that we have. And also how much they earn. There are some who have come and left. And how much they earn. You know, I was a doctor 3 years ago who was earning a salary for a specialist. So I don't know. And there has been always increment. There is an yearly increment. I know there is something called a CBA.
So I don't know my
Waziri, I want you to proceed with the
Madam,
few points. And
to the
there's
chair.
something, let me add on something. At least now you came from the hospital in PGH in Nakuru. I went there with a child, a patient. In Nakuru, I want you to tell us the difference between now our hospital, PCRH, and that one of Nakuru, where a pediatrician sits from morning to evening to attend to children. And in our hospital here, we don't have that pediatrician sitting from morning to evening. I would want, as you answer their questions, I want you to help me understand how can we be like in Nakuru, where our specialist sits in hospital to see our children when they come there, as you proceed with their questions.
Madam Chair, Dr. Sirma is trying to actually avoid my question. Sirma, let's be honest. Unless you want to provoke us. Let's be honest. I'm a cool person, but if you want to provoke us, then we'll get there. I asked you, on an average, how much does a doctor earn in Baringo? And the second question was, those who are on study leave, are they earning full salary when on study leave or half salary?
I know what a consultant earns is around 300,000 Kenya shillings. For a medical officer, it should be around 200, average 200.
Let him.
Honorable Dr. Let's be on record.
Chair, I feel the doctor is not sure of what he's telling this committee. And Chair, don't take us that part where somebody wants to maneuver to avoid answering specific questions. From the word go, my questions were not answered. The questions of Honorable Engo were not answered. The questions of Honorable Shallow were not answered. If the doctor is not sure of what he's saying, let him delegate to his two chief officers. He has the superintendent here. He has the administrator here. If he's not sure of what he's telling this committee, let him shut up and allow others to speak. Chair, we are losing our patience on this one. Thank you.
I think, Waziri, you can see the feelings of the members, and the same on my side. You will.
Are working in this PCRH like doctors. And because of you. The way you talk, and your CEOs are just looking at you, lie to this house. Chief officers. At least in the last department, I could see CEOs whispering to their CECs. You want to tell me, CEO Ruto, you don't know how much a doctor earns? CEO Jesira, you don't know how much a doctor earns? You think you've come to this house to reserve your answers and we'll let you go. We still have questions for you and you will answer. Waziri, proceed from the questions from Honorable Laengo. And we are not going to repeat those questions. I want you to start from the questions from Honorable Laengo so that we see if are we together or you're sleeping. Proceed.
Chair, although I had already delegated.
Waziri, do you listen? I've said answer the questions from Honorable Laengo. Is it difficult?
I want Dr. Kangor to answer how many doctors we have, so that I don't want to make a mistake.
Honorable Selma, did you remember the questions from Honorable Laengo?
It is how many doctors that we have. No, how much they're earning from Honorable Sia. about the study, whether they are still being paid full amount. Yeah.
I think you can proceed to the
Questions of Honorable Aingwa. And if you don't still remember, please allow the member to ask you the same questions.
Yeah, thank you, Madam Chair. In terms of the number of doctors, we're actually 74 in number, against a population of 760,000. Allow me to dissect the doctors on study leave based on need. Then I want to approach it the other way around. One, I've talked about the four whom we have actually stopped their salaries. Now for the others, like one doctor called Dr. Abbas Ali Haji, who is pursuing masters of medicine, internal medicine. That means when he comes back, he'll be a physician. As we speak, you will have one physician in Baringo County. That is in BCRH. Once he proceeds on leave, we don't have a physician in the whole of Baringo County. So there's a need for us to have a physician. We have one doctor who is pursuing masters of medicine in psychiatry. As we speak, we don't have a psychiatrist in Baringo County at the moment. And thank God she's reporting back in September this year. We only have one surgeon in BCRH and one surgeon in El Maravini. Once that surgeon proceeds on leave, we miss surgical services in our facilities. That is at the county referral, or even in La Maravini, which is our second biggest facility in the county. We also have other theaters, like in Mogocho, which actually needs a surgeon. And like enough, among the team, we have one doctor who is pursuing masters in surgery at Moi University, expected to be back in September 2026. In our breakdown, even before we release doctors on study leave, there's a minimum period of time where they have to work, minimum of 2 years. Then now we release them based on the need. Amongst all this team of 14 doctors, they're actually based on need as a county. We have to grow as a county. So we need these doctors as specialists. So we stop referring these doctors to
Honorable Siala.
Thank you, Madam Chair. Doctor, you've just told us that most of those doctors, the president is that they don't come back. So how sure are we that the 14, already you stopped the salaries for the other 4, the 14 will come back? Because you help them grow, develop their career. Then when they come back, they would want to work in a high hospital. They will not want to come to a BCRH where things are not working. So what are the measures that you are going to put in place to ensure that when they come back, they will be retained here for that period of time?
Through Madam Chair, they are all bonded. That is on reassurance. And we have.
Doctor, you've told us there are 2 or 4 who are bonded, but they left.
Like the one who went to KDF, as you alluded.
They left, and you say
the one who went to KDF specifically was a specialist in
psychiatry.
And now you don't have a psychiatrist, and you let that one go to KDF.
Actually, through Madam Chair, they made a request to transfer service, and it's by law that they're allowed to.
Honorable Chair, if they can transfer services, what are this thing called bonding for?
Yeah, they should come back and work for us.
Yes, and if they can still make an application for transfer and there's nothing you can do about it, what is the importance of bonding them? If the bonding cannot hold water, if they can make an application, they want to be transferred and there's nothing you can do, what is the bonding for?
Through Madam Chair, the bonding is actually to make them come and work for us.
But they don't come and stay.
Unfortunately, under Public Service Commission regulations, they are allowed to transfer service so long as it's a government institution.
And this is where the problem is. You've released all of them, but they'll come back again and make the transfers. And when they're away, we are facing the challenges that we are facing. So we'll continue being in the same problem year in and year out. I don't know, Chair, if I don't understand even those three that they went. Those people, I thought when they went, these are the services that we needed so much in our county. But now again, they went, they acquired the skill that we really needed as a county, and then they went. And then we released others, again, to go and acquire this skill that we don't have. And then they'll come back again and they will leave. So we'll be in the same circle. Can you give us a solution?
Honestly speaking, it needs some serious review, because we are actually carried by the Public Service Commission, who again is giving them this the same avenue again to transfer to other government institutions on a government transfer. It needs some serious review, honestly speaking.
What if we make BCRH a parastatal? What happens?
Yeah, they will be wanted to BCRH. That might be a solution.
That can be a solution. Okay.
Honorable Laengwa.
Madam Chair, it means we're just left under the mercies of God. Because do you surely have control over the movement of these doctors? Do you have any control?
Through Honorable Chair, yeah, we do. We do have control in terms of releasing and boarding them. The only challenge is when they now request for government transfer. That is where we have a challenge. But in terms of if they are to sign and join.
As this career progression assisted us here in Baringo?
Through Honorable Chair, it has.
Because if they come, they go. You told us now there is one in doing masters in psychiatry.
Yes, yes.
And you've already, there was one who left. How can you tell us, or how can you prove to us that the same one, the psychiatrist, will still come back and work here in Baringo? No, we are losing. Taxpayers' money belongs to the people of Baringo, and the services they are rendering they are supposed to render to the people of Baringo. Now that you have released them, the Dirac, the Jirak, munaketi, munachilia. Wakikuja, you have no control anymore. So, how?
Before you inform Honorable Sialo, I would want Daktari to give us an example of a doctor who we've released him, amesoma, amemaliza, akarudi akatufanyia kazi. Number two, Waziri, I would want to know how Kangor also came to our county. We read it. We had an interview here. He was also on a secondment. What was he doing from where he came from, and what did he come to do here? Honorable Sialo, please
The
inform.
information I wanted to provide is that from what my colleague Aengwa said, from the calculation, the reason why I'm asking, all these medics who went on study leave, they've said each one of them on an average is earning 300,000. So 18 of them in a month, the money that the taxpayers' money that we are losing in a month in terms of salary is 5.4 million in a month. Now, that is on an average. And of course, I know there are medics who earn up to 500, 600,000. In a year, Madam Chair, we are losing 64,800,000. Now, for a period of, that study leave, if a doctor is on a study leave for 4 years, then we are losing 259,200,000, Madam Chair. And when these people are qualified, they don't come back. So, county government of Baringo and the people of Baringo are at a great loss. So, Madam Chair, we really have to do something as a committee. So, to ensure that at least we remove this embarrassment that is in the public and in this entire country. Thank you, Madam Chair.
On addition to what Honorable Shallow has said, he has given us on an average the amount of money we are losing as a county. I want to ask Dr. Kangor and the doctors seated here, most of them are doctors, of course, that do we really value the value of money that we are using on these people? Do we care about the value of money? We are spending a lot of money to somebody to gain knowledge to come and assist us. But on the way you say, there are some circumstances which are very difficult for us to control. If it happens that when the government knows you have already spent money to this person, you have given him the knowledge they want, the skills they want, they will continue poaching from you if you don't have modalities as the county government of Baringo to ensure that such a doctors, we are not losing such a doctors in our facility. We have other counties, example of other counties like Marakwet and Eldoret and others. And of course, we are aware on how they are doing. But for Baringo, it is a loose kind of procedure that even today, if I become a doctor, I wake up tomorrow, I write my application to you, I'm granted, I go to Uganda, study there, take 4 years, come back again, go to Nairobi for greener pastures. What is the value of money? And my questions, Madam Chair, have never been responded to. I'm still waiting. And I'm still patient. Thank you.
Waziri, proceed.
The issue of Chepcheng, I don't know. She's supposed to answer the CEO. Maybe I can answer.
Kangor, proceed.
Through Madam Chair, allow me to answer on the doctors who have gone to school and have actually given us the value of our investment or our money. 8 doctors reported back. One is 2 are pharmacists. The other one is our surgeon at PCRH. Our 2 radiologists. Our only physician. Our only ENT surgeon. Our only ophthalmologist. They went to school, came back, and they're actually offering services in our facility. Going forward to address that supposed loss in terms of them reporting back and actually disappearing. 1, we need to have a collective approach in terms of approaching Public Service Commission so that as Baringo, as a county, we get value for our investment for those who want to transfer service to a government institution. But again, there is room. Once we have all these specialists back, we can have what you call collegiate approach to training, where we have our county referral store, Oledam Ravine, as a training institution for specialists through the collegiate approach like COSEX and the others, so that we retain the same doctor within the same facility, offering services but now specializing. And upon completion of studies, getting e-certification and actually being recognized as a specialist. So there's a solution to that going forward.
There's a solution from today's meeting, from today, that we've raised concern that now you can find a solution.
Yes, we can approach, there's the collegiate approach compared to the university approach.
What have you been doing to do that?
The only challenge is the number of specialists whom we have, but once these doctors report back, we'll have enough ground to request for the collegiate approach to specialization.
But remember, Kangor, Dr. Lexin and Dr. Said left. You watching. The rest will still come and they'll still live through Chirag, through you, through the rest of you. When are you going to qualify? Number 2, I'll still want Waziri to tell us how you came to our county on such a secondment so that we can get to know what kind of Baringo we are. If indeed you came with something that really helped us, or it is the same stories?
Okay, so that we don't mix issues, there was one question that needs to be answered.
I want you to answer the question of Kangor first, okay, so that Madam CEO takes up the next question.
Okay, for Dr. Kangor, this county by self-request. And we followed all the procedures. And when we applied, Dr. Kangor was working in Nandi. He has worked as a director. He has even acted as a chief officer. So we felt that after his application, he was coming to add value at the level of management of our county, at the leadership level. So he followed all the procedures, and we accepted.
Did we have a substantive medical director on that, the position he was taking?
The director, medical services, you know, this is it's a very long story. Because even when you invited us here, part of your invite was to investigate any employment malpractices and breach of any applicable human resource laws. And we have a director of medical services where we found the mode of engagement was a bit flawed.
Proceed, Waziri.
We found a director of medical services does not only play administrative role. This is a technical advisor to the county and the governor on matters of medical services. And there are qualifications for it. And we are being guided by the Health Act 2017. And there is also an advertisement that was made.
Which act is that?
27, an Health Act of 2017. And there was an advertisement that was placed sometimes in 2018. And when you look at the requirements, one is that one must be a Kenyan citizen. The other one is one should possess a degree in a relevant technical area, that is medicine stroke public health, should have served at the level of deputy director for at least 3 years in public service or equivalent in other sectors, demonstrate professional competence and managerial capability in health sector, must be in possession of master's in degree in public health or medicine. He must have a certificate in senior leadership development program or its equivalent, and must be registered with the relevant professional body. Must be a computer literate and must satisfy the requirement of Chapter 6 of the Constitution.
Honorable Siala.
Thank you, Madam Chair. I wanted to interject a bit. Dr. Sirma, so does he meet all those qualifications?
Yes, he does.
So we have no problem with his?
Yes, he meets, he meets all
Now,
that.
do you know that there was a budget implication that was caused by his probable secondment to Baringo County? Because we had a substantive director who was in that position and was earning drawing salary from that position. And even if he was transferred elsewhere, that director or that person went with his salary the way it was, because there was no way you could demote him, and you had no reason to demote him or even remove him in that position, but only because someone is being brought to take over the position. So the director who was there went to be was designated to a different duty, but he went with the salary of a director. Now a new director is coming in to replace him, yet we do not have a budget for that position. So where did we get money for his salary?
There was a budget because I know there is a doctor who left in the same job group where he came to occupy. And that was even a specialist.
So can you prove there was
resigned.
Dr.
There was a
Sirma?
surgeon. There was a surgeon.
Okay,
who
I
left.
agree. Yes.
Yes.
So can you
so
prove?
he took over his salary.
Can you prove that there was a budget for his position?
You know, if there was no budget, the county public service
No, Sirma,
board.
it's simple, Sirma. I'm just asking. You've said that you think.
Yes, yes.
Just be sure of what you're saying.
Yes.
So I want you to prove to this committee that there was budget for his employment.
Yeah, there was.
Yeah, I agree. You've said we don't object, but kindly just prove to us that before he's coming to Baringo, there were correspondence between the department, you, and the finance or the treasury department, accepting that there are enough funds to cater for his salaries. Because the one who was there went to a different position bearing the same salary. So if you provide that, then we have no problem. Madam Chair, thank you.
And before you proceed again, you've opened another Pandora box. That a surgeon leaves and you think that budget can pay Kangor. Why didn't you bring another surgeon? For that matter.
Madam Chair, Baringo County has been a challenge. It has not been attractive to get specialists. Because of, there are many other reasons.
But Waziri,
yes.
You know you're proving a point. You know, you're on these social medias. How PCRH has been operating. You know even the names that have been branded. Don't you think you're proving people right? That we don't have the right people in this PCRH? Because you tell me a surgeon leaves and you think that budget can be given to a director to come and just work in that office. Now it's a surgeon who have left this county.
Madam Chair.
And Waziri, you know we had a lot of hope in you. You have a very good record from PGH, Nakuru. And when you came in, we knew PCRH will be a new PGH. But to this point, we are in a very bad books. Even our hospital, in your eyes, PCRH has been reduced to level 4. Where ukiona tu? And looking at what you are talking with Kangor, because I have not heard from the rest, there is no hope. That through this committee now, we are going to plan on how doctors are not leaving. And if this meeting would have not happened, what would have happened? Members, Honorable Ayengo, proceed, but by the look of the things, you will continue. I'm going to give you a chance. But Waziri, by the look of the things, even the questions as we proceed, ni ile ya Raila bado mabambano. Proceed, Ayengo.
Thank you, Honorable Chair. I think surely we are not getting the answers as we deserve. Therefore, we have even decided to just forge ahead without answers. Nevertheless, I just want straight away to ask them. There was a time, there was an outcry in Baringo North where the sub-county hospital was reduced to level 2. I think the anomaly has been corrected. You will clarify for us. Number 2, our county referral hospital, which I am so much skeptical about the name referral, because I think it is a conveyor belt for Moi Teaching and Referral Hospital. Why was it reduced from level 5 to 4? My questions will come direct and I want straight answers. I will not go around. Answer, and I will proceed with others,
Okay.
please.
Proceed to answer. CEO, Madam CEO, please proceed.
Are you? Okay, thank you. Now, I have two questions to answer. We had the first one for Chief Ching, and the one that just came from Honorable Aengbo. Then I want to start from the one from Honorable Aengwa because it is shorter. Now, Kabartonjo Hospital, around December, January, we had some issues regarding which level it was. And it was alluded that it was reduced to level 2. Now, I just want to make it clear, and I think we corrected the issue. You can confirm, Honorable, that level Kabartonjo Hospital was inspected and qualified for level 3. Now, during the transition to SHA, the mistake was with SHA. They still put into data Kabartonjo is level 2 when they were key in. So when the anomaly came, we still wrote letters to SHA, and they were able to bring it to its correct level. So Kabartonjo is level 3. Now, for the referral hospital of Kabarnet Referral Hospital, I think BCRH is level 4. It has never been level 5. It has been inspected, and we are yet to qualify, or they are yet to qualify BCRH to be level 5. So BCRH has never been downgraded because it has been level 4 and awaiting to be approved for level 5.
Thank you for being clear.
Yes.
That it has never been level 5. Yeah. But the word that was moving around all along was level 5. Now that we are used to saying level 5, that's why we even call it referral. What efforts are you making to make sure it is taken or goes to level 5, so that we reduce these issues of all the time ambulances, sirens down the valley to Eldoret?
Okay, there are a lot of efforts.
And time limit.
Yes. For it to be level 5, as I have just said, that they came, they have assessed it to qualify to level 5. Now, it has not yet qualified because there are some few requirements that we are supposed to meet before we make it level 5.
Which are the requirements that we are missing?
Like now, there are some services that is supposed to be offered. We have a number of nurses that are supposed to be, they have numbers according to departments, like how many doctors, how many clinical officers, how many nurses.
Have you raised the intent?
The intent of the total number of nurses that is required?
Yes.
The intent as, we are raising it bit by bit because of finance.
CEO, that is a big lie. You said you're in the process of making this hospital qualify to level 5. Okay. And these things, we got it from our fact finding. We even didn't know how is it. The MedSoup told us the reason why we are not at level 5 is because of the number of nurses, number of doctors, number of. Have you raised that intent to even the CS in preparation to that level 5? Or even to the cabinet secretary?
Yeah, we already have an intent. We have an intent of working towards that. Like in the new, we have an intent that is with board, and we are awaiting shortlisting interviews. And
please provide that intent to this committee.
It can be provided. I don't have it with me here, but it can be provided.
It was when?
It was early January or December.
Waziri want to give an input to that point. Please proceed, Waziri.
The facility actually was assessed by the Kenya Medical Practitioners and Dentists Board together with the MedSup. And the MedSup has the list of the requirements in order for BCRA to become a level 5. He has it with him. And the good news is, I was called some 3 weeks ago by the health advisor of the President's State House. And he requested us whether
was asking about whether it was a budget, and there was a budget. Otherwise, the county public service would not have accepted the war transfer to the county. If there was no.
Why was it not competitive if the budget was there?
We had requested for, I told you we wanted a manager.
Yes, why was it not competitive?
You know, when somebody requests for transfer of service, it happens anyway.
even like the specialist.
But not in his position. Not in his position. That position should have been a competitive bidding. Is it true or lie?
You know,
at his level, is it not a competitive position?
You know, this was a request by him to transfer.
Why did you accept?
Because we knew he has been a manager and he was going to assist.
And we had a manager already who was working.
But
or you want to say he was not a? Did you want to say he was not a professional?
There are issues that I had already mentioned.
You know, Waziri, how you can see the transition of Kangor by Jepching, the mysterious issues that are happening in Jepching's life. It was actually caused by him. You will not tell us, but I can tell you, we've done our own fact finding. How Jepching landed there, how he went to Uganda, now you are recalling him back.
I don't know whether you read the qualification of Mr. Jepching.
Don't tell me about the qualification.
Yes.
Now, that is the reason, whoever employed Dr. Jepching to that position, was he not aware? Is it not the public service board in our county? Or it's another public service board that did that job? You know, you want to take mistakes now, we want to go to the public service board. They employed Dr. Jepching. Is it true or false?
They did, but it was a malpractice. They didn't follow the advertisement.
And why did you take Dr. Jepching under the same salary to another hospital as a medsup?
Yes.
Does he even qualify to be a medsup?
As an administration, yes, he can. Administratively, and he can.
As a medical soup?
Yes, he can.
Waziri, take charge. Members proceed. Honorable Sharon? Honorable Layango, you want to add
Yes.
something?
No, I'm proceeding, Honorable
Okay.
Chair. I'm proceeding. I don't know, Madam CEO, is Kabartonjo theater operational? And we have doctors there.
Through the chair, it's not operational because we still do not have enough equipments or all the required equipments to operationalize Kabartonjo Theatre.
And we have doctors there.
Yes, we have. We have the MedSoup as a doctor.
Now, what happens? Until when will the theater Kabartonjo be operational?
We have.
And I know one time, Governor Kiptis went there and opened the theater. This theater will remain closed until when?
Thank you. I think we've had a discussion around it, and even the governor is aware of this, and he has given us instructions that by the end of this year, that is December, Kabartonjo Theatre should have been operationalized. And now, why it has not done so is because the budget, money has not been provided in the budget to buy the equipments that are required. But now, in our budget this financial year, we will factor it in. And even if it will not be in the budget, we are hopeful and very optimistic that now with the FIF money, we can set aside a certain amount. It's not much. We only need 3.5 million for Kabartonjo Theatre to be operational. So even using the FIF money, it is possible that by December, it will have operationalized.
So it is on record, Madam Chair,
Yes.
that by December this year, Kabartonjo Theatre should be operational as per the Chief Officer. Nevertheless, let me continue, Madam Chair.
Proceed, Honorable Layango.
That we are now come to PCRH here, that in most cases, we have transfer of personnel, clinical officers, nurses, doctors, without the knowledge of the MedSoup. Is that true?
Transfer of staff to other places without the knowledge of MedSoup?
Yes. And is he supposed to be consulted? Is he supposed to be consulted for that matter?
When we are transferring?
Yes.
When we are doing transfers, we sit down, and that is now between the chief officers, our CEC, and the two directors. And on need basis, and on assessment that on a certain area, we could be having more staff, and even not more staff. There could be a very needy hospital somewhere that does not have even one staff. So we do transfer and then notify the MedSoup through the copy that we have made a transfer.
So the law does not qualify that he be consulted?
Yeah.
Now, what about in such a case in like referral? I know in other areas you can move them around in level 2 hospitals and the rest. But in such a case, don't you think it is unfair that we have shortage of staff and you continue without maybe, if there is good relationship or so, could you maybe, after even making that proposal, even if the law does not allow, don't you think it was prudent that you could just inform him that we are taking this number of staff, we are replacing with these ones?
But most of the staff that we have transferred out of BCRH, they have been interchanged with other staff. However, Honorable, through the chair, sometimes if we try to negotiate in every hospital with the in charges, none will be willing to release even a staff.
Now, another question is that it is alleged that the transfers have been discriminatory. Is that true?
It's not true, to the best of my knowledge.
Now, there is also a growing concern. We are in this hospital here because this is where all the patients in level 2 and 3, they end up here. And from here to where? To Eldoret. And we've been a laughing stock, especially along Iten Eldoret Road. Wherever they see an ambulance, probability for it being for Baringo is more than 50%. Now, and we are the farthest. I want to ask, we've got some knowledge that most of the nurses or the clinical officers who are having issues, maybe drunkards, or have disciplinary issues, they end up being brought here for maybe closer monitoring and the rest. Do you think it is fair that you bring them, people under disciplinary cases here, even if it is for close monitoring?
Thank you, Honorable Member, through the chair. Now, I want to start with the referrals. And I want to confirm in this session that referrals outside BCRH has drastically reduced. It has sincerely reduced. I have received 2 phone calls from MTRH Eldoret. And the phone call was saying, thank you, BCRH, for the numbers have reduced. I don't know if it is true, but it tells me that from 4 to 5 per day to 1 per week. That is a phone call from MTRH. But even from the records in the hospital, it is true. The referrals are seriously, and we appreciate the reduction. Now, on the transfer of drunkards to the county hospital. Now, when I came in, and I don't want to take credit on this is something that I just said through management, and I said, I think all of them minus the doctor and admin, and I said that any staff, wherever they are, they will remain where they are. And if there is anyone who has an issue like a drunkard, we should not transfer a problem from one person to the other. And I said that we will try to rectify, and when they have improved or fully improved, then we can consider maybe transferring. So the issue of transferring somebody from one place to another, I think it is not there. Thank you. I still had the question to answer, Madam Chair. Should I
proceed,
now?
Madam Chair?
Okay. Now, there was this question that was asked earlier about the release of Chepcheng to Kampala University. Now, I want to maybe give us the steps that we follow before releasing someone to go to either outside the country or even within the country or to any college. Now, when a staff shows interest, any staff shows interest that they would want to pursue or to go to school, then this interest is presented to DIRAC committee. Now that is the committee, human resource, within our office. Then this DIRAC will sit down and then will analyze the need, the request vis-a-vis the need. If it is needful that that staff goes to school, then it is approved in CHIRAC, and then it is forwarded to DIRAC. Now, if DIRAC also ratifies, if it ratifies, then the CS will now write a release to these staff to go to school. Now, that is where it is if the school is within Kenya. But if the school is outside Kenya, then now the CS will write, when it is ratified now through the stages, then the CS will have to write a letter to PS Health, no devolution, and then if it is approved, then now PS Health will write a letter to CS to approve the release of the staff. So that is how it's supposed to be done. But now for the case of Jeching, I was informed, it is confirmed, that the process was not followed. He was given a release letter to go to Mbarara University. Yes. And then later on...
The letter is addressed by who?
Huh?
The letter that was given.
Sorry?
The letter was addressed by who? The letter that Shari got.
It was, I've not seen the letter, but I'm told the letter was addressed by the chief officer by then. Yes. So when it came to CHIRAC, and CHIRAC refused, did not approve. If it did not approve, now I was in that CHIRAC by then, I was in the Department of Lands, so it was not approved. So when it was approved, then CHIRAC recommended that Chepching be recalled. Now, so when I was posted to the Department of Health, that is when now I met the CHIRAC deliberations, and I had to recall Chepching from Mbarara University. So he was to come by April, but then he called me and he said, I put the letter on WhatsApp and I sent it to him in Mbarara to come back. But then he called and he said, please, I am about to do my exams. Can you allow me to complete this year? Then I said, this is now on humanitarian ground. On humanitarian ground, I allowed him to finish. He has reported back from Kampala. He came last week and he came to the office. Thank you.
I've seen Honorable Lekekmon on mic. Please proceed.
Chair, I think I will continue with my questions.
No, it's not a... If it's the question, I think you can still wait a bit, Honorable Locales.
Thank you. Madam Chair, I want to take Dr. back to the question Aengwa asked about Baringo being level 5 downgraded to level 4. I'm interested in that question, and I want to take you, Madam Chair, to Baringo County website, baringo.go.ke/health department. Baringo County Department of Health Service is headed by the County Executive Committee member, Dr. Solomon Sirma, is the one here, and two chief officers, Dr. Winnie Bore, who leads medical services, replaced by Dr. here, and Mr. Evans Ruto, who spearheads public health. It is made up of 3 sections that include planning, administrative, preventive, promotive health, and medical services. I'm interested in the last part, achievements. Madam Chair, I want us to go together. In order to reduce on referral cases to hospitals in either Nakuru or Eldoret, Baringo County Referral Hospital, Kabarnet, has over time, under the leadership of His Excellency Governor Benjamin Cheboy, EGH, EBS, been improved in terms of service delivery, particularly specialist services, so as to enable it to become the preferred medical service provider in the region. These high-end services include renal units, radiology, mammography, CT scan, intensive care unit, and high dependency unit for neonates. From 2013, more than 47 dispensaries were built and 13 other similar facilities upgraded to health centers across the county. These are achievements, Madam Chair. The sub-county hospitals were elevated to level 4 referral hospital, while Baringo County Referral Hospital was promoted to the level 5 hospital. That is not my words, Chair. This is from the website of Baringo County government. I have just taken some part and I have shown them where it is. Can they confirm if Baringo is in level 4 or level 5? That's my question. Thank you.
Proceed, Waziri.
Cabernet is still a level 4 hospital. The people, there is something called categorization of facilities. And who does the categorization is Kenya Medical Practitioners and Dentists Council, where they come with officers of various cadres, and they pick two officers that have been appointed in this country to assess a facility, and they categorize it according to the standard of that facility. And the latest, I don't think it's even a year ago, they came to BCRH, and I said there are requirements that are needed, and they give us the list in order for BCRH to be a level 5.
Proceed, Honorable Locales.
Now that Dr. Sirma, you are saying that recently this facility was assessed by whatever body that is assessing this facility. I want to ask, the information we have in our website is read by the people of Baringo and outside Baringo. So do you want to agree that the information we are reading from the website is misleading? Kindly confirm.
I don't know. You know, when before
and these are achievements.
People had assumed that it is a level 5 without.
Who are people? The people of Baringo.
The people of Baringo. The people of Baringo.
But the website is not written by the people of Baringo.
Thank you, Chair. That's the question.
Yes. The
who is writing this website of Baringo? Who is updating? Department by department, because I've gone to Department of Health and I've given, including your name is there as a CEC in charge. Not this one, no issue done by Kiptis, previous government. This is your regime, Cheboy 2 regime, and it is indicated the achievements you have achieved. Moving level 2 hospitals in sub-counties to level 3, level 4, moving Cabernet to level 5. And you are denying, saying we are still under assessment.
We are not under assessment. It has already been assessed. People assume that we are level 5, but after the assessment, they found that BCRH is still at level 4.
So including those updating the government website are assuming.
I think that needs to be corrected.
Do you know include if now we search, and I'll tell you, search Governor Cheboy speech of last year. It was in his speech saying Cabernet has been moved from level 4 to level 5. It was updated in the website, and still you are still denying that we are not there. Who is misleading Baringo? Is Governor Cheboy misleading Baringo, or Dr. Solomon Sirma misleading Baringo?
Me personally, I've never said that BCRH is a level 5 hospital, and I've never told even the governor.
Chair, I think we need clarity of this. Before we wind up on this one, it is an evidence-based. I have not brought this issue from nowhere. Honorable Ayengo asked us, this is one of his questions. It was answered that there is nothing like that. Still, the doctor says there is nothing like that. It is in our achievement of Baringo that Baringo referral hostel is level 5. Achievement. And these are good achievement. These are very good achievement. Why are we denying? Who is misleading who?
That should have been an error.
Dr. Sirma and the two CEOs, are you aware of the website and the achievement of our Excellency Governor Kiborei? Before even then, I would want to know if they are aware of the update. And again, if you are aware that the governor read a speech that Baringo PCRH has been upgraded to level 5. Starting from you, Waziri, the mic is on, then to CEO Ruto, then to CEO. Madam
The other achievements we have achieved.
I'm just asking about the level 5. Don't mix things. Are you aware of the update in our website?
It was.
And now, the other levels, is it now as per what is in the website or what you know?
The other levels I'm aware.
So,
that they are level 4.
So level 5, PCRH, you are not aware? And the website, you are not aware of the updated website?
Well, as I told you, the people who did the update, I don't think it came
Was
from
it
my
which
office.
people? The people of Baringo or
You know
the government? The government of Baringo?
No, the people usually update is not even that. It is the communication team.
From the Baringo County government?
Yes. Yeah.
CEO Ruto.
Thank you. Yeah.
You are not on record.
Honorable Chair, I'm not aware.
CEO Ruto, but you are aware that Baringo level, BCRG is at level 4, not 5?
Yes, Chair.
Madam CEO.
Seen it on website, it is level 5, but it is not a fact. BCRH is level 4.
At least you have some honesty in it, because honestly, you know, we are conversing, representing the people of Baringo. This committee represents the people of Baringo because they were elected to do this. But looking at the things in our health department, it's not going the right direction. Honorable Cialo, Honorable Locales, then Honorable Sharon.
Thank you, Madam Chair. On the issue of Dr. Chep, what do you call him? Chepchieng, yes. You said he was released irregularly, and you've recalled him back. So after how long?
I think he completed. He has completed the first year.
First year.
Yeah, so that is 1 year.
So what will happen with the studies and the investment that he had made?
Now,
because there was an illegality?
Yes.
It was not approved through Chirac.
Yes.
It was an individual's decision to send him on study leave.
Mm-hmm.
And there is an official documentation for that matter.
Yes.
So now, what will happen to his investment?
Now, I have talked to them personally. He came to the office. The investment of going to school, he has to make a choice. Because now, the human resource policy will not grant him permission to proceed unless
Yes, madam. Okay, I
Unless-
agree. There's no problem with that.
Okay.
My question is, someone who is an officer, government officer,
Yes.
authorized him. Because why not for Dr. Winnie Bore to grant him that permission to go for study leave? He wouldn't have spent such amount of money studying for 1 year, and then he's been called back. So that investment, are you going to facilitate back? Are you going to pay him back the money that he incurred studying for 1 year? Because you cost him as a department to go for study leave.
As an individual, I say no. And also, the ministry cannot refund.
Okay, what will happen if
it was
takes,
an anomaly?
What will happen if it takes Baringo County to court? Are we not going to lose a lot of money, taxpayers' money, for an illegality that someone committed knowingly?
That is true.
Okay, Madam Chair, I've just received a concern through a text from a resident of Eldama Ravine. I think he had spoke about the medics who've gone for study leave. And this person is saying that there was a medic who was in Eldama Ravine, who was released on study leave and went abroad. And in the process, I think the arrangement was local arrangement. And in the process, he arranged with his brother, who is also a medic somewhere else, I don't know, in Eldoret or somewhere, to come and relieve him in Eldama Ravine Hospital. So the brother came relieve, his brother was going to abroad on study leave, and the supervisor and the med sup, Eldama Ravine, allowed and permitted that to happen. Now, we're asking, is this doctor, okay, what is the name of this doctor who did that? Number two, is he still in service? Is he still in study leave, or he has been suspended? Number three, what disciplinary actions were taken against the med sup and the administrator of the hospital for allowing a stranger on a local arrangement to come and cover up for a person who is absconded duty or who is in study leave? That is a very serious issue, madam, that has been raised, that I think the department must clarify.
Waziri, proceed to tell us who is going to take that point.
Dr. Kangor.
Dr. Kangor, proceed.
Allow me to answer through Madam Chair. This is actually an anesthetist who left for the United States of America. Initially, as a study leave, but what was discovered later, he was actually moving away from Kenya. And he actually engaged a cousin of his to take up his roles because his cousin is an anesthetist. The case has actually been handled at Chirac, and actually they have been surcharged millions. Him and the perpetrators, that is the in charges of the facility. So it's a concluded case, and they have to refund the county.
Allow me to
Honorable Cielo first.
Thank you, Madam Chair. So, Dr. Kangor, you are saying they have been surcharged. Who in particular? Is it the officer who went abroad?
One, the immediate supervisor, that was the clinical officer in charge. And
what is his name?
She's called Rachel. The clinical officer in charge, that is Rachel. She's called Rachel. I can't remember the other name. And the anesthetist, that is Kurere.
Kurere.
They've been charged actually, yeah.
So the two also are surcharged?
Yeah, they're surcharged.
Okay. What about the med sup? The med sup and the administrator of the hospital? Because this officer came as a stranger and worked in a hospital, handled patients on behalf of his brother or cousin. And for what period of time did that officer stood for his brother?
It took almost a year.
1 year, a stranger walking without notice.
Actually, what confused even the management is that cousin was once a staff in the same facility. Yes, yes, but they have been surcharged heavily.
So
That
this staff who was covering up his brother or the cousin work on the same. They work on the same facility.
He was actually once a staff in the same facility, and that is why, while he was there, he could not be noticed.
Doctor, let's be realistic. If that person used to work for that facility and he left, and then all of a sudden he comes back and everybody accepts him back, but they know that the work he's coming to do was for his brother. And how did the two brothers found themselves working in the same facility? Those are the problems that we are facing.
And as you answer those questions, how much was he surcharged? And has it been paid to our accounts? And if yes, we need those documents to be submitted.
And then finally, Madam Chief Officer is walking out and had a question with, okay. It is confirmed that through our website, BCRH is a level 5 hospital. But now my question, Dr. Musa Sirma, Ruto, and the CEO with the entire team. Under your leadership, our level 5 hospital, BCRH, is being reduced to a level 4 while you are seated comfortably. Sirma, will you even want to have that in your in your career?
Madam Chair, I
think you had concluded that point when Honorable Sialo was outside. I think we allow Kangor to finish the points that it was raised that was not answered before, so that we conclude on this matter.
Yeah, through Madam Chair, I promised to get details of what was those that was surcharged, and even specifically who was surcharged. I'll avail the documents.
When?
By tomorrow, because actually it's from the Town Secretary's office.
Tomorrow morning at around 10?
Yes.
It is. Honorable Lakakimon, please proceed with your questions.
Thank you, Madam Chair. My question goes to the CEC Health, that kindly explain to this committee how the principal public health officer came to board and what is his qualification and experience. Principal public health officer. You have a public health officer, principal public health officer.
the Chief Officer Public Health.
CEO Ruto, proceed.
Thank you, Chair. Yes, we do have a principal public health officer. Yes.
How did he come to board?
It is.
How did he come to board? That public health officer. What is his qualification and experience?
He's actually an outgoing. He's serving now on his terminal leave, because he has reached the requirements of 60 years. He has masters in public health. And how he came on board is that he's a member of our CHMT team. And there's normally promotions done after 3 years. And these officers are appraised. And if they are qualified, they get that promotion. And up to that level of principal public health officer, it is basically through the normal promotion. Immediately after that, the cadre just be above the principal public health officer is the assistant director of public health. Assistant director of public health normally should be competitive. It should be advertised, and people apply, they're shortlisted, and they're interviewed. And if they are found suitable, they can be are given that position. Thank you, Honorable Chair.
What was his job group before you promote him to principal health officer? What was his job group, and how did he went to job group N immediately?
He didn't, yes, it's true, the job group is job group N, but he did not, he didn't like jump to job group N, he just went through the normal succession plan.
How, you see, what we were saying.
Let me interject a bit, Honorable Lagakimon. Is there a public officer who was employed recently? Honorable CEO Ruto?
Honorable Chair, yes.
How did that happen?
The position was advertised. Yeah, there were, people applied. They were shortlisted through the County Public Service Board. They went for the interview, and yes, they were recruited for that position. It was actually one position. Thank you.
Which job group was that? CEO Ruto?
Honorable Chair, it was job group N.
And currently, what was he doing before he was employed?
I will not know what he was doing, Honorable Chair, just to be very honest. But I think the position was just competitive and people applied for it. There are many other, citizens.
Was he working in a hospital?
Honorable Chair, I might not have that information, and I want to go to the record yet. Yes, I
Thank
don't
you.
have that
Honorable
information.
Lakakimon?
Yeah, thank you, Chair. I think I will continue because that was the issues we are following. How that principal health officer jumped from the group that he was to job group N. That was where we queried. And
Actually, to make a point clear is that he was a casual worker?
He was a casual worker, and then he jumped to job group N, which is a very senior position, and we wondered how. Now, let me continue, Madam Chair.
Sharon, you seeking, okay, Honorable Sharon, proceed.
Thank you, Chair. When we did our fact-finding in the hospital, we were made to understand that this particular public officer was working as a casual worker, and actually was working, when he came, he was working under other public officers who are still and working as casual workers. There are about 4 in that particular hospital. And what really caught our attention is that the fact that they're still working as casual workers. And then we got somebody who was working under them and being trained by them, being given a very high job group. Job group N actually is at a level of a director. And if you could have used the same salary to even, that same salary could have confirmed these 4 public health officers that we do have. So this particular engagement is questionable in one way or the other. I don't understand how the CEC, who makes such requests, how did you make a request for employment of this particular person? Was it that we needed him so much, more than we do need these 4 others that have worked for so many years, 10 years, 5 many years as casual workers, and having one person who is earning a salary that can pay all this on those who are working as public health on permanent and pensionable basis, or even a good contract?
Proceed, Waziri.
I don't know whether you're talking of the same person that I'm guessing that. Is he called Ranguno? Yes, because I know a bit of.
Okay, and what we know is that that was one of the most recent recruitment that was done.
Yes. This officer, I don't think we even had control over it because an advertisement was placed for that job group N. And he applied, many others applied, and he was shortlisted.
My question is that, and even to seek clarity, this public health officer is he somebody that we needed in our county more than we do need the 4 that are working as casual workers?
We're going by, I don't know, I think the chief officer did the indent.
Did you raise the intent of the particular specific job?
Why? Yet we have these 4 who are working, they've been working over the years, and this is a totally new person. He came actually as a casual worker and worked for a few months. Just a few months. These other ones, they've been working for many, many years. And they went for the same interview. They applied, and they went for the interview, and they didn't get the job, but they took this other one that just came the other day. And considering the issue of casual workers, and you know who a casual worker is, these are people that we are mistreating, we are mishandling, and we are calling them casual workers, and they are not.
CEO Ruto, proceed.
Thank you, Honorable Chair. The issue of raising an indent, it is informed by need. It is also very important that as it is, we appreciate the work that the 4 casuals are doing, but we also need people in management. It was informed by need. Honorable Chair, as we speak right now, we have an indent that is in the board that we require also public health officers, but at the entry level.
Proceed, Honorable Sharon. And on that note, we would like to know, is the said who got the job is a graduate? Recent graduate?
Honorable Chair, yes, he has a degree in public health. And Honorable Chair, maybe just to share.
And the experience, and the rest, the 4 of them?
I've not checked their qualification, Honorable Chair. Unless you want to give me time. But just to share.
That is where the problem is. The reason why we are having this, we are having these unending problems of casual workers is because of the heads of these departments. If you are in charge and you know those people are working in the office, you should know that we have public health officers who are working. You should know they are providing services to us. Then, as a responsible person, even when you are putting up your intention to employ such a person, you should say, but we have this pool of people who have been working over the years. I've checked their qualifications. You should know their qualifications. You should know the years of experience and say, I'm forwarding this list to the Public Service Board to have them considered. Because one of the things that we are really struggling with, Dr. Evans, is that we are having casual workers who can take us to court any time, and we'll end up paying millions of taxpayers' money on something that we could have regulated. And as a responsible person of that department, this is something that you could have seen, and we could have sorted out this problem if you had seen it in that angle.
Thank you, Honorable Chair. According to the County Government Act, the institution that is mandated to recruit is County Public Service Board.
Yes.
My role as the chief officer is only to recommend. And what I normally do,
did you do the recommendation?
To all our casuals, the people who are applying to seek any particular position, I normally advise them to come to the office and I do the recommendation to all of them. Now the process of choosing the suitable person is the public health, is the County Public Service Board.
Just before we proceed, the other time the medical soup was here, he has been, if it's not the medical soup, probably the one in Mogotio, and I find Mogotio Sub-County Hospital to be quite effective. They've done letters over the years forwarding that these are the nurses that we have. While we understand, we all know that it's the role of the Public Service Board to employ, you also have a duty to inform them that we have these people who have been working as casual workers, contractors for over these years. They are qualified. And I'm really shocked that you have people who are working in your department and you don't really know their qualifications. And this is a call to you, and I don't expect, unless you have any other way you want to defend yourself, but this is a call to you and everyone else to be in charge of their department and to help us sort out this issue of casual workers and employment matters in Baringo. But as we speak, you are doing barely nothing on that.
Honorable Kakimon.
Thank you, Madam Chair. I think we have exhausted that part of the principle of public health. Is in any way that officer related to one of the senior officers in the department? That's why you left 4 of them that were there, and then you that person is picked by Public Service Board to head that department. Is he related to any of you that there was some kind of discrimination and nepotism?
Honorable Chair, I think in that regard, I'll speak on myself. I'm not related in any way whatsoever to the particular officer. I don't know whether my colleagues can also exonerate themselves, but from my side, I'm not related. 2, I think the issue, if I can go back to the issue that Honorable Sharon said through the chair, we do have their qualifications, and most of these casuals, they are contracted by the board, the hospital board. So yes, we have that qualification. We have we can get the qualification. Thank you.
On that note, I would want to inform you that Honorable Sharon was saying, when such an advert happens, it takes you take leadership to inform the board about the people that are in your office, their qualifications, and if ask them if they can consider, so that next time the problem doesn't come to your desk that CEO Ruto, you are not even aware about your staff and the rest. I would CEO, Madam CEO, would you want to add something on that point?
Maybe add up on the question that Sharon just posed on what role we play in ensuring that the casuals are taken in, the professionals. Now, I want to say that we have a role. And like for my department, I have already prepared a list. I am calling it a wish list, and I have informed the board. And this is a long list, a wish list that if it is well, we have these casuals who should be maybe given preference because they've stayed for a long time.
Please table that wish list to us.
Yeah, we shall.
Thank you, Honorable Lakingmon. Proceed.
Yeah, thank you, Madam Chair. I just want to ask you whether you know a staff by the name Florence Kiborei. Florence Kiborei, what is her role at Marigat Sub-County Hospital?
Angor, proceed.
Through Honorable Chair, she's one of our senior clinical officers who is in charge of the clinical services within that sub-county of Baringo South or Marigat sub-county. They usually interchange the 2 names.
So what is her role? Is a clinical officer?
Yeah, she's in charge of clinical service within that sub-county of the sub-county of Marigat or Baringo South sub-county.
Who is the head of TB program in Marigat?
He's called Kiplagat.
Huh?
Kiplagat, Benson Kiplagat.
Benson Kiplagat.
Yes.
Is the coordinator, is he the head of TB or the coordinator of TB programs?
He coordinates TB programs within the sub-county.
And have you followed his work as a coordinator?
Yes, we've followed up. on his conduct, especially on matters related to those cases of pre-XDR and even MDR cases within the sub-county.
Now, are you aware that this officer, same officer, has been drawing some tokens to give to those officers who are giving patients drugs? Is he drawing some tokens?
Allow me to respond administratively about the case through Madam Chair. TB program is actually coordinated by the National TB and Leprosy Department in the Ministry of Health. And through the county TB coordinators and a program called TBU, they're able to run, it's actually a program on its own. And some of those tokens and even the allowances paid to conduct some activities actually is coordinated from nationally. What I'm aware, though I'm waiting for the final report from the coordinator, is there have been alleged cases of forgery, alleged case of them not doing the right thing. Like you have a program called DOTS, Direct Observed Therapy. That is where a healthcare worker, either a nurse or a public or maybe a CHP for that purpose, is engaged to make sure he gives that drug to that patient and confirms in records. Those allegations are there, and we are to go and verify from the report from the coordinator.
Yeah, because we are getting reports that this officer has been doing a lot of forgery in all the facilities. The people who are giving drugs to these patients in Kimalel and other stations, they are not getting their allowances because this officer has already his own people he has been using, and that's why we have high number of TB patients in Marigat, and that is where you have now some patients resisting the drugs because they have not been treated well. What happened that this officer you have transferred to another sub-county and you reinstate him back again? What happened?
Through Madam Chair, I think we've not reinstated anybody. It's a case, we're actually waiting for the report, official report from the coordinator for us to act. Otherwise, it's an investigation going on. I was being informed in the morning when we were coming for this session.
Yeah, because we want to see the kind of action taken for the forgery. This officer is forging. We want to get the action taken by the fake information he has been giving. We want to know why the people who have been giving drugs to these patients, they are not given their token. Somebody is having his own team, fake team, that does not even link with the patient themselves. This is to say, this officer does not have an officer ahead of him to monitor what has been happening.
Through Madam Chair, that is well noted. We are waiting for the final report, which we can, if it's by request of this committee, will table through a chief officer of public health.
So why do you bring another officer now, Florence, to go there to that department? And we have officers like Cheserem, who has been in that department and doing good job, and then you bring another person knowing that there is something that is not good going on. Why did you bring an officer on top of officers that have been doing good job in that sub-county?
An additional question, Madam Chair.
Honorable Locales, proceed.
I want just to reinforce my colleague here that is Florence Kiborei taken to that department in preparation of what is perceived as failure by the TB coordinator, and therefore Florence Kiborei will automatically take the leadership of the coordination. Yet there were other officers who have been in that department and they were overrun by the coordinator, and therefore from your own end, the leadership, top leadership of the county, is there such a plan?
Honorable Legakmon, have you finished?
Madam Chair, These are some of the anomalies. I'm surprised because I'm one of the members of the health committee, and these are some of the issues that has been happening in the hospitals, and no action is being taken. In fact, when we talk of discrimination in this county, it is real. Because when you get somebody doing good job under an officer, you tend to bring another officer on top from nowhere to supersede what those other small officers have been doing. And when this is a trend, where an officer can forge rubber stamps of different facilities in this country, where does those drugs go? And this is an area that we need quality care to these people. TB patients need care. And TB, it is a communicable disease. And when a patient who has been a TB became resistant to those drugs, then we have risked their life. And here is an officer drawing tokens. Here is an officer getting money, and he has made some fake and some forgeries, fake information, and is comfortable and no action taken. That is how we lose our people. Otherwise, we are concerned about it.
CEO Ruto, before you proceed as well, you tell us who Florence Kiborei is. What does she do? So that you give us your input. Honorable Sharon, on the same case? Okay, proceed before CEO Ruto answers the questions.
Also, I want to be informed who does these transfers and what makes somebody to be transferred. Do you wake up one day and feel like this person is not suited for this particular place, and then you just wake up and transfer? Because we've had cases of whereby the CEC wakes up and together with the director here, and they transfer people anyhowly. So we really need to know what are the processes of transferring people.
CEO Ruto, proceed.
Thank you, Chair. I will start with the issues raised by Honorable Kakimon. The allegations.
I would like you to give us the information, if you know, about the Florence Kiborei first. What does she do at the moment before she was sent to that department, so that you proceed on the next points. CEO Ruto.
Thank you, Honorable Chair. Florence Kiborei is one of our senior clinical officers based in Marigat. Initially, she was our county TB coordinator before being transferred to Marigat. The reason as to why, Honorable Chair, wanted to start with the issues raised by Honorable Kakimon, it is because the issues are intertwined with the allegations raised. The issue of the officer Benson, I got these allegations last week about the malpractice that this particular officer, about that particular officer. Honorable Chair, the issues are so serious that we had to take a stand action. I have already instituted a team to investigate within the county, so that in the principle of fair hearing and according that particular officer also a fair chance to defend as himself, I've talked to the sub-county coordinator, Mr. Tutoek, and some of the officers to investigate the allegations, so that when we make a decision as a department, we make a decision that is informed by the facts. As we also wait the report from the national office at the Department of TB and Leprosy, we also wanted to do our fact finding as a department before we discipline that officer. Honorable Chair, that investigation is still on, and we will have a session tomorrow in the morning, as does the health leadership, to interrogate the allegations and also make a decision about that particular officer on the issues of the malpractice. The issue of Florence, we wanted Florence to be like sort of, meanwhile, because we cannot leave that department. TB is a serious disease, Honorable Chair, and we need someone to be, we cannot leave that office vacant like that.
Are there other people who are working with Nelson?
Honorable Chair, Benson, not Nelson.
Okay, Benson.
Yes, Benson, yes.
Was there other employees who are working with Benson? Allow him, Honorable Lagakumon, to give you answers.
And another officer is brought in, and the officers who have been assisting in the department. So I don't know, unless what makes Florence more.
Thank you, thank you, Chair. And the reason as to, I just mentioned that Florence was our former county TB coordinator. So she has the expertise.
Yes, former, now she works as who?
She's a clinical officer in Marigat.
Why do you remove, we were in Marigat, and yes, they are complaining of you people pulling out staff from Marigat to other departments, and they don't have doctors. Honorable Sharon, then you proceed to answer those questions.
Chair, I also want to understand, now that we have other people working with this, with Nelson, who is about to face some disciplinary action. There are other people who are working with him, like Cheserem, for example. What makes Florence more special than the rest? Are you, if you do that, are you now not promoting the discrimination that our public service people are facing in Baringo? This discrimination of people knowing who is who, and then they get favors over the others. Are you not going to promote that? And if that is the case, are you willing to rectify the issue, take Florence where she was, and have another person in that particular pool of people who are qualified and they've been doing the same job, given that job?
CEO Ruja, proceed. Okay, Honorable Laingwa.
A quick one, for motivation purpose. If people have been working and you bring somebody else, yet there is another qualified person there, don't you think you are demotivating those who have been there?
CEO Ruto.
Thank you, Honorable Chair. I want to go on record by saying that Florence Kiborei is not special. Yes, I just want to go on record, and the reason as to why Florence was given that position, it is because she's qualified. She's better qualified than the rest of the team, like Jeserem and the other team. And Honorable Chair, the decision to select a particular officer to any office, not only the TB office, it is an informed decision formed by myself, the CEC, my colleague chief officer, and the directors. We normally have these meetings and have a discussion. It is not a responsibility of only myself. It is something that we need to sit as a department and make that decision.
But CEO Ruto, you want to tell us the people that were working under that Department of TB, the person who was following Nelson on that, because they work in an hierarchy. When you have like a deputy, the people who are working below Benson are not qualified. CEO. And again, before you proceed, I want, when was Florence Kiborei seconded?
Last week.
Do you have the minutes for the same?
Sorry?
You have minutes to show the same, or is by verbal?
We didn't have minutes. We normally don't have minutes. We just have, you know, a daily routine meetings with the department.
Ruto, hiyo ni mchezo ya town. There's nobody who is being given a responsibility in an organization by word of mouth. That is a CEO who works in an hospital. You just recalled her, unamwambia aende tu.
Honorable Chair,
Daktari, you are a professional.
We don't just call people. We write letters.
Yes, and they should be minutes, because you said you sit. There is no letter that comes from one person.
Yes.
If you sit, it means it's a minute.
It's actually signed by myself and my colleague Nancy, Chief Officer Medical.
On that note, Madam CEO, confirm to this committee that the people who are working under Benson are not qualified to take that position.
I do not know their qualifications, but normally when giving promotions, we give depending on the job group.
Madam CEO, remember this is not a promotion.
Yes.
This is somebody who've done a mistake and we just want to step aside as you investigate first. So in that process, what happens? You know what we are saying in black and white? There's favoritism to Florence Kiborei. And we want justice for the people who are working under Benson.
Okay.
Because I'm sure they know what's supposed to be done in that department. And now you stated clearly that you're going to investigate on Benson. It's not clear whether atakuwa kwa makosa. So if you want to tell me you're bringing Florence Kiborei because she's an expert of what? But she's a CEO in Marigat, and Marigat already are complaining that they don't have the doctors, the CEOs. So if you remove Florence Kiborei, who takes up after her?
Honorable Chair, this is just an added responsibility. We are not taking Florence from the, she will still continue to see patients. This is just an additional responsibility. And two, it is true that there are other officers working with Benson, like Cheserem and the rest. When you look at the qualification of Florence is better, she's better qualified in terms of experience.
You see, you're actually becoming a conduit of these casuals. Because why we are here is because of these casuals. When they are at the point that they are going to get an opportunity, you come up with your own regulations. But when they were working with Nelson, they were very okay. They were working under that TB department, they were very okay. Until when this opportunity comes in, now you want to come in with your person that you want to take them to that department. We are aware of the things that are there in that department. Please regularize, Waziri, take up that responsibility, give people responsibilities. The person who Kina Jeserem have not been given that responsibility, wakashindwa, so that you say, if we give Jeserem this job, he will not do it. But you want to remove somebody who is working comfortably, is working with the patients in Marigat. You want now to remove them and take them to another department. Then what happened to that position? Please, Waziri. And these people are not saying it in black and white. Let me tell you in black and white. There is favoritism to Florence Kiborei, and please take up the responsibility. I've made a ruling. Let's rest at there, Sharon. Okay, proceed before I make the ruling.
Okay, Chair, now that Evans understands the qualifications of everybody in that, those who are working under that department, these people, how many are they that are working in the tuberculosis control? I don't know the name, but how many people are working in that department? Together with the person who is going to face the charges.
CEO Ruto.
Thank you, Honorable Chair. These officers work together.
I'm asking how many, please just answer my question so that we move very fast.
Chair, I think I'm trying to answer the question. And
how many staff are in that? Kangori is over there.
Seven.
Can you take
There are 7 officers.
There are 7 officers. So you're saying among all these 7 officers, Florence is the one that is more qualified than the 7. That is what you're saying? Yes. Okay, what are the qualifications that you are looking at when you're putting Florence against the rest?
Someone who has experience in epidemiology, and also 2, someone who has worked in TB.
So none of them has experience apart from Florence, you're saying?
Honorable Chair, I said all of them have experience, but in terms of the best suitable candidate was Florence, according to our
I'm asking
decision.
what made her stand above the rest? What made her more palatable and look like someone who is more qualified than the rest? If they all hold the same qualifications.
CEO Milka, if you have answers, stop whispering. You allow CEO Ruto to give us answers, or you pick the mic and give us the answers.
Thank you, Honorable Chair. It is because of the experience that she has in TB.
How many years of experience does she have?
She has served, Honorable Chair, initially as the county TB coordinator.
How many years of experience does she have?
In terms of...
Is somebody who is managing TB in our county, how many years?
I need to confirm the years.
You don't need to confirm, yes, because you seem to know this area so much. You are the one who said that she's more qualified. So if she is more qualified than the rest, then you know the information. And if you don't know, we'll go back to where you started lying to us.
Honorable Chair, it's true, I know.
How many years of experience?
Because myself, I'm an epidemiologist.
Okay, yes, how many years of experience does Florence have?
Honorable Chair, I need to confirm that.
Okay, how many does the rest have?
Still, Honorable Chair, I need to confirm that.
Chair, that information will need to be provided for in this house in terms of the experience and why experience and the minutes. And when you're drafting the minutes, this is not a decision that can be made by you, because this is where abuse of office will come in. And remember, Evans, don't answer these questions as a way of evading or trying to cover up anything. These proceedings are being followed by EACC, and this is where abuse of power can come in, office can come in. And if you're trying to cover up anybody, that is where you'll be caught in a mistake that you are not even part of. Or maybe you're part of, who knows if you're part of it or not. But Chair, I would really want to see the information today, because you're going to make recommendations on the same before we table a
CEO Ruto, confirm to this house that you're giving the qualification of that job, the level of for Florence Kiborei and the 7 of them, that allows you that you perceive that Florence is more qualified than the rest.
Thank you, Honorable Chair. That is well noted. I will provide the information of the 7 officers in terms of the experience and the qualification to this Honorable House by close of business today. Thank you.
Thank you, CEO Ruto. We allow Honorable Ngotie to take up his questions.
Okay, thank you. I think my question is more of finance and procurement, not medical, but I still think MedSup will assist us here, or any other person who can take this one. We are all aware that in every institution, procurement, accounts, and HR are the most important departments in an institution. And my question is, do we have an hospital accountant in PCR? Do we?
MedSup.
Madam Chair Lady, we have a hospital accountant by the name Kevin Kimaru.
Okay. Human resource?
In human resource, we have a staff by the name Dorcas Kurui.
Procurement officer?
Procurement, we have Kilinyo Ruben.
What are the terms of the accountant? Permanent, contractual, or casual?
His posting is from the county. It has a county letterhead. So he is not on hospital contract. Kilinyo is on hospital contract, and Kilinyo is a subordinate, so it's permanent. And Dorcas is
who is the accountant?
Contract. Kevin Kimaru.
I'm talking about the accountant. Yes. Let's go slowly.
Yes.
because some of us are slow learners.
Okay.
So who is the accountant?
He's Kevin Kimaru. He's an employee of the county government.
On permanent basis?
Yes.
Permanent, you are sure?
His letter came with a county letterhead, posted to a hospital
No,
answerable.
that is fine.
Yes.
But he's on permanent, he came on permanent basis?
Yes, he is.
Okay. What about the human resource officer?
Human resource officer is on our hospital contract.
Overlooking or overseeing all those who are permanent and also those who are on contractual?
I need to explain a little bit.
Please do.
We had permanent staff doing the role of human resource officers in the hospital. They worked with the same Dorcas. And then when I came there, we had an Irene Kampala. She was permanent, she was transferred. Then there was another one called Memo. She was transferred. Then now we were left with the one who was working with them because we couldn't get, and we did not get a transfer in of a human resource officer. Okay. Because our hospital has a lot of human resource functions to do. Okay. We had to do with what we had.
I think that one I will give you I-5. But have you given any intent so that you want somebody maybe to be permanent basis or something like that?
The need for the hospital we always do, and I usually do once every year, usually at the beginning of the year.
So you have done for maybe to confirm the way you have sourced the Dorcas, to confirm even Dorcas?
Yeah, okay, she's included in the list that I usually
fine.
do.
Okay,
yes.
That's okay. What about for procurement officer?
Procurement officer is a permanent staff.
Permanent?
Yes.
Okay, fine. Now, are you further aware that said officers are assigned sensitive assignments such as, I mean now the one for who is casual, but is not dealing with fuel?
Yes. Sorry?
Okay, Madam Chair, I think I have some related issues, not necessarily what Honorable Ngoti asked. One, I wanted the superintendent to tell us that is he aware that the casuals have been left to take care of them, especially overtime and even during working hours. What has he done as a SUP to ensure all due diligence is followed by all workers in Baringo County and Referral Hospital? Two, as the superintendent and the management of the facility thought of bringing in the machine gadget of checking in and checking out of staff to minimize the issues of absenteeism in that department. To Madam Chair, to the CEO, Dr. Evans Ruto, if Ruto is aware that almost all our sub-county hospitals have less or are understaffed in terms of the nurses, the CEOs, and the doctors, why do we have that state in our sub-county hospitals, especially the level 4, level 3, and level 4 hospitals? What is the required number of nurses, CEOs, and doctors in those hospitals? And more specifically, I have interest with the Chemolingot, where I'm told there are only 18, was it 18 or 8 nurses who are running the facility during the day and night hours. Can you confirm to this committee the number of nurses per sub-county hospital and COs and doctors? And what is his mitigation measures to ensure that we have service delivery in all our hospitals? To the Waziri. Waziri, are you aware of one, Margaret Kangogo, at our county health management team? Are you aware of that lady? What is her role in county health management team? What is her qualifications of Margaret Kangogo? Margaret Kangogo at CHMT. Was her role? Was her qualifications? And lastly, maybe let me receive those. I have one last question, Madam Chair, that after I receive the other responses, I can proceed.
Before I want to see their job descriptions, whether they are casuals or PNP people. So I would like you to provide information on that matter. Thank you. Proceed with the answers of Honorable Locales.
Thank you, the Honorable Chair Lady. About awareness of staff being absent from duty, I am not aware. What I know is that I have reports of staff who could be absent from duty for some reasons. And I have prepared a list of all staff who are absent during the month of April, during the month of May, which I've provided with the director on why they are absent. And what I do is I usually do 3 unannounced hospital duty rota management rounds. What I do is I have prepared a list, a table that I go to every department. I ensure who is present and who is not present. I compare with the duty rota. And then about how to manage this better. We as hospital management had planned to procure a biometric clock-in, clock-out system. However, in the process of doing that, we learned that the HMIS, the government is doing a project that will have all health management information systems countrywide. So we put it on hold a little bit so that we don't want to procure something and then the national government does another one. So in the event that this takes too long, especially from national government, we'll proceed and buy our own biometric attendance register. The appointment letters of the accountant, the procurement officer, and the human resource officer, I should be able to provide that, but I may not promise that I'll do that today because I requested to stay behind today. I was supposed to attend a function in Western Kenya, so I may be away the rest of the week after this session. So I can do that next week unless probably my colleague accepts to provide that in my absence. Thank you, Madam Chair Lady.
Honorable Locales.
I've heard the MedSoup say that the government is planning to buy some biometric machines, which we are not certain when. We even don't know if they have that budget. But the county government of Baringo has its own budget. And if that machine is bought, and the county and the national supplies, you can even request them to do in another hospital, not BCRH, if you have already installed. The more we delay in putting up these machines, is the more we get more complaints of absenteeism of staff. Because some people may be absent, giving you reasons of absenteeism, yet they are doing other issues outside. They are serving their own clinics or doing their locum outside. So, and there is a lot of complaint from inside. You know, we had time with your people over last week, or even last week part 1. We had a lot of time and we have a lot of inside story of what is happening. And when we are asking you these questions, we are not just asking you to provoke or say anything. We are asking you from a point of information. We have information of what's happening. And therefore, when I made so, I'll want the chair that don't even delay. Don't even delay buying this machine. With the help of the chief officer and the CEC, go forward and buy this machine. And we have sanity in Baringo. If we don't improve Baringo, nobody else will come and improve Baringo. And I think that's one of the, maybe that will be one of the parting shot. That if you people don't improve Baringo, who else will come and improve Baringo? At this time, you have been given this opportunity to serve at the Baringo. And the people of Baringo have a lot of confidence in you, and we are waiting to see the difference. In fact, when Dr. Solomon was coming in as a CEC, the people of Baringo had a lot of confidence. And I can tell you, my brother Solomon, people are losing confidence. It has taken you long to do some changes. But it's not yet too late. You can still initiate some changes and make the people of Baringo happy for what you are doing. So I'm still expecting my other responses. That's about Mersup, and I'm done with you. Thank you. I'm done with that one. So the other questions, Madam Chair, to proceed as I asked.
Waziri, proceed to point whoever is going to take charge.
I think I need to clarify something about the accountant, the one based at BCRH. Actually, that accountant came to replace somebody called Cesar, who was the health accountant department, but is domiciled at BCRH. And it's the same Kimaru, who is in charge of accounting in the health department, but he sits at BCRH. The other question is about Margaret Kangogo. I know her. Margaret Kangogo came to the department through a posting order from the office of the CS. There was one who swapped with her. And she belongs to county health management team because a human resource, somebody who is in charge of human resource in the department should belong to the committee of CHMT. About our qualifications, that one I don't know. Actually, the other issue is about performance of health. Because BCRH, if you compare it to 3 years ago,
How do you accept those people? You give reasons why you don't want to lose your people.
But for the accountant,
You and record.
It's part. The posting is done under the
Like your HR that was there in that office, that small office down there, who was there before. Even Madam CEO would like to know what happened. Why did you transfer her?
It was not us. We just found she had been transferred and there was a replacement. So you know.
I'm asking because that you are aware, you don't know who Margaret Kabogo is. She's a teacher by profession.
That's right.
Now I'm informing you. Number 2, the HR that was transferred from your department to agriculture to do what? Yet you are the department that really need an HR issues. You have the most casual workers, you have the contractual. Why did you transfer her? I can see Madam CEO want to take up that matter. To respond. by saying that the changes was done by HR, Director HR, the main HR for the county. Who is the main HR for the county? Rotich. That is obvious, yeah. Rotich. Okay. Yeah, now can I proceed to answer the question?
There is a gap left, and when the postings of staff within PCRH, inside or outside, that's my big question. Is it always done without your knowledge or with your knowledge?
Thank you, Chair. To Honorable Locales. Locales. Now, we only have control over the professional staff, the medical staff, but there's other staffs, it is taken up by the human resource.
So as a chief officer in charge,
yes,
what basically is your role on issues of employment, issues of transfers, issues of cross transfer from even one department to another? What's really your role? Because I understand nothing can be done without consultation with the chief officer in charge. Like today I cannot wake up from the director HR and say I am moving so and so from Baringo to Marigat without consulting the department responsible. Can that happen in Baringo County?
Chances of happening are yes. However, when transfers are done, it's normally brought through to CHIRAC. It's approved. Suppose that is the way. It's supposed to be approved through CHIRAC. However, I cannot rule out. Sometimes there could be an anomaly somewhere.
Okay, so for Margaret, it was not through CHIRAC.
Yes.
So it was through the county secretary.
Yeah.
Thank you.
Think so.
Thank you. I think that's a very important information. No, the letter from that Margaret had. Was it posted by HR or county secretary?
I cannot confirm, but I found her there. But
yes.
Through HR.
Through HR.
Department. Yes.
So we can say through HR and the county secretary know better about that question. So that we proceed.
Yes.
Okay, maybe, thank you. Daktari has mentioned about improvement of our facility. Daktari, I want to disagree with you. Improvement is not on monetary. If today we decide to collect revenue strictly, that's not improvement of Baringo County Referral Hospital. Improvement is on service delivery. Service delivery. Are people getting service, reliable services in Baringo? Are people getting treatment? Are there surgeries done in Baringo successfully that people can say this was done? I think with the CT scan machine that came the other time, that one improved on issues of revenue. But I still feel, on my personal opinion, on issue of service delivery, we are not yet there. You still to up your game as in charge of health, so that we can be in par with other counties. You are up to the task, but I think there is a lot of laxity somewhere. That's my own opinion, not of the opinion of this committee, but my opinion. After observing, going around our health facilities, doing observation in those health facilities, there is still much to be done. Do you have anything to say about that?
According to me, I don't know what.
That is Waziri. We don't have to go back to those pinpointing. Honorable Locales have raised his points. It's take-home points. Honorable Sharon, I don't know if you want to.
Not yet.
I wanted to know if Honorable Sharon want to make a comment over your issues, or it's a new thing.
questions.
Okay, please, CEO Ruto, proceed so that we go back to Honorable Sharon.
On our sub-county hospital and staffing.
Madam CEO, please proceed.
I'm the one in charge of the sub-county hospitals. That's why I'll take it up.
Thank you.
Not CEO Evans.
Okay.
So thank you. So you asked about the nurses, and I really want to appreciate that note, because the number of nurses that we are having in the sub-county hospitals are very few compared to the ratios required by WHO. Now, like for Chamalingot, where you have the interest, we have only 8 nurses.
Imagine.
It is 8, but it is supposed to be 20. When we come to the general picture about Baringo County is that we have 488 nurses to take care of all the 232 facilities. So it is true, we are having something I can call serious shortage of nurses. And it is really, if it is well, then I think all the arms should come together and look at this issue. Because in the very near future, like now in BCRH, when you check on the ones who will soon be exiting, the nurses, there are so many. And in the year 2030, we'll be having a serious one. So if we can come together, maybe shut down some projects and give a priority to the department and employ the nurses. We need over 2,000 nurses to man Baringo County. We have 488. This is a serious shortage. So Chamaligot, you have 8, but you require more than 20 nurses.
Honorable Locales.
Yeah, so that I may conclude on that question. Thank you, Madam CEO, for your honest response. Now that, let me dwell on issues of nurses. Let me not go on issues of doctors and CEOs. On issue of nurses, how many nurses have gone for retirement or even exited service recently? How many?
I do not have the record with me here, but with the number of the intern 17 that we gave for employment, we divided by 2. Then that will be around 6 or 7, because for every senior nurse who retires, we replace it by 2. So if I will use that, I want to assume, because I do not have the correct number. So we can say around 8. Yeah. Who will be exiting between December and this June. Now, between June and the coming December, we will have another number exiting.
So let's say those who you were intending to replace.
Yes.
Are already those who have exited
No,
up to June.
Yes.
Up to June.
Yes.
I'm in concurrence with you.
Yes.
So as now the department, what is your plan? Because those who have exited are few compared with the number that we are already below in terms of staffing. We are less. What is your plan as a department to have more nurses employed in Baringo? And through any way, through convincing the governor, through affirmative action, through whatever means, that convincing the treasury to have budget, just like the case of the ECD teachers recently. Have you thought of even using your committee, the committee on health, to take up this issue? Because now it's becoming a county problem.
Yeah.
Understaffing of over 1,600 nurses. Understaffing, that is a serious issue. That's why we even say we need services in Baringo, and yet we have the major problem is staffing. We don't have the people to help us serve these people. That's why even we have a lot of number of casuals in our health facilities, in our level 4, level 3, and level 5, which we are still yet contesting. So I think there is what is really your plan as a CEO and the Department of Health to have more number?
So, one is through replacements.
That's one.
Replacing those ones who are retiring. And then two is to appreciate the effort that this house has done. We have several number of honorable members in different wards who have set aside some amount of money to assist us contract and pay some staff in those facilities. And the third one is that we have really spoken about mass recruitment. That's why I'm saying if it is well that all of us, I mean both arms of this government, to come together and put aside money the way they did to the ECD teachers, the agriculture department, and health actually should be a basic need in our county. So if we can come together and forego some 1, 2, 3 and give priority to this, then we will be able to employ.
I think also you need to be very meticulous on this as a department to convince, use the power of convincing. I don't want us to dwell on that. Now let me finalize with my question on still issue of nurses. Why is it that when there was a last recruitment last year of around 8 or 9 nurses, the nurses who have been volunteering in our hospitals were left, and those who are just finishing from service were taken? Whose fault was this? Do you always recommend even those serving in those dispensaries? Like, and I can tell you, we have nurses who are volunteering without even a pay in some of our facilities like dispensaries. They are volunteer for 3 years, 4 years, but when employment comes through the Public Service Board, what is your advisory to Service Board? Because you bring somebody who has finished school 2 years, leaving somebody who has just volunteered for 5, 7, 8, 9, 10 years, either in Baringo Referral Hospital, either in Chemolingot, either in Ravine or Mogotio, or even a small dispensary at Saimosoi. Why is that happening?
Through the chair, this is sad. I want to accept it is sad that when we do employments, others are taken, leaving out those ones who have been assisting in the hospitals. We have discussed it in Chirac, Chief Officer is here, and we have agreed, one thing that has been agreed upon, that in future adverts, it should actually mention the hospital.
Yes.
So that in that hospital, if there is a nurse who has been working there, they give priority to that nurse. So that is at least something that we have agreed in Chirac.
And,
then the other thing is,
and are you able to transmit that to the service board or county secretary?
The CS is the chair of Chirac, so
Yes.
he was there. He was in agreement with us. Now the other thing is, this is what we've been saying, and I've said it personally in Chirac, that if it is okay, can we do an internal advert so that we take in those who have been, in the system. But then the answer that I get sometimes is that when we do the internal advert, then we will find ourselves taking maybe nurses from the same region. And we need, the regional balancing. And we said at some point that can we one time make that mistake once and for all so that we absorb and then now move on.
Okay, Madam Chair, I think I'm a bit satisfied with how far the department or the CEO have taken this issue to Chirac. But now the problem, my biggest problem is, will Service Board implement? And have you written, the Chirac, have they written to Service Board informing of this workable formula of mentioning if today I need a nurse at Concord dispensary in a correct, the entire correct division, that we mention Concord dispensary. And if there is somebody who has been volunteering in Concord dispensary, we get somebody who has been volunteering being taken. Will the service board, in your own words, will the service board honor?
Madam, we work together. So when we give that advice, I'm expecting the board to accept, because now there are places where even when you want to send someone, they don't want to go. So we want to adopt this, and working together means that we should come into agreement at some point. And so board should not have a problem, and if they will, then we will, I don't know, because we have not discussed it, so I cannot say if they will have a problem with them. But with Chirac, we are done.
Thank you, Chair.
Honorable Sialo.
Thank you, Madam Chair. I have about two short questions. Number one is to Waziri and Madam Nancy. There was a staff that was transferred from BCRH, the Department of Pharmacy, to Mogotio. And there's a complaint there in Mogotio that she has not reported for about 8 to 9 months. Are you aware of that case? And if you're aware, what have you done to solve it? Number two is about a concern that has been raised by the junior medics in the Department of Health, that on the issue of career development, you as the leadership in that department are biased. You're only considering those who are senior medics, doctors, for study leave. But then these are the junior officers, that the nurses, the clinical officers in various departments are not considered for those career development courses. And again, they say that when there are these donor-funded trainings, you always consider yourselves at the top. You go for those trainings like for malaria, TB and others. But then those who are actually doing the real job, who are actually supposed to get those trainings, the nurses at the dispensaries and the level 4 hospitals, are left behind. So that you go and draw the per diems, you enjoy, but the people who are doing the real work are left behind. Yet they are the people who are supposed to get the new trends of the diseases that are developing, and probably how to handle such cases. So why is it that you consider the top for those per diems and those trainings, the honor-funded trainings, and then why is it that you only consider those senior medics for those career developments?
Waziri, proceed.
About the officer who is a pharmacist called Pauline, I know she was transferred from BCRH to Mogotio. What I know is that she had some medical condition that she needed attention of a doctor in Nairobi. That's the last time I knew about her. When she came back, she was given leave to be attended to by a psychiatrist in Nairobi. So I think who knows further about her absence?
Honorable Sialo.
Thank you, Madam. Just some more clarification. What was the reasons of transferring her to Mogotio? Was it on medical grounds, or what was the reason? Was it because of some malpractice?
No, not for malpractice. One was that we had promoted a pharmacist to be a medso, so she was going to take that position. And also,
is that true?
Kindly be on record. Waziri, pull down your mic.
Yes, I want you to be on record, because
yes,
we're asking what we know.
Yes.
We are informed. When we ask such things, Dr. we are very informed. Okay, proceed.
Yeah. So she was going to take over from Dr. Wanaina with the MedSub now in Mogotio Sub-County Hospital. And she was also transferred because she had requested that she want to be out of Cabernet from some social issues. I don't want to mention them. She wanted to be far from this town. And also she wanted proximity to Nairobi to seek medical attention. So I'm sure there is some documentation about the sick of and our whereabouts currently. I'm sure.
Daktari,
yeah.
Why is it that until I raise that issue, is when now you, as a department, wrote a letter indicating that she has health issues, but you've confirmed here again that you released her on social issues. Social issues means it could be a lifestyle issue that has affected our service delivery.
Yeah,
now,
it was going to affect.
For 8 months, 9 months down the line, she's not on duty. There was no replacement. My people are suffering. The department, the pharmacy there now, at night, they're not dispensing drugs at night because there's nobody. Those who are there, few, they're working during the day.
So I want the details to be given by the CEO, because when I was on, what's it called, on Kokwe last week, I saw her as the county pharmacy, although we never talked. So more information I think should come from.
So, Dr. Sirma,
yes,
you said you released her on medical grounds. So how did you find her in Olkokwe?
It's last week.
Dr. Let's be sincere.
Yes.
You know, I'm elected to represent my people.
Yes.
And that is where now we will get issues with you. My people are not getting services. They are not getting drugs at night. Just because you did your local arrangement and released this lady. It's only until yesterday when you knew that we were on this case that you tried to act. Why are we doing this, Madam Nance?
Madam CEO. Thank you, Honorable Member. Through the chair, it is true that at some point, I think, not even yesterday, I think you called way back, you informed him about the same. But before then, we had the information, and to be sincere, I had called the MedSup there to give us a report about the lady. It took some time before writing the report, until I think until beginning of mid 5th May, around May, then he responded. But then through our phone call, he tells me that he is unable because, you know, the lady has a lot of issues, social issues. Yani sometimes she anasema sijui kuna watu wanamfuata. She has some psychological problem and she's undergoing treatment, and like kind of like he had some human heart. Maybe he said over the phone. But then I said, please document and send. Now we have the documentation plus supporting documents from our doctors.
Okay, so you confirm that whatever I'm saying is true?
Yeah, you called.
Then the one that Dr. Sirma met in...
she has resumed work, I'm sorry. Let me finish. She has resumed, I think like 2 weeks ago.
So she's on duty. When I go to Mogoti, I'll find her.
2 weeks.
Madam, when I go to Mogoti, I'll find her.
I assume so, because that is the report from the MedSup.
Because if that is my situation, if I appear in Mogoti and she's not on duty, then I suspect now you'll carry the burden. You'll be held responsible for that.
That's okay.
Okay. Now, there's the other issue I've just raised. You can answer that as I check what my colleague is trying to communicate.
Proceed. Which one was that? I talk when he wants the answer. I continue?
Wait.
Okay.
Madam Chair, I've just received an information that, and I told you, Sirma, when we ask these things, we're asking out of information. The information reaching us is that the reason why that lady was transferred to Mogotio was because of a fraud that happened in BCRH. The BCRH lost 34 million. And instead of dismissing her or even subjecting her to disciplinary processes, you decided to transfer the problem to me in Mogoti. Transfer the problem to the people of Mogoti. Madam, you guys, are you really fair?
Thank you,
Just before you respond.
Okay.
Yes. And an additional information reaching us also is that this particular lady is a wife to one of the senior persons working in the office of the governor. So the department decided just to cover up by sending this lady to Mogotio. Now, what happened and where the money that was stolen? Did you recover the 34 million before sending her to Mogotio to bring problems there?
Okay, I do not have a good answer for that. Maybe the director could have a better answer for that one.
Yeah,
but allow me to just answer the first one that you talked about, why we release, why it's like we are giving more favor to the medical officers to go to school and the junior staff. We don't seem to favor them. I want to answer that one. And then for the case of Pauline, I will allow a director to answer because he's been there longer than I, and I found her already not in BCRH. So for the medical officers and the junior staff, I want to confirm that we as much as we're talking about giving permission to doctors, I want to say that, you know, when we are approving someone to go to school, it is only allowed that if you are doing something above, like master's degree, you know, the government can sponsor you in form of time and even sometimes money. But when you are doing a basic degree, then the government, they used to do that until, I don't know, some point. I cannot say until when, but the policy changed. And then now, if you are going for a basic degree, the government cannot sponsor you for that. Unless you take maybe an unpaid leave, then you go to school. But however, I am aware of some nurses who have been released to go to school for higher diplomas and diplomas.
Madam CEO, before
Yes.
you proceed to give the mic to donate your time to Kangor, I would like to know if you know about the fraud. Because you seem to be honest, your answers have been very straight and genuine. I want to know about if you know that fraud of the state
Sijawahi
pharmacist.
sikia. By the way, I've never heard. Sijai sikia.
Okay.
Nasikilia hapa.
Kangor, proceed.
Through Honorable Madam Chair, personally, I'm not aware about the 34 million fraud. Maybe we'll find out. That is being honest. In terms of Pauline being available, last week we were able to visit Mogotio, and she was actually with us in Olkokwe because I was with Waziri. And I believe she's back.
Honorable Sialo, on that matter?
I think Madam Chief Officers has accepted to bear responsibility. And I guess also Dr. Kangor is following suit. If we find that that lady has not reported, the two of you will be held responsible. True. I think that one we are in agreement. Number two, on the issue of the scandal, you two are not honest. We have memorandums, we have formal communications to us on that particular issue. That's why it has been raised. So I'm asking you again, are you going to bear responsibility of this fraud that you've failed or refused to disclose? I disclose. I want you to be on record, Dr.
Yeah, honestly, through my Madam Chair, I'm not aware.
I can see Waziri want to say something about that issue.
The fraud, I have not heard about it. I think because you talked of BCRH, I think Dr. Bakalo will be in a position to confirm to us whether there was fraud.
Dr. Abakalwa, are you aware?
Honestly, if there was any fraud of even 1 million or 2 million, I would be aware. 34 million? I don't know that.
Let's leave alone with the figures. Is there a fraud?
None that I know of.
I want to be on record.
Yes.
And you're the medsup.
Yeah.
What was the reason of transferring that lady to Mogoti? Can you be honest and sincere? Because now we are going to a different dimension.
Okay. I can only account for her transfer from BCRH. She was transferred from BCRH to the county health management team. And
when was that transfer?
I think 2022, 2023 thereabouts. And when she became the county pharmacist, then now that is beyond me because she was in the county health management.
Okay,
I can see Madam CEO as a concern.
It is a request. We had requested earlier to be, wacha nisifika hapo, nilitaka kuombea ruhusa Bakalwa and the admin. They are supposed to be in Nakuru. They were supposed to meet the auditor general in Nakuru by midday today. We are supposed to appear in Nairobi on Wednesday, and they had made an appointment with them. I wanted to request, if it is okay with you, we will try, if there's any question before they leave, if you allow them to leave, then we will appreciate, so that they will be able to meet.
Dr. Abakalo and admin, proceed.
Madam
At
Chair.
least you appeared last week.
I seek your indulgence.
Okay. Any question to Dr. Abakalo and admin?
I want them to confirm something. That before the lady was released, or really after the lady was released, was there an internal audit, forensic audit that happened in the department?
Dr. Abakalo.
That is released from our hospital.
Yes.
You know, when she left our hospital, she was appointed as the county pharmacist. And for us, audits happen in BCRH every time. So I may not know if there was one that is attached to anything. In fact, we are audited average more than 6 times a year. So
we asked you about this thing.
Yeah.
The chair was even fair and said, let's leave about even the figure that got lost.
Yes.
Any fraud that happened, all of you have denied. Now we've gone deeper into the thing now. I'm asking you, was there a forensic audit that happened?
Audits do happen. I'm not sure which one.
No, you cannot be. Dr. Be honest.
However,
don't tell us you're not sure. You are the medsup. Every time an auditor, either internal auditor or external auditor, comes to your facility, you must be informed, and the entry point for that matter is your office.
Yes.
So you cannot tell us you don't know.
But I can't say I know what I don't know.
Okay.
What I know is the only time that we had what I can say a theft, it occurred about some commodities. And this I reported to the DCI. They did their investigation. I could not hide that one.
What was the cost of the commodities that got lost?
I do not know, because those who did the investigation.
I'm saying the value.
I will need to confirm that.
Dr.
But
if it is a you reported. So what did you report? That which commodity had gotten lost, and what is the value of that commodity?
I reported that there are some commodities which the in charge of a section said he received, and there is a discrepancy in what was actually recorded as received.
So, can you declare what were these commodities that got lost?
They were, I think they were test kits, HIV test kits. And that one, I found myself to be not qualified enough to do an internal investigation. I had to involve those who are better qualified. That's why I reported to the DCI.
Okay, maybe, Madam Chair, as you release them. So, you've heard of the audit that has been done. So, if we provide this list, the audit,
yes,
and the findings of the audit, are you going again, accept to bear responsibility?
I think, Honorable Sialo, let me help you so that it looks fair enough as the chair. Daktari, earlier you had alluded that you are not aware of any fraud. Now, the fraud that Honorable Sialo is talking about is about the lady, the pharmacist, who was there. Now at least you said there was a fraud and you reported. If we go finding with our own fact finding,
Yes.
and find out that the said lady
Yes.
was involved,
Yes.
are you ready to bear the consequences?
My responsibility there was very clear. When I noticed that we had this theft, I reported to the DCI. The DCI have not given me any report subsequent.
There's no problem, Daktari. The only thing Honorable Sialo is asking is we are going to do a fact finding about this issue. And definitely all of you knows you're just trying to cover it up. And was it lynching the department of that lady?
Honestly, I have absolutely no name attached to that.
Thank you, Honorable Sialo.
It's good they've confirmed that there was theft. But I want to ask, you reported, right? So you expect the DCI to take action on their part. Now, on your part, as a medsup and the HODs who are here, what actions did you take against that person or those two people who are handling those equipments and those drugs? As you wait for the action from the DCIO, what actions have you taken yourself? Do you still have that person, or you went ahead and transferred the problem to Mogotio?
You see, I said this and I want to say again. When I reported to the DCI, I did not have any name that I could directly link to that theft. So I expected the DCI to give me a report. Then I can know so and so is
Madam Chair, I think Wabakolo is trying to take us in circles. Can you be honest, or we just chase you now?
I will accept to be chased
Because
I'm being
how do you report? Now, which department was it responsible?
Pharmacy, procurement.
So that pharmacy does not have a person who is in charge?
Yes, we have an in charge, we have procurement, we have stores, and they were all investigated.
If that person who was in charge, instead of you reporting that person or even dismissing or putting her through the disciplinary action, you decided to transfer that person to Mogotio to come and again bring problems there.
When I reported to the DCI, I had to get a report from the in charge reporting that we have a theft. That is what I used. So when I inquired what is happening and I did not get a name, I used that letter plus my covering letter to report to the DCI.
Did you report to the department?
Yes, in fact, even our CEC told me, such a matter, please take it with the police.
What was the kind of report you made? Was it a formal?
Yes.
Was it written?
It was written. I even have a copy of the DCI receiving my report.
Madam Chair, I think we need a copy of that letter. That was written to the department first of all, and then the one you made to...
No, I did not write to the department. I wrote to the DCI, in
DCI,
consultation with the CEC.
Now, are you reporting to DCI or reporting to the chief officer?
Well, you know, this is a matter...
Because you cannot just go directly without the involvement of the chief officer.
Maybe there was a lapse there. However, the best I could do is to arrest or to find out the root cause through investigative organs, which I did.
Dr. Let me ask you something. If something got lost in your office, a valuable commodity for the government in your office, who's going to be held responsible?
The medical superintendent.
Yes. So in this case, this lady is in charge. Some drugs got lost, but instead of even holding her in that capacity for investigation to go on, you just decided to transfer that person.
By the way, the in charge of pharmacy that time in our hospital was Dr. Chebon. And the letter that I used to go to DCI was signed by Dr. Chebon, if I'm not wrong. But I'll bring it. I'll produce it. And we can even go get a copy from DCI.
Who is Dr. Chebon?
He left the country and he's away for study, and I think He left the country for studies.
And who is Chebon in the governor's office?
No, I'm talking about Dr. Joseph Chebon.
Oh, this is another Chebon.
Yes. Yes.
Chebon.
Yes.
Okay, okay. Now, what informed the transfer of this lady when an investigation is still ongoing?
From BCRH to become a county pharmacist, surely that is the decision of the county.
Not you.
Not me.
Madam Chair.
Yeah, because
I can
now
see
she became
admin.
my boss.
I can see admin want to say something to save the med soup.
There was the question that if something happens in the hospital, as it is reported to our bosses, we work very closely with the national government, the police, the DCI on many things as an hospital. So it is not really honorable. Sometimes the MedSup can communicate directly to the DCI or to the police. There are so many other things. Like sometimes a patient can run away because of maybe the person is mentally not correct. We report to the police. There are so many things that we work with them. Sometimes it gets to our bosses. Sometimes the MedSup does it. So by approaching the DCI on that incident, Honorable, may not necessarily have been that he usurped the powers that be. So that is a clarification which I wanted to make. And many times, there are things that we do with them very closely, and when some patient runs away, we inform them, then we help each other to bring that patient back. And
Now that admin you're here, are you aware of the fraud?
I'm not aware. No, I'm not supporting Mheshimiwa. I'm just clarifying something on the issues that maybe the MedSub approached the DCI. There was one casual who was involved in fraud. We got the casual. We dismissed the casual. We reported to the DCI, and the case is ongoing. So that is a different issue altogether. So it has nothing to do with the one that you are alluding to.
Honorable Cielo.
Thank you. I think, admin, you've confirmed that it was right for Dr. Bakalo to report, even if it was not through the department. So, what do you think he was reporting if you are not aware?
Be on record.
If there was a fraud and he reported it, indeed he shared with me about that. Although I was not in the hospital, I was not in the hospital.
Madam Chair, I think, thank you. You've
but
confirmed.
the way he mentioned it, it's exactly what happened.
Okay, thank you, admin. I think you had misled this house, but again, you've confirmed that he told you that there was a. And then why were you denying? Okay. I think that one we are in agreement, Madam CEO and your colleagues.
Before you clear, I don't know now if the MedSup left to where he was supposed to go, or he's still supposed to come back. Be on record.
Madam Chair, he's still coming back.
Okay, noted. Honorable Cielo.
Thank you, Madam Chair. I wanted to inquire from Madam Chief Officer and his counterpart if that issue was brought to your attention, and if it was reported to you, what were these commodities that got lost? How many drugs, which kind of drugs, which items were reported to you that they are missing in the pharmacy?
Through the chair, I am sure this incident happened before I was posted.
Our CEO, Ruto, you were there. Take up the matter.
Thank you, Honorable Chair. I think that issue falls under medical services department.
But you can't tell me, CEO, when such a fraud happened, even in your office, you've never heard about the fraud. You may not have the details, but did you get to know about the fraud?
No, Madam Chair, no. I did not
Was
about
it?
the fraud.
About the casual, that one he told me verbally. Not the Dr. Pauline, but for the casual. He told me there were not non-pharmaceuticals, and he had already reported to DCI.
They are failing to disclose the items that was stolen and the drugs that were stolen. And I think that is the information that is in the report with the DCI. So I didn't know why the guy didn't want to disclose the other drugs that got lost. And at that particular time, we've confirmed the person who was there was the lady that he transferred to Moguti. And the only disciplinary action, I don't know if it transfers a disciplinary action or something. The only thing you've done is only to transfer to Moguti because there was a fraud at the pharmacy where he was heading. So was it right for you to transfer this person to Moguti where he has committed the offense?
Dr. Bakado?
Firstly, I do not confirm that I transferred this officer. This officer that you are talking about was working in our hospital and was appointed as a county, or maybe she was county, the pharmacist. But the person who was in charge of hospital pharmacy brought me the report, and I used that report to have the matter handled this year. So at that time, we have documents to indicate what was stolen, indeed, what was missing. But I said, to quantify, I'll have to confirm, because I have documents to that effect. That's all, Madam Chair.
Dr. Before the lead was transferred to the department level, was that incident after or before she was transferred?
It may not be very clear to me, Madam Chair Lady, because even when she was in pharmacy, most of the time her office was at the hospital. And even the current county pharmacist usually sits at an office in the hospital.
Okay, when was she transferred to the department? Which date?
I may need to confirm. Yeah.
Okay, when did you report that the hospital lost items?
I will need to confirm because I have those documents. If I'm given time, I can produce those. I can produce the date, when it was reported, when they were delivered, what were the quantities that were delivered.
I think because you refused to disclose, let us find it out. You just table the documents, the report that you reported, any formal complaint that you passed through the department, the chief officer's office, and we will find out the rest. Thank you, Madam Chair.
I think we allow Dr. Bakalo and the admin to leave so that the CEO said they will take charge of any question that is going to affect them. And Dr. Bakalo, can you get us the documents? I don't know when now that you are busy.
The soonest I can do that is next week. That probably Monday.
Next week when?
Monday or Tuesday.
Let me give you Tuesday at 10 a.m.
That's fine.
Thank you.
Thank you.
Honorable Sharon, kindly we wind up so that we...
Yeah, owing to the time that we have, I'll be very straightforward in my questions, and if I ask a question, please, let's just be direct. And I'll proceed to ask the CCM, you can put your mic on the issue of transfers. What really guides the transfers? We know that the county public service board, they usually do certain level of transfers, and there are ones that you do as a department. What really guides you? Do you have a policy, or you just a guideline, or you just wake up and do things as you want?
We do within the department, but interdepartmental is done by the county secretary.
And actually put your mic very close, because we are really losing you.
I'm saying,
yes,
within the department is done by the chief officer, the two chief officers, the director, and heads of programs.
Okay, do you have
the
a policy?
person who is interested?
Do you have a policy?
No, we don't have a policy.
Do you have a, okay.
Yes.
Don't you think that there is a risk of having a politically motivated transfer, or when you just when you get irritated with someone, can just wake up and make arbitrary transfers? And in that regard, I've done my research. The other counties that they do have policies that guides transfers. You can check as the head of that department, Kisumu, they do have one. Muranga, they have one. You can actually check, and probably you can start working on a policy on transfers. Another issue is on that one for Florence. Waziri.
Yes.
We understand that the Department of TB, they get a lot of funding. Do they?
Although now it's going to reduce because
okay,
of
but
the stop
in
work.
the past they used to get a lot of funding.
Yeah.
Okay, so even when you are adding someone another role,
yeah,
you've said that it's actually not like you're transferring this person, you're adding this person additional role.
A responsibility.
A responsibility. You're also giving this person a mandate. You're making her a bit. You're giving her some level of control, because she's going to control her department with a budget, right? Right?
In terms of, the kind of money that she gets is for supervision.
Yes.
Mostly, yes.
And then there's an additional money that's going to get.
Yeah.
Okay.
Yeah.
I really want to see by close of business, I still want to see the procedure that you used to actually give that lady that particular job. Waziri, yes. On the issue of level 5, what was the intention of whoever, is it you, the governor, or yourself, of calling our hospital level 5 when it was level 4? What is the intention?
It's not me.
It's who?
Yes.
It's who?
It's in the website. But it's not me. Okay.
Who controls the website? Is it done by somebody who is outside the hospital, or someone who works within the hospital? Is it a property of the hospital?
It's the communication team from the governor's office.
Is the website a property of the hospital, or is it?
It's for the county.
Website?
Yes.
Who procures the website?
I know it's the county website. It's a county website.
At this point in time, I wanted Evans to actually answer this but you can go back. Let me go. Nancy, who procures? Is the website a property of the hospital, or is it the executive? And remember, this is something for our website to be developed. There's a budget that is put and it's paid.
I think Honorable Sharon, I want Honorable Lakales to be clear on that issue of where the posting was done. Is it at the health?
I have checked.
It's on which?
It's actually, I've seen. It's the hospital's website. And I'm even seeing the CEC there taking oath. I've seen his photo and the rest of the CEOs. And saying what is it,
Honorable Sharon?
So I'm asking, is the website the property of the hospital? And you know, if you don't have an answer to that, you are responsible. You are the CEC. You are the CEO. You are an accounting officer. That money is paid yearly. There is a subscription that is paid by taxpayers' money. So you should not say that you don't know. Ignorance at this point cannot be a defense.
I am aware of the website.
Yes.
Not that I'm ignorant.
Yeah.
I am aware of the website.
Yes.
But the subscriptions, I have not paid.
You've not paid?
Yes.
It's paid, when did you come to the office?
6 months ago, December.
Or probably it has not expired, but usually it's something that it's paid yearly. So, at this point in time, I'm wondering, what was the intention really? Like, it's something that really puzzles me. Because according to the law, misrepresentation. Let me read to you, Daktari. The Social Health Insurance General Regulations 2023 explicitly states that misrepresentation or providing false, incomplete, or misleading information may constitute medical fraud and attract legal penalties. At this point in time, who do you want that? Who is the person who should be liable of misrepresenting to the whole world that Baringo County Referral Hospital is a level 4, level 5 hospital? Okay, just put on your mic, please.
Is domiciled at the communication office of the governor for all the information.
Are you
even for speeches of the governor?
We have the executive, we have a website that belongs to Baringo County government.
Yes.
That is where we get all the details of the governor, his speeches and everything.
Yeah.
And then we have this particular one that really talks and shows the mission, the values, the mandate of the hospital. So there are two different websites.
Is it the hospital or the county department?
Is the hospital, the department of your department. Your department.
Not there is a difference between the hospital and the Department of Health.
Dr. Sima, do you want me to show you the website? And at this point you want to say you are a CEC of that department, you're not aware of the website?
You see, if it was, you know, I don't look at the budget all the time of the hospital, but I know the budget of the department. And I've not seen anywhere where we pay for that website.
Okay, so at the end of the day, somebody should, I've seen it's the county government of Baringo, the county of great diversity, health services. That is where they are saying that the Department of Health, whatever, and saying that BCRH is, that one I need to withdraw and apologize. The person to be blamed for this mistake is the governor of Baringo County and the Office of Communication. So because, Chair, such level of misrepresentation, you know, by the time they're saying that this is a level 5 hospital, it means that we have this, we provide these services, we have expertise on this and this. So somebody can actually come to a hospital thinking that they can get this service, yet it's not the case. So we are misrepresenting to the public. So that is something that we need to take note, Chair, that we are lying to the public. The governors, the executive is lying to the public about the status of our, we call it referral hospital. After, maybe it's not a referral hospital anymore.
Honorable Sharon, we've noted your concerns. Waziri and your two CEOs. you and Kangor, thank you for coming. And there are so many issues that we've noted. We will still do follow-up. The whole county is watching, and all of us has to go back and at least do things right. What we pointed out here should be taken seriously, and in our next session we should not ask about them. Thank you so much. Sergeant Atam, walk them out. Dr. Ruto, I've made a ruling. County Secretary and your team, welcome. I'm Jeruto Kipchala, Chair to the committee, Public Service Ad hoc Committee. My members, kindly introduce yourselves.
Thank you, Chair. I'm Honorable Sam Locales, the Vice Chair of this committee. Thank you.
Thank you, Chair. My name is Max Yalo, MCA Mogotio, and a member of this committee. You're welcome.
Ainkwa John, member of this committee.
Mheshimiwa Leka Kimon Wesley, MCL James Ward, and member of this committee.
My name is Sharon Keter. I'm a member of this committee.
I'm Julius Ngotier, a member of this committee.
David Sitoi, a friend.
County Secretary, please proceed to introduce yourself and your team as the legal officer prepare them to take an oath.
Chair, Honorable Chair, and Honorable members, my name is Dr. Chip Kwanya, the County Secretary Baringo.
Chair and members of this committee, my name is Roti Chandru, Director HR Baringo County.
Chair, honorable members, my name is Francis Ayabe, County Payroll Manager.
Chair, my name is Julius Beth, the Chief of Staff.
Proceed, Wakil.
I, Dr. Jacob Kuruichepkwany, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I, Andrew Kimaru-Rotich, do solemnly swear.
Please be audible.
Sorry, Chair. I, Andrew Kimaru-Rotich, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God.
I, Francis Kiborei Ayabei, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I, Julius Kipkulei Bet, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God.
Chief of Staff, kindly proceed, and you can sit down as well, and inform this committee your responsibilities in this government.
Thank you, Chair. As I said, my name is Julius Bet, the Chief of Staff, and in the county government, my responsibility is to be in charge of the government staff, organize his diary, itinerary, office, the official residence, vehicles, and any other thing that assists the governor in his daily discharge of his duties.
Mr. Bed, do you have any powers to employ?
No.
Where did you get the powers to terminate the contract of the 4 staff working at the Department of the Devolution?
I don't think I terminated anybody's contract.
The request you made them to be terminated. And are you aware of that letter?
I'm aware of the letter.
Proceed to explain to this committee.
the request that I made in that letter was not about terminating, because a contract is self-terminating. The contract of the said staff ended on the 31st of October 2024. But due to some issues here and there,
which issues are there here and
maybe
there?
I'll explain about I'll explain. They didn't leave their workstations as expected at the end of their contract.
Was it your responsibility to note that their contract ended?
It is my responsibility. But some of the staff had been moved to other departments. So when they kept on working, I may not have been aware. And when I became aware, that's when I did request that since their contract had ended, because it was self-terminating, it's not that I can terminate, I don't have the powers to terminate. I requested...
Mr. Bett, do you listen to what you're saying?
Yes.
Their contract was supposed to be self-terminated. How did you know? And who informed you? And whoever informed you as who?
I don't think I needed to be informed about their contract.
How
Madam
did you
Chair.
know that their contract is supposed to end?
It was in their letters of appointment.
How did you get to know about their letters of appointment?
These are people who are reporting to me. So I have to know when a contract is ending. Because we have the tenure contract, which goes with the office holder of the governor. And then now there are those fixed term contracts.
Honorable Locales is opening another Bandorak box where I don't want to go that direction. Proceed to ask your questions.
Chair, I wanted to have through you, Chair, the job description for Mr. Bett, so that we can align the job description with what he is saying. Is he in position to furnish this committee with his outlined job description, a written one? Thank you, Madam.
Mr. Bett, proceed.
Thank you, Chair. I can provide that. I can provide the job description, but maybe because I was not ready, I don't have it now. But maybe you can give me up to tomorrow around 10 a.m. because of the time now.
But you can highlight.
Which I have done.
Please proceed to highlight so that they are aware.
I've done that. I am in charge of governor's staff, the office of the governor's staff. And in the office of the governor, we have 39 staff. I'm in charge of the diary of the governor. I'm in charge of the itinerary, the office, the official residence, the official vehicles for the governor, and other things that will assist the governor to in daily discharge of his duties.
Honorable Sialo.
Thank you, Madam Chair. I think the Chief of Staff has mentioned that he's in charge of the 39 staff who are under the office of the governor. So I want to ask him, what is your role? Are you the one employing the 39? Is it the governor? Or what role do you play in engaging the 39 employees who are under the office of the governor? That is number one. Number two is that you've said that some of the staff were moved to the department from the office of the governor. And I assume that that was when you took over the office. You found that there were staff who were there from the previous regime, Honorable Kiptis regime, and you guys decided to transfer some of them to the departments. And that when you wanted to probably terminate the contract of the other ones, you noticed that the others who had gone to the department. And on that note, you issued a request of termination of contract of those staff. And if my memory serves me well again, is that when Kiborei, the chief officer of public service, appeared before our committee, he mentioned that he had initially requested the extension of contract of all those staff last year, it was last year November. And since last year November up to this point where we've initiated this motion, now you decided to write a letter of termination of the contracts of these staff, and immediately the county secretary acted upon that letter the same day and sent them home. Is it true?
Madam Chair.
Proceed, Mr. Bet.
Madam Chair, it's not true that I terminated any contract. As I said earlier.
No, you've said you wrote a letter asking for termination.
No, Madam Chair, I think that one, I didn't write a letter asking for termination. The letter I wrote was requesting for them to be given an extension of 7 months because some of them had been working and from there be terminated. Because it was self-terminating in 2024 October. So this was just an extension so that they can be paid their dues for this time worked.
Okay.
I didn't request for termination of a contract. I don't have those powers to terminate any contract. And members...
But why did you want people to be paid whom their contracts were ended?
I think, Madam Chair, I've said that some were still working, expecting maybe that they'll be given a contract extension.
Was the employing authority aware of that? That their contracts ended?
Madam Chair, maybe you can pardon me there. I didn't get what you...
I'm saying, you are alluding that you are requesting that their contract be extended for 7 months, and so that they get their dues and they go home. Is that not just saying you are terminating their contract yourself?
Their contract, Madam Chair, their contract had already expired. And
why was it you, but in explanation, you just stated clearly your responsibilities. And the chief of staff, the chief officer, devolution, had written a letter for them for extension of their contract. Were you aware?
Madam Chair, I'm not aware of that letter. And secondly, as the head of staff in the governor's office, I do make requests on staff, requests for staff to be not to be employed as such, to be seconded or be brought to the office. And I write to the county secretary, who will look for a staff. If we will get a staff suitable for the position that I've requested, then maybe they transfer that staff. And that's why we have PNP staff in the office of the governor. Secondly, if there is no staff, then maybe in consultation with the head of human resource, they see whether we have the finance, the budget to employ. If the budget is there, then he requests the public service to employ for the governor's office that employee. So I believe that when an employee has been brought to not my office as such, but to the governor's office, I'm in charge of that employee. And when their term ends, it's upon me, who is in that office, to see whether we'll need an extension or not, because many of the governor's staff are mainly short-term. Including myself, it's a tenure.
I can see you're doing a very good job. But again, when their contract ended, why did you keep these people that long? Until when you got to know about this motion, that is when you acted.
I'm sorry, Madam Chair. I don't think I wrote the letter because of the motion. I didn't.
You want to inform this House that it's a coincidence?
A very big coincidence, for sure, Madam Chair. I did expect even that letter to appear in this House. I expected it just to go follow the right procedure to the public service and stops there. I didn't expect it will come this far.
But the point is, Mr. Bett, you are aware all along that these people were working at your office, their contract ended way long, 7 months ago. and their services ended. Why did you keep them in your office?
In the working environment that we have, Madam Chair, there are quite a number of consultations that happen. And the consultations could have taken a bit of time. And maybe that's why this letter writing happened after not 7 months, but around 6 months, because in my letter I didn't saw that they wind up, I requested for an extra month. That's when maybe we concluded the consultation.
Honorable Sialo.
Thank you, Madam Chair. Chief of Staff, you mentioned that you wrote to the CS for extension of contract for those staff. And the Chief Officer Kulei also informed us that he requested the same through the office of the County Secretary. So I want you to confirm to this House, do they have contracts now?
So as far as I know, Madam Chair, I'm not aware whether they have their contracts. I have not received any response from the office of the County Secretary or the Public Service Board.
Maybe to a County Secretary, are you aware of?
Madam Chair, the communication went to the County Public Service Board. As per today, no feedback has been given. Thank you.
Madam Chair, I think through your leadership, this committee is aware and has some evidence of termination of contracts that happened just recently, and I think those documents were tabled here. And unfortunately, Bonasias, you are the one who signed them. So when you tell us you are not aware and you left it for the board, that means you are lying to this honorable committee.
CS, proceed.
Madam Chair, I thought the honorable member was asking whether I'm aware whether the feedback or the request we made to the board for the extension of contract for the 8 months has been replied. And that's what I've said, it has not been replied. I think that I was asking particularly to what the Chief of Staff was asked, I was confirming.
Yes, I think we are on the same issue.
Yes.
Bet requested for extension of contract. Kulei requested for extension of contract through your office. Then you acted upon, you're saying you sent to the Public Service Board.
Yes.
But there are letters that were issued through your office, the letters of termination of contract for those particular staff.
Madam Chair, no letter of termination of contract has been issued. The contract letters, just the way the Chief of Staff is self-terminating. So the letter of appointment ended in October. Now, as you've spoken, Madam Chair, you are right. That delay, which the Chief of Staff is saying consultation was going on, is where the gap is. And when he wrote to me, I said these staff have been providing services with a letter which ended and no renewal of that letter. So my responsibility as head of public service was to write to the Public Service Board to consider extending for that 8 months to enable us compensate them for the service they are provided because they were at work. Thank you, Madam Chair.
Madam Chair, I don't know, through your guidance and indulgence, I don't know if you can confirm to this committee and these members that we have letters of termination of those 4 employees. And those letters were signed by the County Secretary who is trying to mislead this committee. And it was just done recently because there was a motion in the Assembly. When you appeared here as County Secretary, together with the Public Service Board, the same issue arose, and you were in record for your information. Everything is captured, everything is in the answered report, that there was a termination of contract. Kulei himself, in fact, you had a difference with Kulei concerning that issue. Just to remind you.
Before you proceed, CS, I can see Sharon also on the same point of information. You can proceed so that you can be able to answer the rest of the questions.
Mine is to just help guide this conversation. So there are people who are, how many years of contract were these people under? Was it 3 years?
Madam Chair, I want to confirm that there is no letter I've signed personally to terminate a contract.
It's okay, me, I'm not there.
Yes, I'm coming to you.
Please give the mic to the CS.
Yes, and Madam Chair, what Honorable Sharon has asked is true. The contract was 3 years.
3 years.
It was 3 years, which ended in October 2024.
October, let's just go slowly so that we find a solution and end this question.
Yes.
So it comes to an end October 2024. And then what happens next?
Then what happened? Instead of the immediate supervisors.
Who are the immediate supervisors?
That is the chief of staff.
Chief of staff.
Because these officers were working under the chief of staff.
Okay.
So the immediate supervisor's responsibility is when a contract ends for any officer, you release.
All right. On that, my understanding is that before a contract comes to an end, there's that process of telling an employee, now your contract, there's a letter that must be done to that employee.
Correct.
Was that letter done?
Madam Chair, it is two front. The officer himself, when 1 month remains, puts a request. That is one. Two, the immediate supervisor, when 1 month appears, should also inform.
Was the person informed?
So the two of them, the immediate supervisor and the employee.
Okay, now that the employees are not here to speak for themselves, let's speak or talk of the supervisor is here. But let me just go to the supervisor because this seems to fall under him through the chair. The chief of staff. Did you do, when the contract was about to lapse, did you do the notice to these employees? And if you did, please tell us when you're going to provide the letter that was received, signed and received by each employee.
Madam Chair, I didn't do any memo or any letter to them.
Oh, you did not?
But they did.
Okay.
Proceed to,
you know, we are not
be guided by Honorable Sharon so that you move faster.
And you're not going to speak on, we cannot speak on behalf of people who are not here. So you are supposed to do a letter as the person who is the supervisor, and you've said that you did not. Okay, now let's proceed. We have these people. Now the contract has come to an end. There's no letter that has been issued to them telling them now we don't intend to probably extend your contract. There was no letter to that extent, right?
Madam Chair, as the County Secretary said, it is two-way.
I don't want to go to the other way. I just want to talk on issues that and is under your control.
Madam Chair, I think I ask for your protection here because I need to explain exactly what happened.
Are you going to guide me on how I'm going to ask my question, Chair? I also need protection. I need protection.
Honorable Sharon and Mr. Bates, it's Honorable Sharon who is asking questions, and answer what you know about the questions you're being asked, and when you don't know, probably maybe you say no, so that you proceed to the next step.
Okay, what did the employees do?
Madam Chair, the employees wrote letters requesting for contract extension.
Okay, what did you tell them?
And when they write, I don't think I'll try to remind them because they know. Them writing the letters shows that they know.
Okay, let's go back again. They did a request for extension of contract?
Yes.
And then you went quiet. You went quiet. And you let them report to your office every single day for 7 months, right?
Madam Chair, protect me so that I can manage to answer these questions.
Those are leading questions. You proceed to answer those questions until the end.
Yes, I will answer, but let me be allowed to answer them one by one.
Okay, I'm going to ask you. So they do a letter requesting for extension. You went quiet. Did you go quiet?
Madam Chair, I didn't respond to the letter.
You did not respond to the letter. Next question. Did they attend and offered services to Baringo County for 7 months thereafter?
As I said, Madam Chair, some of them had been transferred away from the office in the process, and they had some immediate supervisors who were with them.
The ones that remained with you? How many did they remain with you?
Madam Chair, none was directly working under me at that time.
Where were they? Who were their supervisors?
One had been transferred to enforcement. Another one had gone to the call center. And I may not recall of it.
And who did the deployment to those other departments?
They were done by the Chief Officer of the Public Service.
It was done by, is that Charles Kule?
Yes.
Okay, let's go back to the letter that you did. Are you the one that did a letter to extend their contracts?
I did request, Madam Chair, for an extension of 7 months since their services in the office of
just allow me to guide you. You are the one who did the letter of extending their contract. Yes. Were these people under your supervision for you to do the letter extending their contract?
In their employment letter, they were clearly under my supervision.
You know you're blowing hot and cold. You've rightfully said that they were transferred to different departments. And by doing so, you recuse yourself from any liability. And you went ahead and did a letter requesting for the extension. Is that what you're saying?
Madam Chair, as far as I'm concerned, they could have been moved, but they were still voting. They were still workers under the governor's office. Just like even now, there are some governor's staff who have been transferred to offer services somewhere else. But they are still directly reporting to me in their letter. The new letter doesn't change.
Chief of Staff, what are you saying? If people are already been transferred and they're not you're not supervising them, how are they under you again?
Honorable Sharon, the CS want to inform me. I don't know if you need his information.
Oh, I need his information because this is very important.
Madam Chair, I want to clarify to the honorable members that we are on a program-based budgeting. This staff, however much they have been taken to other departments, the funding is from the office of the governor. That means the governor has given out to assist in a service need. Now, when the chief of staff, when they are now with other supervisors, that's now Charles Kiborei. Kiborei, before renewal, should have consulted the chief of staff whether he has the money to extend the contract. So, and priorities change as per the need of that particular department. So I wanted to say that there was a gap, as you have said, Madam Sharon, Honorable Sharon, that there was a gap. And that gap is when these officers have worked for 7 months, no compensation, and no renewal. And that had to be corrected.
Okay, that correction that you're doing, you know, once a contract has come to an end, and I want the HR chair, if the HR can help us here, because he's an expert. When a contract comes to an end and you allow somebody to work what becomes to these employees' terms?
Chair, I think you mentioned something which is very clear, that contracts are self-executing.
Yes.
When they come to an end,
Yes.
it is either you can leave
Yes.
or leave.
Yeah.
However, as you said, the HR manual is very clear.
Yes.
For everybody who's on contract,
Yeah.
it allows you, within the last 6 months of your contract,
Yes.
you must request for an extension.
Yes.
So what needs to be confirmed is, was there a request within that period?
There was a request.
Now, where an employee now continues to
Yes.
stay
Yeah.
and is allocated duty, there is a pre-assumption
Yes.
that there was the intention to renew the contract.
Correct. So the intention to renew the contract, according to you as the expert, how long should the contract last?
It should be immediate, because we are all have what we call liabilities in life.
Yes.
So whenever you keep quiet beyond
Yes.
a month,
Yeah.
then even the person psychologically, the ones who are actually their contract have ended, presumes in their mind that the employer doesn't have a problem with me continuing.
Does the employee converted into, is the contract renewed automatically by the law to the same number of years that the previous contract was, or the person is converted into an employee?
The law does not provide a situation whereby you must renew.
Yes.
It has provided a period that any contract can be between 1 year to 5 years.
So in this particular situation, is the head of the HR, so what do you think applies?
In terms of it is a prerogative also of the employer to decide how long they want to renew the contract. However, the challenge, and I think the CS has mentioned, is that there was a lacuna in between.
Who created the lacuna?
The lacuna was created sometime when the governor realized that there were staff within the devolution that he felt that they were not satisfactorily being utilized. So there was a decision to shift staff that were not very busy to other departments. And I think it's correctly, the 4 were removed from, 2 went to communication directorates.
It's okay.
Yes.
I'm still, there's this consultation that the chief of staff is talking about. This consultation they are talking about, that took 7 months for them to realize, oops, we have these people who have been working here, we need to rectify. We need to rectify the situation because they've been working, they've not been paid for 7 months. So what kind of consultation was happening? And remembering, these are people, you've just told me that the governor realized that there was a vacuum somewhere. If the governor had realized that there was a vacuum, why is it that you did not give them contract and start paying them their dues? Because you remember, for those 7 months that these employees were working without salaries, their NHIF was not being paid, their NSSF were not being paid, so they've suffered damages. For all those months, when, let's say for example, if any one of them became sick, what could have become of them? And you're utilizing them, and the governor knows that they need to be used. Is that what you've said? So what kind of consultation is that takes 7 months?
Chair, I might not be able to answer correctly that, but what I want to add to what the Chief of Staff said.
If you cannot answer my question, just delegate to someone else so that they can answer the question.
I needed to explain a small part where these are staff who are initially under the office of the governor.
Yes.
Then there is a decision to transfer to work somewhere else. As he says, he might not have noted that these people are still there. On the other hand, we have, when they were transferred, their direct supervision moved from him to the chief of staff of the department.
Who transferred them? Who did the transfer letters?
I think it was done by the chief of staff for the devolution public service.
So Charles wakes up one day and decides to draft letters transferring people working under the governor's office to his other departments. Is that what you're saying?
There must have been a consultation.
Consultation between who and who?
Definitely between the office of the governor and the office of the county secretary and the office of the...
So they knew that they required their services even then? but they didn't give them new contracts. They have not been paid for 7 months. That is when we started this motion, that is when CS woke up and realized we need to compensate these people, poor people. They've been working for 7 months without salaries. Yet you're telling us that you had realized that you needed their services. Why is it that you did not renew their contracts? If you guys are truthful.
My understanding, so that I can give the county secretary, my understanding is that they were transferred before their contracts ended. That movement happened before the contracts ended.
On that note, Honorable Sharon, before he moves the mic to the CS, are the said contracted staff who among they had one same contract with you, the legal officer and the admin at the service board? Over to the CS, not you.
Madam Chair, the officers were employed the same time with the three. That is the Director HR.
So since he said, you've confirmed what I'm asking,
yes.
Since he said they were working with budget constraint, why is it that they had their budget to continue and the other one didn't have budget to continue?
I've said we are on program-based budgeting. The budget for HR is with the CEO Public Service and Devolution. The budget for the two in the County Public Service Board is under County Public Service Board. The budget for the 4 is under the Office of the Governor, under the Chief of Staff. That is how it is. So the renewal...
You're confirming to us that their budget ended?
So the budget for these 3, the officer requested. For the 2, now, that's what saying they were consultation. And they were consultation, and that's why now it makes the request as the user.
CS, for 7 months you do consultation of a job?
That is what the Chief of Service is mentioning. And honorable members, Madam Chair, you are alive to our budget of this financial year. It was never active.
Chair, we should not go on the issue of the budget. My question is that when you are keeping people for 7 months, and then you're keeping them knowingly that you're infringing on their rights, you're exposing Baringo County into an extra budget that we're not budgeted for. So right now, you realize that there is a mistake. You now want to correct the mistake. Using our money, where will you get the budget from? Let's start from there. Where are you getting the budget to pay them for the 7 months?
Madam Chair, the budget is available.
Was it available if you've created the budget now?
You see, Madam Chair, CARA for this financial year came down and consultations are going on. Even you are aware that our projects never took off up to December. It is public domain, and that's why that consultation was taking long, so that they can be able to ascertain whether we have budget to engage these people. And that is why...
Consultation taking 7 months long. Consultation, and you are using people's human resource. They are providing labor to this county. CS, just be truthful. Was that a consultation or it was an error?
Madam Chair, I think the COS can confirm that because it is their office.
You're the one who is saying that it's a consultation.
That is,
But Honorable Sharon, you see, the CS, you come in to talk about the issues of the Chief of Staff.
Yes.
And it's not about you.
Yes, I was.
Now you are locked, you are at the corner, you don't have answers. Now you want us to go back to, can you finish this issue of Chief Officer? Let him answer the questions comprehensively and we close that chapter. While Honorable Sialo, you'll take up after Honorable Sharon.
Okay. The consultation that took 7 months, what was that was being discussed for 7 months?
Thank you, Chair. As the CSR said, there have been austerity measures put in place in the Governor's office. And as you are aware, government main duty is to offer services. And from the services that they offer, we decide as an office whether we need certain position or not. These were positions that were in the governor's office. But they were transferred because maybe their work was not clear. We didn't see much of their work when we came in. So we sent them to other places where they can offer services. Now their contracts ended. And this is a budget for the governor's office. So as part of the austerity measures, it was decided that maybe these positions lapse.
At what point were they transferred?
I may not be so sure of the dates because I was not
There,
aware.
did you find them there working?
Where? In the governor's office?
Yes.
Yes, we did.
So at what point, which month approximately? Because these are the people that you see every day, they are working under your supervision. If not every day, at least every other day.
The transfers could have happened somewhere in 2023. Not all of them were done once. Not all of them were moved once. They were moved in phases, including even some of our tenure staff have been moved to other offices to offer services.
If you knew that, let me ask you, if you knew that already the office of the governor, there were constraints of budget, is that something that was in your knowledge at that point? When the contracts came to an end?
Madam Chair.
Was there, you've just told us that there was budget constraints. Isn't that what you said?
Madam Chair, the budget constraint was there, but there is no way we could have terminated just a contract like that.
So let me ask you, as the person that is responsible, so you put as responsible of that department, so you would put them just waiting for nothing, like you just put somebody there just because you need them, you don't have a budget, you just let them work without paying them, waiting for a day that will come when you realize that there is a problem that needs to be corrected. This extension of contract right now that you're doing, are you correcting a problem or you're extending because you wanted to extend?
Madam Chair, I think when I wrote the letter for them to be paid, a request for them to be paid 7 months, to be given a 7-month contract so that they pay their dues. It was more on a humanitarian ground, putting in mind that their new supervisors didn't stop them on time. So I didn't want a situation where we just write back and say that these people, their contract are ended.
It's not even on humanitarian grounds. It's their legal right. Don't make people look like they're so... You know, one thing that I'm noting about this Baringo in general, you're making the employees look like they're desperate, they don't know their rights. They actually do know their rights. When they're working there, their legitimate expectation, their contracts, they were going to be extended.
Honorable Cialo, you want to inform?
And I'm done, Chair. I think we'll go round in circles on this matter.
Honorable Cialo, proceed.
Thank you, Madam Chair. I want to inform this committee and probably the members who are appearing before us that I had a privilege to serve in the previous regime as the head of GDU. The staff that you're mentioning were my colleagues under the office of the governor. When the recruitment of those 4, actually it was not the 4. The recruitment that was done was for seven employees. Number 1 is the director HR who is sitting before us. The second person was Dennis, Mary. There was the legal officer who is currently working with the Public Service Board. And then there was another lady by the name Kayla something. You guys were 7. Now, recently, there was an extension of contract of the 3 out of 7. One is the director, he got a contract, and of course, we have a question why he got a contract extension of 5 years, later on it was cancelled, and he was given 3. But him now, he has an extension of 3 years contract. And their initial contract of all the 7 was 3 years each. Yeah, including the legal officers, the communication and all those. But now, there was a contract extension of 3, Director HR, the lady at the Public Service Board, and the other one. Well, the other 4, theirs did not come through. Reasons, we don't know, best known to you. Now you requested, and Madam Chair, I want to bring again to the attention of this honorable committee that the letters of deployment that were sent to these staff, the four ones, was signed by the county secretary who is seated before us. And I have a letter to that effect. Honorable Chepkwony, let me read with the permission of the chair. This is a letter that was written to Dennis.
Honorable Cielo.
Thank you, Madam Chair. It was a letter that was written to Mr. Dennis Ruto, person number 202-104-99-960, under the Department of Devolution, Public Service, Administration, ICT, and E-Government. Through the Chief Officer, Public Service and Administration, ICT, and E-Government, dear Mr. Ruto, the reference was deployment. Then now the county government of Baringo, in its endeavor to improve service delivery and to optimally utilize staff skills, has decided to transfer you from the office of the governor to the office of to the Department of Finance and Economic Planning with immediate effect. Please ensure that you do a comprehensive handing over before being released to your new station. By a copy of this letter, the Chief Officer, Finance and Revenue Management is requested to deploy you to and inform this office on the new areas of deployment. On behalf of the county government of Baringo, I take this opportunity to wish you well in your new assignment. Yours sincerely, Honorable Dr. Jacob Kurui Chepkwony, PhD.
CS, please confirm.
Are you aware of that letter?
About that letter, if you're aware.
Thank you, Madam Chair. In the interdepartmental transfers come through my office, but the requester is the accounting officer of that particular department. So the Chief Officer of Public Service, who is the accounting officer in the office of the governor, makes the request through my office because I'm transferring them to other departments. So they cannot communicate directly, but they come through my office. So I take the responsibility for interdepartmental transfer because of the request of the accounting officer, Public Service and Devolution, where the office of the governor sits.
And on turn, CS also, I want you to still confirm, where did you say their budget went where? Ended. Did you say their budget ended?
Madam Chair, their budget never ended. When they were transferred to the other departments, they were serving, utilizing the budget of the governor. Because they are
but we are aware that the budget of salaries are all consolidated. It's not about all the salaries are in one pool.
No, these particular officers are serving under the governor's office, and every department.
So for our HR, its budget is different, and the legal.
What we do, Madam Chair, you know the budget making process, every department presents their request. When it comes to the budget of HR, we finally consolidate at where? At HR. But when you go and look at it, it comes from every department.
Honorable Layango.
Madam Chair, I think there was a question that I asked and he has not answered. And it's good, he has confirmed that actually he was the one who deployed the 4, while initially he denied and misled the committee. Now it is clear it was the county secretary who deployed the 4 staff. It was not the chief of staff, neither was it the Public Service Board, but basically it was the CS. Now my question was, why was it that the other 4 out of the 7, 3 of them had a contract extension of 3 years, the other ones stayed for 7 months, up to now they have not received an extension of contract. And from the requisition of both the Chief of Staff and the CEO, the requisition that they've sent to the Public Service Board through the CS is for an extension of 7 months. Why 7 months? And these officers are not tenure employees like the other ones. The 7 were not tenure. So let's not mislead the committee that the employment was tenure. It was not tenure. So why renew this one for 3 years, like their first contract? And these are the ones you've requested for 7 months, and they worked for 7 months without pay, instead of giving them 3 months. 3 years as the other colleagues. Thank you, Madam Chair.
The Chief of Staff, Mr. Bett.
I don't think I say that their contract was tenure. I've just said that maybe there are some other members of other staff who have tenure contracts who have been moved to offer services somewhere else because their services are needed there more. And I will not talk about the 7 because I don't know. I'll just talk about the 4. The 4 that I know. The other 3, I was not aware of their contracts. The 4 were not on tenure. They were on fixed term contract, and the fixed term contract was 3 years, ended 31st October 2024. And as I had said, and as even the letter by Honorable Cialo had shown, that they were transferred out of the office, but still they were running under the budget of the office. Even when they wrote their letters requesting for extension, they wrote it through me to the CS. They wrote it through my office to the CS. The 6 month.
What was your opinion when the letters came in?
That's when we started the consultations.
For 7 months?
It took around 6 months, not 7 as we are, because the total contract time we are.
Honorable Sharon, as we conclude on this matter.
My question is to you, the Chief of Staff. You had indicated that among those employees whose contracts came to an end, some of them were transferred to the call center. Are you still sure about that? You said that there's one who was transferred to the call center.
Yes, I'm still sure.
What is the name of the person who was transferred there?
Unless there was a change which I'm not aware.
What was the name of the person who was transferred there?
Mary Chumba.
Mary Chumba. Did you do another letter to the service board advertising for the positions the positions that became vacant immediately? Once this contract came to an end, is there another letter that you did to the public service board requesting for the positions to be re-advertised?
Madam Chair, no.
You did not?
I did not.
All right. Thank you.
Members, I can see there's no one who still have a point to raise or a question. Honorable Cialo, I can see your mic is on.
Thank you, Madam Chair. I think my question on the renewal, why is it that the other ones, the 3 of them who are employed at the same time with the other ones are given extension of 3, while the other ones, the recommendation is still pending 7 months later of 7 months? The other ones have waited for 7 months. I don't know how long did the director and the team waited for their renewal of contract? The consultation, how long did the consultation take for you? Was it 7
HR,
months
please
again?
proceed.
Sorry. My contract was renewed in January.
After how many months of consultation?
It ended in October 2024. That's about 3 months, almost 3 months.
So I think we've concluded on that issue. Honorable Cialo, take up your questions. No, Honorable Lekakimon. Honorable Ngotie.
Thank you, Chair. I direct my questions to County Secretary. Kindly give us or give this committee an overview of the county public service. That is, county staff on permanent and pensionable terms, temporary staff, contractual staff, and casual staff.
CS, proceed.
Madam Chair, just I'll ask the member to repeat so that I can pick.
That you give us an overview of the county public service. That is county staff on permanent and pensionable terms, temporary staff, contractual staff, casual. Their number, overview, just an overview, summary. If you have the documents to table through the chair, she will give directions. Like how many casual do we have in the county at the moment?
Thank you, Madam Chair. I was trying to get the approximate figures. On PNP, our staff are about 3,000. On contractual terms, fixed term contracts, some ranging 1 year, some ranging 3 years, they are about 800. On casual, the ones, the Office of Public Service, which are being within our sub-counties and other departments, are about 240 or 200 and something, around there. That's an approximate overview. Thank you, sir.
Do you category of temporary staff?
Madam Chair, I think the temporary staff is asking at the staff on casual, which is about, you have mentioned, about roughly 240 or 230 there, to be fixed.
Do you have volunteers?
No. As head of public service, the officers who support me are the respective accounting officers in the departments, which are the chief officers. And when I came in, they were volunteers, but at some point, I asked every chief officer not to have any volunteers because we don't have a policy on volunteers and a policy on internships. So for now, I don't have any record of volunteer.
Okay, did you do it in writing or verbally?
In writing, I have communication that effect.
You can table the same?
I can provide.
Have you done anything to do the policy?
Madam Chair, as a county secretary, I don't do policy. The CEC devolution does policies on public service. So, but I can give information that I know there's a policy which is at some stage being developed by the CEC Public Service with the support of the County Public Service Board. Thank you.
You are aware that the say 244 casual have not been paid since 2024?
Chair, I'm truly aware. And I don't know whether I can be able to explain, Madam Chair, I'm aware.
Honorable Ngotie will
Okay.
proceed to tell you whether he
Yeah.
wants you to explain.
Kindly, briefly, what have you done concerning the same, the steps which you have taken, and including whether you have you've done something with the Department of Finance so that they can request the same for the cash for their payment?
Madam Chair, let me put a record straight. I came in 2023 as a CS, and I realized our management of casuals has not been the best. They were paid without a budget line. And I want to thank the Honorable House that I and the Chief of Public Service came to you, saw the budget committee, and it is the first time in this financial year when we are able to get a budget for our casuals. Our casuals have been used to be paid haphazardly through the sub-county offices. At times when the sub-county offices or the municipalities doesn't have money, they are paid by the treasury through our personal emoluments for the staff on PNB and on contract. Now, this year, we made a good progress where, with the support of the county assembly and the executive, we are able to put that 4 million from January. Now we went further as the chair and also the head of public service, Chair Chirac and head of public service. We wanted to get exactly who are these. And I appointed the chief of public service to be the chair and the chief officers of treasury, the two planning and revenue, the chief of health, chief of urban, those departments and water which had casuals to sit and go around and get us a data. And that is the data we get, which was about 243. But later on we cleaned, and when we are going around, we really wanted to get who is this, where does he work, what is the ID number, and we demanded for bank accounts. Because what used to happen, and I want to put the record straight, is that our officers used to pay them by signing a payroll. So the money was not going to the bank accounts, which could create loophole for misuse. So when we succeeded to get that, and even before then, I stopped, and I have a letter to that effect, no more payment of casuals in that particular way. Then there became an uproar when our towns became very dirty, and we had to lift the ban because these people were working and we were doing that cleaning of the record and having the bank accounts. So we lifted a little, and then now we got all the documentation. Now when we wanted to pay, the control of budget, because we make requisitions and we show the line items, control of budget says we want an approval from the Public Service Board showing that they are in the picture of these casuals. Now I asked the accounting officer at the treasury what is needed. They say a letter just delegating the various chief officers of the departments and the various employment points, that is the county points and the ward offices, to delegate, to give them responsibility to engage these people. Now, since we were in a mess, it's good to own it up. We were in a mess since the defunct local authority, because some of the cash was actually were inherited from the defunct. Since 2013, we came all the way, we were in a mess. These people were there, being utilized, being paid the way I've mentioned. So the board asked me, who engaged these people? I said, it's a systemic problem. And we have the responsibility as the office holders at this particular time to correct the situation. Now, I was unable to get an approval. So there was a pull and push. And that is the time it took about 7 months. And I could not pay them because the controller budget has not gotten that approval letter. And I think that is when this information reached you. And I want to really congratulate the Assembly. This is something we need concerted effort. We need our collective responsibility to assist each other. You give us the...
Honorable Kakmon, you want to say something?
Thank you, Chair. I want to be specific on this cadre of snake handlers, issue of county staff, before as you continue. This staff, they have been employed during the defunct county council. And the work they are doing is earning this county a lot of money. These snake handlers were employed during the defunct county council as snake handlers. But during devolution, you changed their position to support staff. Could you tell this committee why you changed the position of the snake handlers from that position of being a snake handler, you put it as a support staff? There was also a point that you employed them on permanent and pensionable terms, on support staff, not as snake handlers. Initially, you were paying them 8,000. And when you gave them letters of permanent and pensionable, you indicated 30,000 per person. And these people who have been handling these snakes, like Baringo, they earned the 8,000 for 5 years. And they have not been paid arrears, the balance of the money that remain from the 8,000 to 30,000. When you pay 8,000 for 8 months, there is an arrear of 22,000 per person. So what did you do with this staff? And why did you put them to the category of support staff? And these are people who are doing unique work and a risk work. You don't pay them risk allowance, and you have not even paid them the arrears, having given them permanent letters that they will be earning 30, and they are still earning 8. And they have been earning 8 for 8 years, for 5 years, and the arrears have not been paid. So could you tell this committee the reason why you did not categorize them? Because that is a unique work and a risk work that they are doing, and it is earning this county a lot of money. Why didn't you put them at that category of snake handler rather than putting them as a support staff? Do you want to say that when they are bitten by snakes, when they get some injuries, you don't pay them those expenses because they are support staff? So please, could you tell this committee about that specific cadre of employees, snake handlers? Thank you, Chair.
Proceed, CS.
Madam Chair, I'll respond, and then the HR will also add value to what I'm saying. I want to bring this to speed. The scheme of service for the defunct local authorities is different from the scheme of service after devolution. So when you go to the IBBD, you have nothing called a snake handler, to be precise. These people, to grow, to be promoted, needs a definition in the integrated personnel in the IBBD. So in our wisdom, or the wisdom of those started devolution, because I suppose that office was held by somebody by then, they decided to put them under supporter staff. And that paved way for them to be promoted through the system. The only unfortunate thing, Madam Chair, is that we have gaps, and I want to own this. We have gaps. The scheme of service for doctors, nurses, and clinicians provides from the negotiation or from the bargain by their unions, gives them those allowances for risk allowance. But this kind of staff has never been entrained in the system. So it was our responsibility as a government to put them on what is called work benefit, work injury benefit, so that you are at risk, even a driver is at risk. But when they are exposed to risk, they are supposed to be compensated. Something in this county, we've never gotten it right, and I want to own it. And a few years ago, you are aware that some of our drivers got accidents. We want to compensate. Our insurance cover does not cover the work injury benefit. We end up paying using our budget. But the insurer is supposed to provide that. We've tried, and I must say this, we've tried as head of public service in the budgetary making process to say that enhance this insurance cover so that when we have our staff exposed to injury, we have a way of compensating. But we've never gotten it right because of resource base. Madam Chair, that is what I can say, and I'll ask the Director HR.
Honorable Ngotie.
I'll ask Director HR to add something.
Okay, Honorable Gakamod.
You see, my point of, my question is, Madam Chair, these are people who have now categorized as support staff. These are people, their salary have been increased from 8,000 to 30,000. And these people have been earning the 8,000 for 5 years. So the arrears of 22,000 for those 5 years, where did you put them? Why didn't you tell this panel that we have budgeted, because there must be a budget for you when you give a letter of permanent, being a permanent and pensionable to those staff. And these are only 10 staff, and they have been earning 8,000 for 5 years. The 22,000 you have not given them. The risk allowance they have not given them. Now that you are talking of the risk allowance being put in a work injury, we call it WIBA. So how, when are you going to pay this staff? They are arrears because nothing is telling. They have a letter showing that they are earning this money, 30,000. For 5 years, you give them 8,000. Are you fair to them? So let them, Madam Chair, tell this committee what action are they going to take to pay the arrears of these members and pay them the duly assigned amount of money. So please let them answer that.
Proceed, CS.
Thank you, Madam Chair. Actually, Honorable Member, I wasn't in the picture of that as CS. I want to own it. But I wanted the Director HR to clarify that, and that's where we are heading to. Thank you, Madam Chair.
HR, proceed.
Chair, thank you, and members. Let me begin by saying when devolution started, majority of these staff were under what you call, they were casuals. That casual basis was carried on up to around 2020, 21. Now, the problem came in because a group went to court, which includes this. There were actually about 249 staff. They went to court. Now, when the 2021 promotion came, because I was also new, their confirmation, they were not confirmed. Their confirmation was deferred by the leadership on the basis of being in court. So there was a discussion and a negotiation that took place until it was agreed that they withdraw the case in court. And based on the withdrawal of the court, they were actually promoted. On now trying to promote the 10 you're mentioning, we realized the scheme was not available and they had reached ceiling. So what did we do as a team? We sat and said, because the decision was people grow, they were converted to subordinate staff to create a path for them. And it was in good faith. Now, part of the negotiation was because we didn't have money for the 249, because we were not going to only pay the 10, the 249. There was a negotiation to convert them, and there are minutes available from the board on conversion and being given letters of P&P, and then starting promoting them then, and then paying salary, the new salaries. That was the decision that was made then. And it was about 249, not only 10, Chair.
Honorable Ngotie?
I think it is fair if the HR can table those documents so that even the member can have a look at them. Now, CS.
HR Andrew, please make sure you provide those documents to this house so that we're able to go through, and the honorable member will take the next action from the documents. Thank you. Honorable Ngotie.
Chair, can I
Further
say,
to that.
maybe I will table the minutes, the report that came from the board on their confirmation, because we have the list of the 249 and the letter that tells us confirm them, Chair.
Noted, HR. Proceed, Honorable Ngotie.
Yes, we have documents of names about that 244, 243, but inside, yeah? I'm still on casuals. That what you have done, what have you done to make them paid? You clarify, do you have the documents, the letters you have exchanged with the...
Madam Chair, actually, we've done all the cleaning.
How many did you get? How many did you get after 243 after cleaning?
I was the Chief of Public Service was here. It came down from 243 to roughly it was 220 something. But I can provide the exact. Because
Can you table that document?
I'll table the document.
You have it with you?
No, I didn't carry, Madam Chair.
Because the one you tabled in this house was 243.
243. Then we did a cleaning, which the CS Public Service and my Chief of Public Service here, the CS Public Service Board and the Chief of Public Service worked together in the manner the board wanted to be presented. And a cleanup has been done, and I've requested the board to actually authorize so that we can be able to pay these people, because we have money, they have worked, and Madam Chair, I'm even worried that we're almost coming to the end of the financial year, and I'm worried that this money, which is on recurring, may transit to development. Thank you, Madam Chair.
Honorable Ngotie?
Do you have any documentation or letters that you've exchanged with Service Board concerning the same? And have you had meetings, even including the finance CEC, concerning, because nine months for somebody with family, I think you feel it. So what have you done personally? Not only exchanging the letters, but even visiting their offices on the same. And we saw the letters, we saw the names. The names, they don't have all the documents required by Service Board. Have you now rectified and supplied them with the updated document?
Yes, Madam Chair. We have cleaned it. We've supplied with the board the template they wanted in Excel sheet. The only challenge, Madam Chair, let me just, it's good.
When did you do that?
It is the CEO Public Service who forwarded immediately after we came in this in between. And I'm sure even the Chief of Public Service appeared here and was able to clarify that. So the only challenge, which I must say to this committee, due to this happening, it's like people don't want to move. It's like people are scared. But for me, I would wish that these casuals be paid as we address this matter.
Allow Honorable Ngotie to finalize, and then I'll give you Honorable Locales.
Bwana CS, the way you've spoken so emotional, what will vindicate you is the letters which you have exchanged with Service Board, showing that you have that goodwill for them to be paid. And I rest my case.
Honorable Locales.
Thank you, Chair.
Before you proceed, I can see the Chief of Staff. It's on mic, please proceed.
Thank you, Chair. I've sat here realizing that I really don't follow anything that's happening now. Okay? I beg to be allowed to leave, Chair.
Can you come up again?
Chair, I've been trying to follow the issues after the CSR started, but I've realized I'm not.
I thought you were on a point of saying you want to excuse it, but since you are saying no, I'm not. You made your request that
I'm requesting that I be allowed to leave.
Chief of Staff, stop being mischievous. You said you are following and you cannot see anything that is on you. We are still on your case before the end of them, so you are not giving you time to leave
No,
this.
Chair. I think you are not getting me.
I've ruled.
Okay, thank you, Chair.
Yeah.
Accept.
Thank you, Chair. I'd want some clarification from the CS. Now that he's mentioning about the payment delay. When did this process start, Bwana Daktari? The process of this committee, when did it start? That's my first question. 2, from when were these casuals not paid their dues? Way back, some from September, August last year. What prevented you people not to pay them until when now we are engaging on this process of casuals, engagement, employment, and other malpractices that you want to come in and say, I am worried, I am afraid that we may lose this money of recurrent because they are not development money. Are you a visitor in this city that now you want to pretend that you are not serving in this government of Cheboy since August 2024 up to April or May, when this committee started sitting, May 2025? That's my first question. My second question, because still the same questions for Honorable Ngotie. You mentioned about 243 casuals. And after we did some check in our sub-counties all around Baringo, we are told, Bwana Chepkony, that when you initiated the process of, you requested sub-counties to update the list of casuals, people hurriedly added more names. People hurriedly added more names to the list of casuals, and including yourself. There is that allegation that you also added names. Are you aware of the additional casuals who are added to the list of casual after you wanted to know the number of casual per sub-county? And what did you do for 9 months not to pay them? That now you find it a delay when the committee are sitting to find out the lasting solution for these casuals.
Honorable Sialo.
Thank you, Madam Chair. I think on the same question raised by Honorable Ngotie, I want to ask the county secretary, are you aware that the casuals that are working under the Department of Health are 730 casuals, beside the 243 that you were mentioning? That is number one. Number two, I know you've provided the list of all the 247 casuals that you are aware. I want you to provide to this committee, with the guidance of through the guidance of our chair, the casuals that were employed, the ones you inherited from the defunct county council, to the casuals that were employed in the first regime of Cheboy 1, the casuals that were employed 2017 to 2022 under the regime of Honorable Kiptis, and the casuals that the Cheboy 2 regime have employed since 2022 to date. I think, Madam Chair, that information will guide us on our way forward. Thank you.
And before you proceed, CS, you're telling this committee that the chief officer, public service, is communicating with the board. I thought you were in charge, because all the communications is done through your office, and even if you're absent the last 1 week, you should be up to date what has happened from then. Because anything that is happening between the chief officer, devolution, should be on your desk. So there's no reason why you don't have any answer to the questions or anything that was asked to the board, because the board was here the other week, and they confirmed that they've not received those names. They don't have the details, but they've given you the spreadsheet that you need to fill those information, because they don't have. So proceed answering the questions as you also guide us on that.
Thank you, Madam Chair. Madam Chair, I want to refer you and maybe give you a letter which I communicated in January 2024. This committee was not yet in place. And this is a letter I wrote to the Chief Officer of Finance.
Proceed to table as well as you.
Yes, asking approval to pay pending casuals wages. This is the one after stopping, when our towns became dirty, I had to leave the ban, because though it's an irregularity, we still need to take care of our health. This is the letter. Now, on, just wait. On I had provided these. On March, there's another letter which I want to get. Allow me to stand. On March, 11 March, that is before even this committee started, I had written to the Public Service Board with the data, requesting, my message here is, this is hereby to request the County Public Service Board to approve this engagement of casual workers in order to ensure payment of the wages and to ensure uninterrupted services. This is by 11 March. I have another letter by January, which I want to. Sorry. Sorry, Madam Chair, so that I don't delay. But I'll provide before the end of this session. Before the March letter, I had another letter for January, which had block figures, but didn't have the details. But I was asking the Council Board, please, let's regularize this process to enable these workers of ours be compensated. And that's why I wanted to clarify, Madam Chair, that it is not when this committee started, when I started this process. I had started earlier. It's only that due to that pressure, also you people got the information, and it was work on process. And even I have other communications here. An executive meeting where I tabled in the cabinet, and I said, here we have a problem. We need to take care of our workers. I have minutes here, or even an invitation for all stakeholders of 6 February 2024, asking the CEC member for finance and economic planning for a meeting, CEC member for lands, CEC member for elder services, CEC member for devolution, publics, and their chief officers and the directors of revenue and finance and enforcement. We sit down to address this matter. So I want to clarify, Madam Chair, that actually before you, the honorable members of the assembly came on board, that we address the matter together, I, as a council secretary, was trying to address so that we avoid an embarrassment. Madam Chair, allow me just to take some time because you have asked me quite a number of questions. Apart from even the casuals in the sub-counties, dated back to last year, I was trying to address also the casuals of the municipality. And you are aware that they had taken us to court. I was with the county labor officer. I've gone with the CEC's public service KB to have a way forward. And even with our legal team, we had tried to address this issue because we had, and even the department to the board, we asked the board regularize so that we don't have legal tussle. But the board was saying no. So what we did with the county labor officer, we decided to request for settlement out of court, which is things I've done and I have evidence to prove that. So I was in this issue, not really sleeping on the job, but trying to address this problem. On the issue of the names which were added, I want to, Madam Chair, to put things straight. When employment is a very emotive issue, when I asked the team I formed, led by the CEO of Public Service, to go around the sub-counties, when they hear that they are coming to clarify, everybody struggles to be relevant. Even there is information which says people are supposed to be confirmed, which was not true. The intention was to get the data, but there is misinformation. And could be people had it, and then that's why when we cleaned, it came down, because we were looking for the facts. And for somebody saying I added, Madam Chair, I want to mention that I didn't add. I didn't add because my office is supposed to provide controls. Madam Chair, the Department of Health, the Department of Health actually has this number of casuals. I've even posted an HR officer in charge of Department of Health specifically and Department of Education specifically. There are HR officers stationed there. Now, there are hospital
Who is
boards.
that HR?
Margaret Kango, I think you can attest, is stationed at Health.
On that note again, because you've opened another thing so that we don't repeat ourselves,
Yes.
what happened to the HR who was stationed there before?
The HR who was stationed there before, there was an officer who was working at the payroll, requested, that's the officer called Patricia Kipsoi, requested that I've stayed in payroll for so long. And
I'm saying the HR at the CHMT, that is where Margaret Kangogo is.
Yeah, I'm bringing how Margaret went there.
But I just want to know about the HR who was there before so that you send Margaret.
The HR which was there before was Irene Kambala, who came to payroll. And then Margaret went to do the work of the HR in the health.
Are you sure she went to payroll?
Irene Kambala is in
the HR who was there at the hospital.
Okay, thank you, Madam Chair. Earlier, before Irene Kambala, there was the HR who is in education, called, in agriculture now, called, what's the name of this? Chep Kiborei. So, Edith. So there were transfers. So Edith was taken to education when we had the ECD teachers. But she protested, I don't want to go to education. Later on, we took to agriculture when the number of staff in agriculture went up. So
why did you remove her from the hospital?
Maybe the director HR, because he's the immediate supervisor, can explain that.
Okay, please do it before you proceed.
Chair, the history of health initially, let me just give a little bit backward.
Don't give us history. We want just to go straight. What was the reason why she was transferred?
Well, I can't give you the reason because it was a decision made at the upper office that I think there was a dispute, there was disagreement between the chief officer.
Don't go that direction. It squarely lies between the two of you, and you know why. Margaret Kangogo, our profession is?
It's an HR officer. It's a principal HR officer.
So the reason why, HR, let's not lie to ourselves. Let's finish that issue again. Let me proceed. It is even connected to the issue of Kimwok, Mrs. Kimwok that was there. So this was a transition that you are drawing a map, you're throwing away the HR from the hospital, remove her to a department that is, she's even not working at the moment because there's not a lot of HR issues in agriculture. You removed her, you took Faith Kimwok to the HR where you are now, then Margaret to be taken to the hospital.
Chair.
And before you proceed, let me allow the chief officer to leave. With the permission granted, you can leave. HR, CS, don't even throw the ball to HR. And HR, don't go to a mud that you don't belong. Okay. Honorable Sharon and then Honorable Engo.
Chair, there is information that you are about to miss. This issue of a dispute.
Please inform me. You are allowed to inform the CS.
It's not even the CS. The HR, I believe the HR is a truthful man. HR, there was a dispute that led to the transfer of the HR. So the dispute was was between who and who?
Chair, let me be honest. It's good sometimes to be honest so that we clean these things.
Honorable Layango, before you proceed.
On the same note, HR, is it HR or the CS who mentioned about, it is you. You mentioned something to do with the upper office. Dispute, and then something happened. It came from upper office. So which is this upper office? And yet we have procedures for handling issues.
Chair, let's be truthful about this thing.
Proceed with the truthful
the
part.
posting of Chief Kiborei was, she actually requested to be posted. Let's be honest.
By who?
Because we had a gentleman called Collins.
Let's not go to Collins.
Herself went and canvassed she be posted.
That is Edith.
Yes. Then she was posted. She worked very well until she was accused of
Honorable Laengo, please.
Yes.
Wacha kidogo tu. Was there in a letter, you know, when you request to be moved, you request it through writing. Was there in a letter to that effect?
HR?
Chair, sometimes we don't always write letters in HR and the CS and the governor's office. It is a discussion. So when she went to health, she was accused of meddling with donors. I'm very honest. And it was an accusation that came from the leadership of the health department.
Are they letters to support the accusations?
No, I'm giving you the story.
HR, we don't want stories.
Okay,
If are there
no
letters to support that one?
There are no letters.
Even to transfer, there are no letters.
The transfer was done officially to health.
I'm saying the request, she said herself, I want to go to other department, right?
Yes.
Was there a letter from her?
No, she never wrote.
Number two, you said in your HR and CS you just transfer people.
No, we don't
you just
transfer.
converse and transfer.
No, there was also issues with the former HR person who used to be in the department, because you know there are quite a number of things that happen sometimes that you have
I
no control.
proceed to tell us now. I want to know whether you are a
Yes,
truthful man.
yes.
Tell us about Faith Kimwok. That is where we know the truth up to now, because you appeared last time, and I want your words to go to be a truthful man.
I would want that.
Let's do the one for Faith Kimwok. No, you are not running away. You said you are a truthful man. Let's deal with Faith Kimwok so that I know whether you are saying the truth or lies. Tell us about Faith Kimwok.
Well, I did indicate here that when Faith Kimwok came, I was on leave. And truly, the CS called my assistant. And what did he do? He gave my assistant a letter, which I said I had never seen when it was produced here. So when I was still on leave, then I was called that somebody who has been sent to the department. Then I asked on what terms. Then he said, I was just given a letter. And I said, converse with the CS as to whether there is a transfer of service or it is a secondment. That feedback wasn't given to me. And that is the story of Kimwok, to where I know. She's in HR, and she has been in HR since then.
So you want to tell us when Edith was being transferred, it was by word of mouth, but when Faith Kimwok joined your office, it had a letter.
Chair, Edith was transferred officially with a letter, and I think we can actually photocopy from our my directorate to health. And she was transferred officially from health to education, and from education to agriculture, where she is currently. All of them have traces of letters.
So in other departments, what did she do? Because you said when she was in health.
So when she came from health to education, education did not want to receive her because of other issues which I don't know. And that was what was decided, that she be taken to agriculture.
Noted. We will proceed to know about those facts after this, so that we are able to know who is the truthful person and who is not. Honorable members, proceed. I can see Honorable Cialo.
Madam Chair, I'm really shocked. And I think, Director, we must tell ourselves the truth. How many transfers did that lady went through?
Chair, the first transfer that Edith went through was to move from our directorates to health.
Reason?
It was a request, and also there was an issue with the HR officer who was there, who was deployed back to HR.
Okay, who requested?
It was Edith herself through canvassing.
Yes, then to the next department.
Now, from the other day, when she was removed from there, she refused to come to our directorate. She said she wasn't comfortable. And I think the CS will explain that part. She said I was not comfortable because after being in health and being posted back to our directorate.
You mean she requested to work in a department, then reaching there, she's not comfortable?
No, I'm saying when it was decided that she be brought back to directorate of HR from health.
And be aware as well, the MedSup said she's not the one who requested to leave the hospital. It is you people, the HR and the CS.
Yes, that is what I'm telling you. The decision to post her from the department will be explained by the CS. But I know one thing, when she came, she refused to come to our directorate. She didn't want because she wasn't comfortable.
But
so
you've alluded that there's something that she did from the health department so that she said she wanted to leave. Be guided, the MedSup said it's you, the HR and the CS, who made that transfer from the hospital.
Yes, we are the ones who made the transfer. She's not the one who requested from health to come back. And the CS will explain that. Because in this conversation, CS is party because of what we call interdepartmental transfer, which is a prerogative of the CS.
Honorable members, that issue of the HR, if you still want to comment, but to me, I can see the generation of that staff, the said staff Edith, it's you people who mistreated her. For the replacement of Kangogo, it is still through your office. The business of just putting people in a department that you feel like that they fit in, because the MedSup explained clearly where Mother Margaret Kangogo came from. And indeed, a job group allowed her to be where she was. But because of your interest, you decided to remove Edith from PCRH and take Margaret Kangogo to PCRH. And CS, be truthful, because we are coming back on that case. And remember, you're building yourself to many issues and you're trying to exonerate yourself. The people who came here earlier have given information. So by the time you ask information, remember that the people who were here before, they've given their own information. Even the letters that I'm receiving here, they even a letter that you signed when you were away. I'm yet to know what letter, the kind of a letter that you signed. I still want our clerks to produce. While you're away, you signed a letter and you're in China. And those are the things that we are really looking into them. We want to know what is really happening in your docket as this years. Proceed, CS.
Madam Chair, I want to request that let's handle one item at a time so that we get clarity of these things. We were on the issue of casuals, which Honorable Cialo put it very well, that we have 733. I've not even clarified how this is done, so that we go to the gist of the others. So I said, when I realized, so that we can get this understanding, when I realized that the Department of Health is expansive, Department of Education is expansive, we had to look for HR officers stationed at those departments, while the other departments are served at the headquarters. The hospital boards are gazetted. The hospital committees exist. And there are certain work which is needed and not managed by the County Public Service Board. So they are mandated to engage because some are technical casuals, some are cleaners, and some are security people. So they are handled and paid through the Facility Improvement Fund. Now, the advisory in terms of managing those staff should be by a senior HR officer stationed at the department. So that is when we took, that's when Margaret is there. So we don't engage on those ones, but the boards and the committees handle them. Madam Chair, the issue of Edith, and you've said really we need to put this thing straight. There were complaints, just the way Director had said. Edith was initially stationed at the headquarters. Then we took her to health. You can see we had the goodwill. We didn't have any malice. We took her to health, to man for us health services. In the process, the accounting officer in that department by then, Dr. Bore, complained that I'm seeing some malpractices. Madam Chair, you know, these are officers. These are, when there are complaints, as management, you sit down and say, what do we do? And also, we need to take care for the future of these young people. So we said, let's move Edith back to where? To the headquarters. When we made that decision, Edith refused that I'm going to be packed, because you see, at the headquarters, you know, this time, I'm not going to the headquarters. Then I called her. What do we do with the director HR? I told her, go to education. She accepted. She even said, let me go to education. We wrote, because in that departmental, I wrote a letter on behalf of public service to transfer to education. Reaching education, I wasn't there previously. They said Edith was there, and she never landed. They refused again. Then I called Edith, and even we sat as management. I told Edith, now what can I do for you? You've gone to education, but they are saying, no, give us somebody else. Edith requested personally, take me to agriculture. And that is when I deployed her to agriculture. And she accepted, she reported, she was received and embraced. That is, now when Edith left, health, Kangogo was at the mainstream with the director, was taken to health services. And that is how it was. After some time, Patricia requested that I've been in payroll for so long, and me, I've been a revenue officer since the defunct government. Me, I want to go and work where my skill is. She made a request, I declined. Made a request to Director HR. Then we said, no, if an officer stayed for long in somewhere, and to motivate her, let's take her. So we consulted, and then we said, who can come to where? To now payroll. Then we identified Irene Kampala. We imposed Irene Kampala to payroll, and then we took Edith to Treasury to support revenue collection. Patricia to support revenue collection. That is what happened. And this happened before the said officer called Faith came. That was earlier, way back before. I want to put the record straight. When I came in, and the director can allude to this, when you walk to our registry, when I came in as the CS, our files were on boxes on the floor. You can attest. All the staff seated in the registry are clerks. No training on registry making. We had only 2 officers who are trained in registry. One at Treasury, one at Treasury. And when you go, we gave priority to Treasury because of finance, and he refused to come out of Treasury because he wanted to post him to HR. So one day when we were preparing, having a breakfast to go for Madaraka celebration, then the teacher asked me, what have you done to the registry? I said, sir?
You said to ask?
The governor asked me, what have you done to the registry? I said, Governor, we are working the way to make sure that our registry is in order. And we promised.
And by that time, our HR Andrew Rotich is still heading the HR.
He's heading the HR.
So he doesn't even know how to arrange those files.
No, you see, Madam Chair, maybe you will explain the work.
But you know, when you explain like that, it means those people who are working in the registry are incompetent.
For sure, the officers at the registry are clerks. And even if you go today, pick one by one on the documentation, nobody has training in records management.
And our HR?
Madam Chair, allow me.
I'm allowing you because
Yes,
you know
yes,
you want to
yes.
you want to show us.
We want to
I want to
yeah,
know. You know
yes,
our HR there is an HR practitioner.
You will add value to what I'm saying.
And I want you to add value to him as well because already you are showing us that this person is not qualified.
No.
Your files can loiter on the floor.
No, not really qualified. Yes.
It is shocking, Madam Chair, and I want to ask, for how long has the files of employees kept in boxes on the floor? Is it since inception of devolution or just later? I mean, for how long have you been watching files of employees being kept in boxes or cartons, for that matter?
Madam Chair, when I came, that is what I found. That's what I found, and I'll give the director also to explain. So we are confessing, not really alone. We said we need expertise to help us put these things in order. You know, when you get an issue, you try to find a solution. So I requested.
You see, CS.
My sorry, Chair. No,
you still ask the question.
Normally my questions are not narratives.
Yes.
I just ask straight. Is it since inception that files of employees are always kept in boxes or cartons? Since 2013, for that matter. And what about what happened to those who transferred before the devolution? How are files being kept in the defunct county councils?
Madam Chair, I'm not saying the files are utilized, but you know, in a registry, there's an order how you need to serial for ease of access and protection. I can tell you.
But you're not answering my question.
Yes, from...
Is it since when?
Since devolution, or even since the defunct county council.
So there's been no proper management of files?
No proper management of files.
Until you saw somebody. I'm done.
Honorable Sharon, on the same?
On the same, I just want to understand if Faith Kimngok is are we talking about Faith? Yes. Is Faith Kimngok a record? You call them not record?
Management.
Is that?
He has a master's in human resources, but specialty in records management.
Oh, okay. You know, we've understood that there was a clear problem.
Yes.
Did you follow the process of secondment?
I followed. Madam Chair, I followed.
Yeah.
I can table before you a letter I wrote to Commissioner of Prisons way earlier requesting for secondment. I can table.
How did you even know this a specialist?
That is the explanation I wanted to give you, Madam Chair, and you said answer direct.
And also when you answer Honorable Sharon, you tell us if you follow the process from the other one, you cannot confirm, but through our board, the other people that we can question, but not the outside one.
Yes, Madam Chair, the process of secondment started with me as the head of public service. You write to the entity. The entity gives you a letter of no objection. When they give me a letter of no objection, I write now to the board, saying this entity has accepted, I have no objection, kindly.
Did you write to the board?
Now communication from Nairobi had not come. Now, because I was addressing a problem, let me answer, Madam Chair. Because when I was addressing a problem, what I did, we agreed with the commandant here, give me her 2 days, then she comes for your work 3 days. And actually, Intergovernmental Act gives us that responsibility. Even you, may have an officer from national government.
That is okay. That
Yes.
is okay.
Yeah.
I just want to understand the process of secondment.
Yes.
Did the Public Service Board approve the secondment?
Secondment has not been approved because
The secondment has not been approved. Okay. And what is Kim Ngok doing in the office while she has not been approved?
When I had a problem, Madam Chair, I requested an immediate pause to give me this officer 2 days in a week to capacity build my office.
No. You know, when we CS, why did you hurry the process?
Madam Chair.
And you know, when you're hurrying, you're breaking the law. Why did you break the law?
Madam Chair, let me just respond to that. Madam Chair, we are one government for 7 counties.
No, I'm asking why you broke the law, and you are going to asking you are telling us about how we are one government, that we know. My question is that why did you, if we have an officer in our public office, the executive there at the HR, manning and handling our data, and is not properly in office, what can justify that? Legally, what can justify that, CS? And it's good you even say that it's actually an error on your part. We move on and we see how we're going to rectify. Because there is nothing that can make that thing legal.
Madam Chair, in my wisdom as head of public service, I'm faced up with a problem here where I don't have a qualified staff. It is prudent for me as a responsible officer to request another department to assist me.
Is it prudent of you as the officer of that department to breach the law? Well, we understand there was a need.
Yes.
While we understand there was a need, clearly we needed people to come and serialize the the data and all.
In the spirit
but
of,
let me ask
in
you.
the spirit of cooperation and consultation, Madam Chair, I think I was doing it in good faith, not with malice.
Okay, did the Public Service Board approve or not?
Madam Chair, we had not reached at the level the service board had approved because...
Okay, what are you doing with someone who the Public Service Board needs to approve? What are you doing with that person in our office?
Madam Chair,
and you know, when you're speaking, we've understood that there was a need. That one we have understood.
Madam Chair,
we've understood that you are doing it out of good faith.
Allow me, Madam
Chair. But can that can the law be broken because you're acting out of good faith? What can justify that?
Madam Chair, the work of the service board is recruitment. This officer has not been recruited to our service.
But what is she doing in our office? And on that note, let me allow my members to ventilate. Honorable Shannon, Honorable Legakimon, then Ayengwa, Sialo, and Locales, so that we finish on that matter, and then you answer them in that sequence. Okay. Note their points. Honorable Legakimon?
Yeah, CS, there is this issue of this lady, Kim Ngok. Is she still in the office or she has been returned back to her workstation? And why fast? Why is it done fast?
That's your question, Honorable Legakimon. Yes. Next, Ayongo.
Was she on a CS, was she earning salary?
Honorable Sialo.
Thank you, Madam Chair. I want to ask the CS. You initiated the process, you posted the lady, assumed that it is your powers. I want to ask you, are you a co-governor with Honorable Kiborei? Number two, you went ahead and requested the person in charge of Cabernet prisons to release this lady 2 days, and then she works for them 3 days. You've said you got a letter that there's no objection. Sour. But then, was he released officially to come handle our records? And finally, are our records now properly in place now that this lady has been there for illegally for 7 months or 8 months?
Honorable Locales.
Thank you, Madam Chair. In that sequence, I'll also want to know what was the mode of engagement and payment that we arrived on. Secondly, is she still working with the Baringo County government? Because there is rumors going around that the lady had been told to vacate the place silently, quietly, and go to where she came from, which we know the place she came from. Now, on the issue of secondment, there is the issue of secondment in Article 73 that says the national government shall put in place measures to protect its public officers on secondment to the counties from loss or disadvantage with respect to pension, benefits, gratuity, or other terminal benefits. Did you consider for Faith Kimok on the issues of her benefits after the secondment? Now that there was no letter from national government to approve for Faith Kimok to be moved from prisons to Baringo County, don't you see that was an illegality? You are treading on an illegality grounds, serving as a CS who does an illegality, approves an illegality, and works with an illegality in the same office. And Madam Chair, that amounts to abuse of office, and it is punishable by law.
And on that note, again, we would like to know if Faith Kimok has ever drawn a DSA in our county. And number two, did you try to source for a record officer within our county? Proceed, CS.
Thank you, Madam Chair. The officer, as I mentioned, was still working in our station, but supporting us to capacity build our officers on aligning. We have never paid her any salary, and we have never paid her any DSA. And so, due to my relationship with the head of his department and my officer, that is when I make a request to address a problem. And if I went wrong there, then I did it out of good faith because I wanted to address a problem.
Honorable Sialo?
Can the CS probably clarify the kind of relationship that you have with that person you're mentioning? And if you have a relationship with the said Faith Kimok?
No. The relationship I'm talking about, you see, as a CS, I have a cordial working relationship with the commandant, their heads of departments. I have a cordial relationship with the commissioner. We all work to serve the citizens of this county. So out of that, I'm saying office to office what? Relationship in terms of delivery of service for our people. We work as one. So That is when I asked the officer, let her support me to address a problem.
Honorable Sharon?
I think to be fair to us and
Yes.
our time in Baringo,
Yes.
just tell us, did you finalize this process of secondment before bringing Faith Kimok?
No.
No.
Yes.
So you've breached the law?
Yes, after writing the letter,
you've breached the law.
I breached the law because I brought
All
her
right.
to
I think we
capacity.
move on from there. Let's just move on. Let's just move on.
Honorable Lekakimon, I think you're done with your questions. You can move on to Honorable Sharon. Please do.
Yeah, thank you, Madam Chair. I have only 2 questions, and I want to ask the CS and the team to be straightforward. Let us not circumnavigate when we answer these questions. You just go straight to the points. My first question is on these statutory deductions of staff. We are informed that this statutory deduction of staff, whether permanent, temporary, or casuals, are sometimes delayed or not remitted. Is that true or false?
They are remitted, but the time is delayed.
Okay. They are remitted, but sometimes delayed.
Yes, the reason, Madam Chair, for delay is because of delay of our release of exchequer from Treasury. So we have had an arrangement with our bank so that when salaries delay, they pay for us the salary to cushion our staff. And then when we get release of our exchequer, then we remit.
So how many times did NSSF wrote to you for the same remittance? NSSF. We heard that NSSF has written you severally on the same.
I think, Madam Chair, the Director, HR can answer that.
Chair, the issue of statutory deductions, I can confirm, being the HR Director, and that is my docket, that we owe nobody any money in terms of remittances, except the issue of reconciliation, nothing else. But in terms of payment, we are up to date as I speak to you. Even the ones for last month, we have remitted.
So you have never received any letter from NSSF complaining of the remittance of the staff dues to NSSF?
We have received several communication, but every time when we check with our payroll, we have done our part. The issue has been Treasury remits, but NSSF does not update because some of the staff we have been having did not, their numbers were old generated. And when, because of the new system, then they don't match the current one, which we did a data correction, shared with them, reconciliation was done, and that's why I'm telling you we no longer have an issue with them now.
Okay, so...
And the casuals who have not been paid, have you paid for them in advance?
The issue of casuals is a bit difficult because as the CS has explained to you for a very long time,
And it's in order to note that you don't say completely you don't have arrears with the NSSF, because the one for it depends with us. It's supposed to be submitted because they've already worked.
Yes, I'm in agreement, Chair. Yeah. What I'm saying is in terms of those staff on contract and P&P. For a very long time, as the CS said, we were not paying these casuals using a payroll system. We were paying them using imprest. People collect imprest, go and pay. But since we started the payroll system, we are actually been remitting.
You're misleading the House. They've never been paid using imprest. Let me inform you, they used to be paid through the account of the sub-county admin, and then they are paid to their accounts.
Yes, which is, they use there was an imprest system one time.
Direct to the casual or through the sub-county?
through the sub-county, and like agriculture, I have even an audit query where there is a query on audit query in terms of interest, which were meant to pay. So there were two systems being operated.
Honorable Kakumon, proceed.
Yes. Now, what about, are you aware of the several staff, whether contractual or permanent, that they have not been receiving medical attention because of you not remitting SHA money to various hospitals? And why, when the budget is there? Because most of the staff go to hospital, they don't get those attentions because the money has not been remitted.
Okay. Chair,
is there a budget for them, or there's no budget for those staff?
There is a budget, Chair.
Yes.
Because
so why
when we do
the
a budget,
delay?
and let me explain to you that normally when we close the payroll, we send the byproducts to Treasury, indicating where the money should be paid. Now, the challenge we have been having for a very long time is that there's a delay in terms of reimbursements from the national government. So what this county did was they negotiated with KCB to pay net salary only. However, because of the challenge, by the time we are paying, we're getting the reimbursement and paying, already 9 has surpassed. We have now, from I think 2 months, negotiated with KCB when they are paying, through the actually a discussion with the governor, when they are paying net salary, they are paying now SHA. As I speak to you, we are, the last 3 months, we are compliant in terms of SHA. But we had that challenge, we agree.
Now, my last question, Chair, is about the transfer allowances of staff. When you transfer allowances from one station to another, normally they are not paid transfer allowances. Why are you not paying transfer allowances? Or they have not even received the disturbance allowances now that you have transferred those staffs?
CS, proceed.
Chair, transfer allowance is the same as the disturbance allowance. We have had a challenge. In the previous budget, we've been working on individual salary per employee, no extra money. We've actually been working with the Director HR to request that we be added a budget variation of 1+1 also, so that we can, because transfers come without plan, maybe in the event that an officer maybe becomes sick or exit service, then we move. So we've never been having a budget. In our CHIRAC meetings, we've done approvals, but the problem is we don't have budget to support. So we say let's give priority to staff getting salaries, and then in this coming financial year, we've requested for about 120 million, including promotion, including other issues, including also that one for transfer, so that we can pay for them.
It's okay, I rest there, Chair.
Honorable Sharon, proceed.
On the issue of transfer, before I go to my questions, I have seen a transfer letter that you did, Mr. Chepkwony. Are you the one to sign transfer letters for employees?
Yes, if the transfer is in that departmental. However, the process of transfer begins from the department at the Departmental Human Resource Advisory Committee. Once they have done the approval, they come to CHIRAC. When they come to CHIRAC, they table their transfers. We look at the reason, vis-a-vis the financial implication, vis-a-vis the delivery of a service. Now, the CHIRAC is, I'm the chair, but it is a body of all chief officers.
Okay.
So if the transfer is within the department, the chief officer does it. When it is moving from one department to another, I do it on their behalf.
This transfer that you did for Jackson Korir in the Department of Finance and Economic Planning, was this interdepartmental? And you stated in your letter that the officer here should move with immediate effect. And this is a person that you're moving, there's no transfer allowance, there's nothing. You're the one who signed the letter.
Madam Chair, as you are aware, we had challenges with our revenue collection. And we had challenges, and a decision had to be made because we cannot allow, when the revenue came down, we need to boost our own source of revenue.
Is this interdepartmental transfer?
Yes,
okay.
yes.
Let's just move to other questions. The CS and the payroll manager, why is it that you're not paying the advocates who are working in this country their allowances for non-practicing allowance? And the board has already approved.
Madam Chair, I'll ask the payroll manager to respond to that.
Or payroll manager, as you answer that, please confirm if you've already facilitated the process of paying the PWDs.
Thank you. The issue on PWDs, we have already started to process.
Thank you.
Yes,
on the next question?
The next question on the advocate allowances, I think that one it is in ongoing, but we are guided by the SRC circulars. Even though
what is ongoing? And you had already handed over the mic to payroll manager. Allow me to just, you want me to go back to you? Please allow the payroll manager to answer that. I've seen letters from the service board approving the payments. And remember, payroll manager, you had said that you just bank on instructions. Once you're told you pay, you make the payments. So what is still ongoing? Which kind of consultation is ongoing?
Honorable Sharon, even though the service board approves it, we must also consult with the SRC circulars.
Okay, what is the circular saying?
The SRC circular do not provide for the advocate allowances.
Are you sure?
I'm sure.
Okay, we'll go back to that. Anyway, my next question is to the Work Injury Benefits Act, the WIBA, and the 4.8 million Kenya shillings that was said to be paid to 2 employees that suffered injuries while they were on duty. 4.8 million, it was paid without a court award, and it arose as a question, an audit query question. Please shed light on that. Who are these employees that were paid 4.8 million? 2 of them, 2.8 million.
Madam Chair, let the Director HR address that.
Okay.
Proceed, Madam Chair, I am aware of the 2.
Yes.
I'm the one who forwarded.
Who are these 2?
There is a gentleman, I can't remember the name. Bulldozer ilimwangukia hapa ikakata mguu. I think most of us know there's a time he was constructing a road somewhere near here.
What is the name? What is the name? What kind of employee is he to our county? Casual, permanent?
He's a PNP staff.
PNP?
Yes. The second staff we paid was a nurse who used to work in Emmening but transferred to Eldamaravine, who got a back issue because of lifting a woman when she was delivering. Those people, what we normally do is that when they raise, we refer them to the OSHA offices in Nakuru. They will assess them and award them.
Is that the law?
Yes, that is. We don't have capacity. They normally go to our offices, our doctors here. Then our doctors will assess, but refer them to OSHA for award, because our doctors cannot give an award. So if we got...
Why is it that the Auditor General say that this was paid without a court award?
Chair, remember we are non-compliant. Let me speak about non-compliance.
Non-compliance in
we are non-compliance in terms of WIBA in this county. Actually, we don't have WIBA, we don't have group life, We don't have group personal accidents.
Who is to be blamed for all this
Non-compliance.
non-compliance?
Let me call it a joint effort. Let me explain to you.
Who is to be blamed among those people that you're saying that they should be jointly blamed?
Executive.
Who in the executive?
Treasury. I would call it Treasury because we budget for it every financial year.
Okay, Treasury.
Yes.
Who else?
Also, when we ask Treasury, they'll tell us the Assembly, the Budget Committee has not provided for a budget line.
You know it's not the Budget Committee to provide a budget line, it's the Treasury.
Okay.
You want to blame the Assembly?
Not really, but I'm saying it's an effort all of us must make because we have actually done every year, even this year.
Have you confirmed, when you check the budget, have you ever confirmed that they've done that proposal as the Treasury? Have you checked at any point in time and you saw that they'd made that proposal?
Proceed, CS.
I sit in the cabinet, and year in, year out, our proposal to the budget committee as the items on WIBA and those items on our insurance.
Correct, we'll follow that. We'll follow up on that. If that is the case, we'll do a follow-up. Are you aware of the 3 staff operating the drilling rig whose, the 2 of them, they have very serious injuries. They lost, one of them lost 2 fingers, one, I think, 1. I don't know if you're aware of those 2 personnel who works at the Department of Water.
CS, proceed.
Madam Chair, I'm aware, but these officers are casuals.
Casuals or are under contract?
Are casuals.
Do you know that they have a 3 months contract?
Madam Chair, they are casuals. Even I have a document here from the Chief of Water requesting me to convert them, the drilling team, to convert them to contract. I asked her, let's work with the budget team to provide a budget on 2024-2025 financial year so that we can be able to onboard them on contract.
Okay. Let me ask you, now that they are casual workers, are they driving a car that belongs to Baringo County with the insurance?
Madam Chair, I've written to...
Please answer my question, CS.
Allow me, Madam, to also respond. Madam
If
Chair,
you don't respond the way you want, I want you to respond so that we move very fast.
yes, and I've said there are casuals who are driving, but I've given instruction that no casual should drive our cars.
Okay, what happens if they get an accident because they are currently operating? What happens? Who is liable?
Those are the challenges. It is the accountable. You see, I manage HR from the departments through the accounting officers in the department so that the people who are liable.
If they go to court, who will pay the damages?
Of course, it is our government, but the responsible officers will be surcharged.
Baringo County will pay them in case of any injuries that they've occurred, that they've gotten out of when they were in duty, right? Even the injuries that they have right now, it's Baringo County to pay.
Madam Chair, it's true. Like we failed to give. It's true. We failed to give WIBA.
Okay.
We paid for the injured PNB. So,
okay, let me ask you.
So, allow me, Madam, to also.
Okay, no.
Chair, a request for protection so that we can be able to understand.
Okay, I've understood.
Yes.
I've understood.
Yes.
You don't have to inform me when I've already understood the question. Just allow me to guide you. Now that you decided to discriminately pay those who are in PNP, leaving these casuals that are literally suffering with no NHIF, no medical care, nothing, and you decide to compensate them over those who are in PNP. Why did you discriminate them?
Madam Chair, which law will I use to pay a casual? You are a lawyer. Which law will I use?
Okay, which law, are you aware you're breaching the law by allowing people to operate our very expensive machinery with no letters for employment?
Madam Chair, personally, I've communicated to every accounting officer. And I said earlier on, this is a systemic issue.
Do you have a letter?
I have
of the
letters
same
to that effect
that,
for drivers and casuals that don't engage because we don't have a way of protecting them. And I've written to that.
And in fact, there is a law. And in fact, there is a law. When somebody gets a casual worker, when that person is working under you as a casual worker or whatever, and he is involved in an accident during a work session, you are entitled to pay that person. I'm a lawyer, so I know that.
Okay.
So I know that. Now that you know the law so much, why is it that you've not paid them?
Madam Chair.
And HR, you can tell through the chair, you can specify that particular law that says that if you bring somebody on board, even if it's a day and that person is involved in an accident, you are entitled to pay that person. It's the law and it's very clear. HR, please elaborate on that, please, through the chair.
Honorable Locales.
Thank you, Chair. Something to get some more clarity. We are told by the Water Department that this casual who are operating our rigs, whom we are calling illegal, have done tremendous work in this county. They have dug over 150 boreholes, which have benefited Baringo County, and it has reduced our budget implementation by a very good margin. Now that you want to, because of this issue of compensation, you are running away from admitting the liability because you know the right thing that you did not do from the word go. Now all this credit we are getting from these casuals, why are we happy when it comes to the credit part? That this county has done good job, Water Department has done 150 boreholes, but when it comes to their payment, when it comes to their confirmation, we want to say, no. These people, in fact, the person who engaged them should carry the blame. The CEO who engaged them should be charged if they go to court. Can you also tell us if these people now will demand the lump sum amount of money they have served this county from 2020 up to 2025? We pay them and compensate them before even you decide to fire them. And we can be their advocates for free.
Proceed, CS.
Madam Chair, you see, engaging workers as casual as a process. And I had earlier on said this is a systemic issue. Madam Chair, if you are in my shoes, with due respect, and you are asked, this is a letter, the chief officer has already engaged, these people are working very well, Mashimwa, they are serving us. I don't have money to convert them to contract. If you are in my shoes, what do you do, Madam Chair? We are constrained by budget, and I'll be committing another illegality, especially punitive illegality, to engage people when I know to commit the county government to a contract when I know there's no money in the budget. And that is why I say this is a systemic issue, which really, I had even gone ahead and I can produce that document. I had said all these workers who are in contract, I wrote to the board and asked them, can we convert them? But there was no budget. It came back to me because there was no budget. So for sure, what is constraining me, I feel for them. I feel they are giving us a service. But what is constraining me is there's no budget allocation to enable me on board them. So my hands are tied, Madam Chair. And I want us, I appreciate this engagement, and I want us as we move forward, so that it will not be a problem of the CS or Head of Public Service alone. It will be a concerted effort, both the executive and the assembly, to see that our workers are given fair justice.
Chair, allow me to ask on these rig operators. They're being paid 20,000. Some of them.
Madam Chair, I don't know even on the mode of engagement because there is no letter even committing them to them. I asked it.
You said that you have the contract there.
No contract. I have a request from my chief officer.
Okay, we've seen their contracts. They have a 3 months contract that was expired and then it was again renewed further.
Madam,
and they're being paid.
Signed by who?
By Milka.
Then the contracts are always signed by the board and delegated to my office.
I love when we are getting there.
Yes.
Let's go to the agricultural officers. Before we go there.
Sharon, Honorable Cielo want to inform you. I don't know whether you need the information. Proceed, Honorable Cielo.
Thank you, Madam Chair. I think the county secretary will not run away from this problem.
Yes, sir.
You've served as the DG for 5 years. You are now serving as county secretary. We are about 3 years now. So when you speak of these illegality and systemic issues, you are part of the system and you are part of the problem.
Madam Chair.
So you cannot run away. In fact, from my own observation, you are the constant problem in a county government.
Madam Chair, I need to be protected. As I speak now.
How can I protect you so that I protect you?
Let me explain. As I speak,
the protection you need, I'll give you. What
yes,
do you want?
I speak as I speak now. I speak as the county secretary of Baringo, which has a mandate and specific roles. In the previous regime, I was a deputy governor who was supporting the governor. There was a break. I went out in 2022. I came back in 2023 in a different capacity. My mandate that time, Mheshimiwa, is different from the mandate as I speak now. So, I can't be crucified, Madam Chair. Honestly, let's put things straight. Let's see, Madam Chair. Honorable Cielo was working with the previous government as the GD officer. Right now, is working as an honorable member of the assembly. He has a mandate, and he had the other time a mandate. Can he be crucified for the wrongs now of the previous? No.
Let me protect you, CS. Let me just give you a very clear one. Let me now go to a place where you are safe. You are the deputy governor in the last government. This one, you are the CS, which is more powerful. When you came in, Kiptis was your boss. Actually, he made you the deputy governor. When you came into this regime, what did you do to his staff? That you are aware we are talking about the GDU. And what did you do to your staff who were tenured?
No, Madam Chair. I left the county government in 2022.
I just want us to be on the safer ground. Now we are on the safer ground. We are talking about you and Giptis.
Yes.
Who Giptis accommodated you to be the DG.
Yes.
And now you came all along, you become the CS. Giptis didn't have powers over this government. But now you came in as the DG. You had the tenured staff. Giptis had, and you had them. When you came in, what happened to yours and what happened for the one for Giptis?
Madam Chair, when I left my staff and the staff for the then governor under a contract. And by then, there was a CS who was in that office.
Yes?
Yes. Personally, I went. Then I came back in March.
Yes.
So I expected my staff to have also left because they were tenure.
Proceed, yes.
One of my peers, let me call upon Vice Chancellor, remained in office and requested the then late Governor Kimwok to engage him. Kimwok engaged him through the service board. The same as the Chief of Staff has explained. 3 officers of mine, the cook, 2 cooks, and 1 driver. 2 cooks were transferred to Kabartonjo.
Who transferred them?
They then, yes.
And be informed that we are in that hospital and you have information.
Yes.
Proceed.
Yes. Then the driver went to Mokocho and then later on went to Lamravin.
Proceed.
When I came back in July, the chief of medical services wrote to me requesting for extension of contract for staff whose contract had expired. And honestly, I wrote to the service board requesting for extension of contract for these officers who are serving there and serving.
That is for who?
That is for the 2 cooks and for the driver in Eldama.
That is your staff?
That's the staff now who had been transferred to Elta. And when they came back, I found that they're in the system because I came back in April 2023. So when their contract ended, I requested to the board. Then the board delayed, the staff continued working. Then later on, they told me this staff was supposed to be on term contract. What are they still doing? I said I requested because of the request from the department, asking that this service is needed for the cooks in the hospital and for the driver driving the ambulance. So if actually...
you've not finished. I'm on your case. This is a safer ground.
Yes.
I'm talking about Kiptis now. What happened to employees?
Now, the employees of Kiptis, when their contracts ended, some left. Others are the ones which the chief of staff was raising. And that is what happened.
That is a safer ground. Honorable members, you have information. I want you to ask questions to the CS, and I'm sure you'll not ask for a safer for protection. You will answer them comprehensively. Members, proceed, starting from Honorable Sialo. Honorable Layengo.
Thank you, Honorable Chair. We say history repeats itself. I know, Madam Chair, that when our CS, who was then Deputy Governor, left to office, we have workers who their contracts were renewed and they continued. We have the cooks. Madam Chair, it is so pathetic. We went, and it is good to go for fact finding. We went to Kabartonjo. We were really touched the state of those cooks, and you know they were cooking for you. I think they were cooking for the deputy governor. They were just dumped there, no budget. They were left there under the mercies of God, not even the hospital. Now there are other staff whose contracts continued, and even some of them changed to PNP. Under the swearing, Madam Chair, I wanted the CS to just come clean. Just come clean. How many of your staff were retained here? How many were put in PNP? And then we just forge forward. And then also the case of, I know the chief of staff left. And there are those staff also, the 7 of them. 3, including our payroll manager, were retained. Director HR, there are those in service board, and therefore were discontinued. I mean, Madam Chair, this is discrimination of highest order. Some of them, you know, they have families to feed. I don't want even to explain. Just tell us what really is happening so that we can, especially those in Kabartonjo, they are at a lower cadre, but they are suffering a lot, Madam Chair.
Honorable Cielo, proceed so that you'll be able to answer all those questions.
Thank you, Madam Chair. And I'm really shocked the Chief of Staff has left, and you had given a ruling that he stays until the end of this session. With me here, Madam Chair, I have two contradicting letters. One letter, if you remember, Madam Chair, the Chief of Staff denied that and refused completely that he did not write any letter of termination for the employees that my colleague has just mentioned. But with me is a letter. And this is a memo, this is an internal memo. It was written on 5th May 2025, which is recently, and it was addressed to the county secretary. Last week. Yes. And the letter reads like this, if you allow me just shortly.
Proceed, Honorable Siano.
Thank you, Madam. The above subject refers, the below list staff have been employees of the Office of Governor, and they've been on contract from 1st November 2021 to 31st October 2024. Number one on the list is Matthew Kipsorno Chebet. PF number, it ends in 99994. He was a communication officer, job group K. Second was Mary Chepsergon Chumba. His PF number ends with 20450, communication officer, job group K. Third was Dennis Ruto. His PF number ends with 99960. He was an administrative assistant, job group J. The fourth was Lux Kipchirchir Tuitoek. His staff number ends with 99986. He was an administrative assistant, stock driver, job group G. Their contract has not been renewed since then, and therefore I request that their services be terminated from 1st June 2025 and their dues be processed as soon as possible. The same position should be advertised as soon as possible, and they should be allowed and considered for, I don't know, it's not clear there, but they should be allowed to be interviewed. That is the letter. Then there's another letter, Madam Chair, which is also an internal memo from the county secretary to the Secretary Public Service Board, dated 5th May, the same day, 5th May 2020. The other one is coming from the Chief of Staff to the DG, but now this one comes from the DG to the board on 5th May. Reference is renewal of contract for 8 months. The reference is made to reference number from the Office of the Chief of Staff on the mentioned contract, copy attached. Since the staff continued providing services after expiry of contract on 31st October 2024, I hereby request the County Public Service Board to renew their contract for an extra 8 months to enable us to pay their salaries for the months they have been working before a decision was made to terminate their contracts. Kindly facilitate this request. It is signed by the County Secretary, copied to the Governor and the Deputy Governor. So, Madam Chair, I don't know if the CS is aware. Initially, I had refused that.
Proceed, Honorable Sharon, before you proceed.
Now, my final question is on the same issue that Honorable Engo has raised. Honorable Chepkwony, I know you appreciate that during the first term of Honorable Cheboy 1, all his tenure employees were confirmed. Is it right?
Yes.
I'm not aware, Madam Chair.
Chepkwony, I want you to be sincere. I worked with you. I'm not new in this government. And this is our government, Baringo County government. You are not new. We know almost every employee. The employees that used to work under you in the Department of this disaster came from where? Who gave them those contracts? Chepkwony, you must be honest.
Madam Chair, when I came in as a Deputy Governor, I found officers already onboarded on the system. And I've never actually gone to look back that because by then.
Yes. You say that you say you don't want to talk about them, or you don't lie to this house. You took an oath.
I don't have information.
Remember, stop it. Even me, and I'm an MCA who came in when you were the DG. And we always hear those things. As much as they are not official, you are aware. And you would not want to be informed over issues that you know, and now you're the CS. Even you yourself, your tenure staff that you, Honorable Oengo have informed you, you confirmed them on PNP, and they were tenure staff. You still want us to tell us that you are not aware? Honorable Cielo.
Thank you, Madam Chair. And so when the regime of Honorable Kiptis, came in, and you were the DG, Kiptis had his employees who were under a 10-year contract. Some were working under your office, some under the office of Honorable Kiptis. When you came in as CS, you decided to take up all your employees, from those who are your drivers, your PAs, including the cooks, and put them on contract, leaving aside those who are employees of Honorable Kiptis. Some of them now are on PNP. We wonder how you change their contracts to PNP in the system. And I think payroll manager should also attest to this and give us some more evidence, because we want to know who changed the terms of some of these to PNP in the system, and on whose instructions. So, Mr. CS, was it really fair for you to actually confirm your employees who are under your office when you're the DG, and leave those who are under Honorable Kiptis? Recently, there was an officer who was working as a GDU by the name Kurere, you know. That staff, you decided, I don't know on whose instructions, to transfer or give him other duties as the MD Chemasusu, with the same terms. But you left the others GDU members who are working under the regime of Kiptis. Was that really fair? Or whose government is this? Is it your government or Honorable Cheboi's government? Is it our government all? Why is it that you're becoming unfair to others, and you want to favor others? Thank you, Madam Chair.
Madam Chair.
Honorable Sharon, so that you answer them comprehensively, then we close the session.
Chair, I'm well informed that even those transfers, the extensions of contracts that were done, and even changing some into permanent and pensionable basis, were not approved by the board. And the CS should tell us why he decided to bestow himself powers that doesn't belong to him.
CS, proceed.
Madam Chair, for that it doesn't want to work again because of the death in Chemasusu. So what happened is that consultations were done. Kiborei, who is in Treasury, was requested to go there. Requested to go to be the acting MD because there was no board. So Kiborei declined. And after consultation, I was advised that we extend Kurere to go and support because there was no MD. So
you are advised by who?
We wrote, of course, from after consultation because of the management of the water body.
By who?
By the executive. So from there.
CS, who in particular? And was it in writing?
We wrote to the board. We wrote to the board. As head of public service, I could not sit down to see.
On whose permission?
On the permission of the executive. So I could not sit down
to
see Chemasusu.
What is executive?
In
you know, here we are the assembly. You cannot tell me the assembly said. And you cannot tell me the executive. Who is the executive? You are the executive as the CS. Who is that executive that gave you orders?
Madam, staff who work as GDU, LCDU are staff who support governor's office.
On that note, it's the governor who advised you.
For emerging.
It's the governor who advised you.
Madam Chair.
Or you just say you don't want to say it so that we proceed?
Yes, I don't want to say, Madam Chair.
Okay, proceed. Honorable Sharon, the point is home, don't be labor. As long as you're not coming on that point that he was...
Chair, I had asked, how can the CS do things like confirming an employee, one FRIDA, into permanent and pensionable basis without the approval of the board? And how is the payroll manager paying someone, like whose instructions were you acting under payroll manager? You can answer that and then the payroll manager can tell us if there were proper documentation on that.
Noting on that, Honorable Chepkwony was moving sequentially, and I know that answer will come. Proceed with that. I want us to conclude on that matter. The executive gave you orders.
For Gurere, we wrote to the board requesting that there's no MD to support her.
Honorable Sialo, you're getting your answers.
It's a temporary measure. And actually, as we speak, the board approved it, and we took Gurere to Chemasusu. And he has done a good job. When his contract ended, he had already put a board in place. And now he has been, from 1st of May, Kurere, the board found it better or good to have Kurere continuously advertise for, because the role of advertising for the MD lies with the board of Chemasusu. But by then, there was no board, and we could not advertise, and so we had to second an officer from the Medicine Public Service to support.
Proceed.
Madam Chair, I think just a point of interjection. I want more information, Bona CS. When was the contract ending for that said person?
Maybe we need to look at the file. I don't remember very well, but by then we had to renew the contract.
So the contract had?
I think it was almost
elapsed, yes?
No. Most of the GDU were ending around, I can't remember, but I can provide that information, Madam Chair. So we had to write the board to renew, to have somebody to hold on the organization. And that is what we have done. And Madam Chair, if the honorable members of Assembly from Koipatek are there, they would actually attest that we did a good job to save that institution.
We are done with Korere. We are proceeding.
Now, on the issue of...
Maybe, Madam Chair, why not extend the contracts of the other GDU members? Was this person special?
Of course, it's because of the need and the qualifications he had.
How about the others? You know, Honorable Sialo, I was waiting for him. You had almost around 4?
Yes.
Yes, we are still waiting for the rest.
From those who are there by then, the only person who had masters in business management, because that institution...
It's okay now for Kurere. You don't have to be labor. The rest, you know, I gave you a very safe... Listen, yes, I gave you a very safe playing ground.
Yeah.
You will not say protect me or do anything.
All right.
You know, this was your co-governor. And as an honest person, what would you have done to his people who have remained in this government?
Madam,
and number 2, the confirmation that you did to your staff, and they were tenual. You will not tell me for Giptis they were tenual. Yours also were tenual. And even yours is more grievous. You put in on PMP without even the approval from the board. So I want you to tell me about what happened to the discrimination of these others who went home.
Madam Chair.
In the powers that were bestowed by this government of Cheboitu.
Madam Chair. let me just be, if you look at the extension of those contracts, it is not me. And I want to ask the members, is there a place where I've appended my signature? You see, I also left office in 2022. And I left
do you see you are the most powerful now than even in that time?
But now when
because honestly,
yes.
if you're able to put your staff on PNP, which is very competitive, everyone is. Do you have those? Can you even confirm first? Did you put them on PNP?
No.
The Frida, the one you're saying, and the three of them.
Madam Chair.
Honorable Sharon.
I think for us to move forward, and I'm seeing that let him just answer one question after the other. The issue of the GDU and his office, he has confirmed that he confirmed his own of people who are working with him, and then he left those who are working with Kiptis. Do you have an explanation to that?
For GDU, Madam Chair, I see there's only one officer on the request of the board by Kurere whom contract was extended.
So the rest were released?
The rest were released.
Why were yours confirmed and not the rest?
I didn't have a GDU officer.
You did? Okay, why are people who are working under your office confirmed or given extension of contracts as opposed to the rest?
No, Madam Chair, I said before I left, 6 months down the line, the officers who were working in my office were deployed.
Okay, who deployed them?
Before but they didn't see us. I was not a CS.
Okay, okay.
And then I left, and then we went to politics.
And then
I came back after almost from August 2022 to April 2023.
Okay, Frida was made a PNP worker employee this year, 2024. Without the board's approval. What do you have to say about that?
No, not 2024.
When?
I think in 2019.
It's not 2019, it's 2024. And HR, please, and payroll manager, I don't know if there's anyone with that information.
2019.
Please confirm, HR, was it in 2019 or 2024?
2019.
Chair.
And these are documents that you can extract.
HR, proceed. And
Chair,
before you go even to that HR, I want us to close from him. We are not coming back to that question. That you are abiding that Frida, the 3 employees that were yours, that were tenure, were confirmed in 2019.
Those who went to Kabartonja's cooks and a driver, the 3 were given extension of contract. Which
those one even leave them there. They are
yes,
on the mercies of the Lord.
Yes.
They even don't know what they are.
That's what I'm saying. They were given an extension, and then which ended in July.
Why were they given extension yet they are your cooks?
Before I left, they were transferred there.
How?
Yes.
Are you aware
yes.
that we did a fact finding, and the sub-county medsup for Gabartonjo wrote a letter to you?
No. Wrote a letter to me to ask for extension, and when I got the letter, I wrote to
asking you about those employees because specifically they were your employees.
Maybe, Madam Chair.
And I want us to conclude because you know where we are going on these issues, and they are there.
If that letter can be produced, Madam Chair, which they wrote to me,
we will produce them
yes.
in due course.
Yes.
I want you to just agree to confirm to me about the tenure staff that they were confirmed to PNP when?
2019. One. That is the one Madam is talking about. The other 3 were given extension of a contract.
They are not on PNP?
They are not on PNP. And even now, we have never paid them. And I think HR and...
Honorable Cialo, Honorable Sharon, please proceed.
Allow me to call upon the HR or the payroll manager to clarify this information. There's no point of being taken round in circles. Was this Frida confirmed as a PNP in 2019 or 2024?
Chair, I might not be, because it is actually records available in the payroll, so I can't confirm that.
Payroll manager, please.
Okay, thank you. She was confirmed in 2019.
2019. Yes. And these are documents that we can get from your office on confirmation. Payroll.
Yeah, we can get those documents from our file.
Ayabe, are you ready to take the liability?
Yes, of course, because...
Of course, you're ready to take the liability.
Yes, because...
Chair, I request that these documents are supplied to us before we make a very drastic decision regarding all these shenanigans that is happening here. And my next question, on, not a question, information that I have, the CS, the former CS, is alleging, which it might come, but I've gotten information that his signature was forged. When it comes to certain contracts that has to do with you, the CS. What do you have to say that? And if that is the case, are you ready to take liability on the same?
You see,
proceed.
Signature, yes. You can do forensic, Madam Chair. And
okay, we can do forensic on the same?
Yeah.
And see, as when you're away, there's a letter that was signed on 30th of May 2025 when you were in China. How did you send that letter to the board?
Now, Madam Chair, while I'm away, I handed the office. I went and there was nobody to take over the office. When I was there, I was informed this information is needed. Normally, I have my scanned signature. What the letters are always written, sent to me, read, and once
so you signed electronically?
Electronically.
Okay.
Don't you think that can be abused?
No, Madam Chair. I keep a track. Any letter which has been signed electronically, there's a register way, and then I come and confirm. I confirm. Because before it is done, they have to send to me. And you see, the office is perpetual. And service delivery must continue. You are an honorable team, and I could not have frustrated the efforts while I'm away.
Honorable Sialo.
Thank you, Madam Chair. And I want some clarification from the CS. What's special? Was it that the employees who worked under you were very special, more than those who worked under Kiptis? Just listen. Number two, you responded rudely to Honorable Sharon that you did not have a GDU officers in your department. But the people that you've confirmed in your department are drivers, the PA, the secretary, leaving the driver for Kiptis, the secretaries, and all those others. Now, what is more special in this lady that you confirmed to PNP, the other ones under your office, the contract was extended. But this particular lady in your office, who was working under your office, his contract was changed to PNP. What was more special? And is there any relationship to that regard?
Madam Chair, there's no relationship. That's one. Two, Madam Chair, I think the honorable member is asking me what I've answered. There's nothing special on these officers. And I want to apologize. I didn't answer Madam Sharon or Honorable Sharon rudely. Sharon said the GD officers in your office. For sure, the GD officers are in the office of the governor, not in my office. And you are quite aware, Honorable Shello.
Before we go to the next question from Honorable Sialo and Honorable Sharon as well, I would want to ask Payroll Manager if you are aware of the 3 and maybe more staff that was sneaked to your payroll without the knowledge of the board.
And the only thing I want to know from you, if you will take liability. If we do our investigations.
Okay, thank you, Chair. What I can answer there or respond, always in the payroll, we don't get any response from the board. What we get only authority or a letter from the CS. So we don't get anything from the board.
The last time you were here, payroll manager, you said you don't put people on payroll until you get approval from the Public Service Board through the CS and a budget and also the HR. At what point did you now decide that you don't need approval from the board?
Upon the recent the change of the system of the payroll, things change. So even issuing of personal numbers.
Payroll, Mr. Abe?
Yes.
In a week's time? The
Yes,
system has changed in a week's time?
Not a week's time.
But you were here just last week.
Yes,
listen, you said you cannot pay anyone without the approval from the board, number one, through the CS, with the budget and the HR. And if you don't have those documents, you will keep waiting until you get them so that you pay them. At what point did you decide?
Okay, that is very true. The Chair, it is very true. Of recently, the government changed the process of the issuing of personal numbers. But before, from 2013 up to very recently.
Honorable Sharon, you are not on mic.
Chair, I wanted to know until very recently, when is that recent? Can you tell us the year at least?
I think from 2020, if I'm very wrong. From 2020.
If you are very wrong or very right?
If I am very right, I mean. If I am not very wrong.
Okay. So,
I was just asking you, will you carry a liability? Because, we are doing justice to people. We want to cure the injustices that are happening in our county. That somebody is under PNP, and the board are here, and they've said clearly, there are people who've been sneaked to your payroll without their consent. Are you ready to bear the liability? As a certified finance person.
Chair,
and also a person who've taken an oath today.
It is very true, Chair. I said long time ago, from 2013, approval of the board was not needed. Only the county secretary, we got corresponding from the county secretary. So until, I think, 2020, if I am right, that is where the system of issuing of personal numbers changed. And in fact, from this year, it also changed further again. That is where we need, the authority letters were needed, confirmation of the funding, and the authority was needed. So a long time ago, only
authority from who?
From the board and funding, all those issues. And the letter from the county secretary.
So the ones you sneaked in, that they alleged they were sneaked, is when there were no requirement from the board?
So I am not aware of those who you are saying they were sneaked in.
You are not aware, but I'm telling you, we are doing our own fact finding, and if you find it, that you've sneaked in without the knowledge of the board.
It's true. It's true, we got a letter from the CS.
Thank you for confirming. Members, proceed, Honorable Sialo.
Madam Chair, I think I wanted to find out if Ayabe knows his boss. Whom are you supposed to report to?
I am supposed to report to Director HR.
Director HR?
Yes.
So that means any instructions that comes to your department must come from your boss, not any other person. True or false?
It is true.
So the instructions that you received from the CS were not proper instructions, and in fact, that transaction and or whatever you did with the CS is unlawful.
And
it is a theft.
When we had now the director HR very recently. So before that one, we had no director HR. So we are getting direct authority from CS.
So you've said, okay, let me take you back a bit. You said that instructions used to come from the CS since 2020.
2013.
2013.
Yeah. Yes.
No, there's a point where you said you needed not to receive instructions from the Public Service Board until some laws changed.
Yes.
Are you aware that since inception of the devolution government, the Public Service Board has always been there?
Yeah.
And it is the work of the public service to employ, to hire and fire.
Honorable members, I agree with that one, but correspondence were not coming directly. Even now, I don't get any correspondence from the service board. We receive the instruction through the CS to director and then comes back to the payroll. So before the director was employed, I think 2021.
I think it's clear.
Yeah, we are getting instruction from the CS.
Our CS. You've heard Ayabe himself saying he received instructions from you.
Not this CS, the previous CSs.
No, we are talking about who entered these, the names of, change the details of this lady to PNP in your payroll. And on whose instructions? You said it was a CS.
Not this.
Okay, confirm.
Not
this one.
Not this one. We just get authority. Once we get the authority from the CS, from the previous CSs, we continue, we process before the change of these processes.
Madam Chair, I think so that this thing.
Of the same staff for the month, for the year 2023 June. Those payslips will actually guide us and tell us, will give us a correct picture of what it was.
Honorable members, allow me to close that chapter. The payroll manager, you've added, we need the payroll so that we can confirm when actually they get to the PNP. Tomorrow, 9 a.m. Please, payroll manager, confirm. You are not on record. Payroll manager, you are not on record.
Oh, you said okay, you need the places?
Did you get the months from Honorable Sialo?
Yes. He said from the month of June?
June 2022.
Yeah, and June 2023. I will provide.
9 a.m. tomorrow.
Yeah.
Thank you. Proceed, Honorable Locales. Honorable Sharon, you're not done? Kindly finish.
Let me finish so quickly, and this is to you, CS, on employments that were done in the Department of Agriculture, of livestock and fisheries officers. How many positions were advertised?
Madam Chair, 123 positions.
How many people were employed?
149.
149.
Yes.
Do you know why they inflated the number to from 123 to 149?
Yes, I'm aware.
Why?
There was a cabinet decision.
There was a cabinet decision.
Yes, upon the request of the CEC Agriculture.
Can we get the requests from the CEC?
This is the...
My friend, yes, don't table that thing. She's on record that she didn't make any request. She made a request of 123, the indent. The one which is beyond 123?
Sorry, the 26 is upon the request from the accounting officer, agriculture.
Okay, and...
But the tabling of the motion or the request in the cabinet was by the CEC, and the cabinet minister here.
I'm sure you're watching what
Yes.
these people are saying. Did you hear what she said?
You
I
see,
don't want to answer that. Honorable
but-
Sharon, I think you're on her.
Let me-
I kindly inform him before we proceed to do what is needful.
The cabinet secretary said that she only made a request for 123.
Agriculture.
Yes,
CEC.
Agriculture, CEC.
Can I explain, Madam Chair? The initial request, which the director is here also, is a nature, was 123. The recruitment process, I forwarded the request to board. The recruitment process took more than 9 months without people being appointed. 12 senior officers, with the list is here with me.
They retired.
Retired.
Okay, we know that story.
And when they retired,
Yes.
before the conclusion of the 123, the CC himself brought the request to the cabinet.
Okay.
And for extra 26. And the acumen, we asked it, how do you employ 26 from 12? He said they are at senior at N and M, but you want officers at entry level. The director was tasked to calculate, and it came to a number of 26. After that was approved by the cabinet, then they tasked the CEC, the Department of Agriculture, the CEC, myself, to work and place the request to the board.
Okay, let me go back. Now, there was an advert that was done for 123, yes? It was, according to you, it looks like it was done like 9 months before the appointment.
I think...
no, I'm just following what you told us.
It took time.
9 months?
Let me, because I'm on record, so that we are factual.
I see. You know you've been on record from the get-go.
Yes, I said approximately. Because
approximately 9 months.
Yes.
So it took approximately 9 months before?
Let me put it correctly. You see at times, Madam Chair, let me just say it took a long time to conclude until other 12 retired.
How long is
the length I'll be able to check from our records. When was the advert placed and when was the conclusion done? I'll be able to provide that.
You are the head of that of public service. I would expect for you to give us the approximate amount of time will help us in this regard. Let me allow me Aengwa to finish on that part, please.
Honorable Aengwa, I can see Honorable Sharon wants you to allow, if it's okay for you to allow her to finish.
On that particular part, yes.
Maybe it's an information that will guide you.
Okay.
Bwana CS, you said between that period of time, 12 other employees retired. Between 2013, during the inception of devolution, up to 2024, when the 123 were advertised, was there any employment in between from the Department of Agriculture?
Chair, the 123 was employed because for a long period,
I just want you to be...
For a long period, there was...
I just want,
Yes.
I've given you a question.
Yes.
Direct. Between 2013, during the inception of devolution, up to 2024, when the 123 vacancies were advertised, was there any employment between that period?
There was none.
Yes.
Yes.
Now, Bwana CS, what was the hurry if this county survived from 2013 up to 2024, minus replacements?
Madam,
what was the hurry of bringing in the 12, the purported 12, which was ballooned to 26?
Okay.
What was the hurry?
Madam Chair, since 2013.
And was, let me also ask you, because this is blatant lies, was
the CEC blind so that you could not foresee the retirement. See, up to now, I think even other departments, they call and they give briefs, they get letters. Employees who are due to retire get letters of reminding them that they are about to retire. I mean, when this 123 was being advertised, the department was asleep. They didn't know that 12 others were going to retire. Madam Chair, let the honor of the question continue.
Honorable Sharon?
Can I respond, Madam Chair?
Yes, you can respond as Honorable Sharon takes your...
Madam Chair, I've said categorically, since 2013, up to the recruitment of the 123, there was no agricultural officers recruited. And it became a crisis in this county. And we didn't have money. We didn't have money. We could not employ, we don't have money. The department placed a request. The 123 had no money until a budgetary allocation was given by the county assembly. The reason why there is no budget, salaries are recurring. All these years they go, that money changes to development. Now,
still, CS, let's just go back directly to the issues of agriculture and those people who are employed so that we move faster. Because if we revolve ourselves, we go back, we will not finish.
Yes, Madam Chair, I'm coming to the agriculture.
Okay.
So a policy decision was done by the cabinet that moving forward so that we are not in the way we were from 2013, any exit, either through natural attrition or retirement, must be replaced immediately before the financial year elapses. Now, the advert for the 123 was because of a provision of budget through the executive by the assembly to address the seriousness of understaffing agriculture. Now, when the 12 retired, the CEC came after that policy directive was given that any exit must be replaced to avoid loss of that money. So when it brought to the cabinet, where I am the secretary, but the decisions are made by the CECs, they approved her prayer. When they approved her prayer, she was tasked, plus my office through the HR, to calculate these exits of 12 can employ how many. And she cited two issues.
Let's allow him, Honorable Layango, let's allow him to finish. He's almost concluding, so that we belabor on that point. I will give you an opportunity. Honorable Layango, let's allow him. Okay, Honorable Layango.
My questions normally are direct. I don't beat about the bush. I asked CS. The intent was
123.
Was done, isn't it?
Yes.
For 123.
Yes.
The CEC wasn't aware that there are other 12 staff who are due to retire.
And on that note, CS, remember your chief of staff for health was here. She has foreseen retirement until June. She's already asked for those employment. And she has given a wish list and she has given 17. And they're already being recruited.
And I've provided...
I want to help you, CS. You know, lies will never meet. You will try to connect them, and they will never. Like this agriculture CS, or the CEC on agriculture. She has left you in the limbo to just lie to this house. She said, I'm not going to answer.
Yeah.
Who can we ask this question? I'm not going to answer. You can ask the CS. And she distanced herself from that 26. And here you are, you have a letter that you're saying she brought it to the executive, the cabinet, and you are the boss. Now she has left, and you watched it, I'm sure. Then tell this house that the CEC Agriculture lied to this committee.
You see, cabinet minutes, there is institutional memory. And I'm not alone. I'm only the secretary.
But remember, today you are alone, CS, because you've said she's the one who I want you to table those documents.
Yes, you will.
Please.
I'll provide the documents.
Do you have them here now?
Yes, and you can.
Please proceed to table.
I'll table.
Please proceed first.
Yes.
To table. With the minutes from that cabinet?
Let me just.
Let's allow him to table first.
The minutes from the cabinet, the extract of the approval. This is the request. This is the minutes, an extract from the cabinet, which I've provided. I've also provided the request, my letter to the board, attached with a letter from the department, placing the request. Then this is the list of staff who retired, which also the Director General can clarify, which is here. Now, I've also attached the board minutes, which were discussed and approved and sent to me. And I've also attached, these are the documents which I've provided. So, Madam Chair, I'm just clarifying in short so that you can any. I've given the approval by the cabinet after a request from the CEC herself, and you can qualify that from.
Yes, the 26 are on PNP or contract?
It's on contract.
All of them, the 26 of them?
Yes.
On which job groups?
You see the list of given shows an agricultural officer assistant, and they are on the job groups, which are given by the board.
Proceed.
Yes, after that process was done, I forwarded the request to the board deliberated and employed them.
And also you proceed to tell us who signed the employment letters for the 26. And why is it the chairman, Public Service Board, and not the secretary? Honorable Sharon, proceed.
Anyway, I think, Chair, you've just preempted my questions. Anyway, I'll still go back to the procedure of bringing on board the 26 extra employees. Was those extra positions re-advertised?
They were not advertised.
Why?
The cabinet gave a directive that instead of taking long and the money crosses the next financial year, let them pick from the merit list of those who had been advertised. And the board is not the decision was accepted by the board because they are the employing organ.
Okay, let me ask you. Section 37 of the Public Service Commission Act requires that vacancies be advertised before filling them, ensuring, the reason why they are done is to ensure that there's transparency and you're able to reach many people. Because remember, you said that the first advertisement was done about 9 months before the appointments. So that took a very long period of time. So do you think it would have been prudent to do another advertisement so that you can reach so many people and create a level playground for everyone who wanted to apply that job?
You see, Madam Chair, advertisement.
Proceed, yes.
Advertisement involves a cost implication and time and the need for service delivery. At that time, our financial year was also coming to an end. So we didn't have money for advertisement, and we need to have these officers, and we didn't want the money to cross to the next financial year because we shall not have it. So
Chair, Chair, through the chair.
Yes.
And something that I remember very well.
Yes.
I remember we had to pass a supplementary budget so that we can accommodate the 26 those extra 26. And remember, for a department to do such a request, they must have a budget for it. In this instance, there was no budget. We had to do a supplementary budget. Number 2, was there an indent that was done by the CCM requesting for these extra people, apart from the minutes that you've provided for the executive, for the cabinet?
Okay, Madam Chair. I think I want to put the record straight. The supplementary was done was for the 123, not the 26. I want to put the record straight. The assembly, through the budget team or the budget committee, gave us the answer and advised that proceed to advertise for the 123, we shall provide the budget. And I can ask the budget for the 26, as I've clarified, is from the retirees, the 26. And I really want us to go back to the same scenario we were in when the budget elapses, then we shall again come and look for that money. So I will ask my HR to clarify on the issue of intent.
Okay, before you clarify, HR, I'm aware of that particular law that says that there are instances where I've seen different case laws. One, that there was there was an advertisement for, let's say, 123 in our case, and then 149 were employed. People have gone to court and litigated on the same. And there are instances that the court has allowed the Public Service Board to get away with it. And those are instances where there's a budget, a clear process was followed, including an indent being done by the CCM and all other procedures. I've seen a case law like that. But again, there are other case laws that says you must advertise again so that you create room for everyone to see that there are vacancies, so that they can everybody will have a level playground. Number 2, the process must be followed and all that. So don't say, I know what you're about to say. I know what you're about to say, but just proceed to say. But I've already caught your mind on what you're about to say. But just say.
Chair, on this issue of agriculture, let me just bring to you. Actually, it is what emanated from actually a discussion, because some departments were closing completely, because for a very long time, from 2013, nobody...
That is okay. Let's just go to that issue. Let's go direct.
Now, on the issue of the law,
yes,
basically, we borrowed from even what the public service do. Okay. So long as it is within the 6 months period, you are allowed to use the same list.
It's not 6 months. This one took more than 6 months.
No, after conclusion of the process, you're given a window of 6 months to use the same list to replace people.
Which law is that again?
Well, I will look for it, but I know very well even the public service.
Okay,
you are the HR and you are the advising person through about the HR issues. You cannot answer that. You don't know, and you are the one explaining about that bit of the law.
Chair, also
not also. Give us that law so that we we make reference. Chair, not unless you withdraw that law, because you cannot just take laws by word of mouth. Okay. Wakili, please help me, Honorable Sharon.
Okay, Chair, do you know the law?
Well, I don't know the law, but we were borrowing from what the public service used to do. Because I have seen people in public service, within a window, they can still use the same list. And it was used also by if you go and look at what the office of the AG did. They did interviews for only a year. The people never reported.
All right, okay, let's just move on. We are going to make a ruling on that, Chair, and give a recommendation. But my next question on this issue again, on the letters, there were 123 appointments. I want to know, these 26 that were taken, is it number 124, according to how they did, how well they performed in their interview? Is it now 120, I want to assume number 1 to number 123, that is how they performed in their interview, and that is how it should be. So, did they pick from 124 to 149 according to how they performed?
Proceed, CS.
Madam Chair, I think the County Public Health Board are in a better position to explain that, because I make the request and we actually said consider the merit list. So whatever decision they did there, they are best to explain.
Oh, so we need to check on that. Yes. Lastly, or not lastly, my second last question on that. Some letters, 123 signed by the Public Service Board, 26 signed by you. Explain.
Madam Chair, when the 123 letters were signed by the Secretary of the Service Board.
Yes.
While they were considering the other request, the board was making a decision on the other request. Now, when they had concluded, the CS Kibi had gone for a weekend to Nairobi and fell sick. When he fell sick, the board, because they wanted to release.
CS, I don't want you to continue lying. It's too late in the night. We are really frustrated by how this session is going on. Allow me to ask to inform you. Are you aware that the letters are dated on the same day?
Let me.
So I want to allow me to just wonder a bit. So CS, the Secretary Chebi signs the documents until 123, and then he fell sick, and then you take over from 124 to 149 on the same date. At what point did this Chebi, Mr. Kibi got healed?
Chairman, Mheshimiwa, I have...
Not healed, sick, sorry.
Mheshimiwa, I have a letter from the board which is here, and they delegated responsibility to me. So...
Why did they delegate for you to sign?
It is within the law. I also...
So you're withdrawing that Kibi was not sick?
No, he was sick, but now he has asked me not to pursue that direction. But
I'm asking...
But you're saying, Honorable Sharon, you're saying, CS, that it is within the law that you are signing the letters.
Kibi became unwell, and in that scenario...
In the process of signing 123?
Yes, in the scenario, in that situation, the board delegated the responsibility to the CS. And when you look at the letter...
Can't you see that it's somehow they didn't want to take the responsibility of the extra? Because that is few. 26. Honestly, even a class 3 student can do assignment of 26 after doing 123. That is
even
really
if Chon answers that, Chair, do you have a strained relationship with the board?
No.
You don't?
Yes.
Why is it that you've had a back and forth on the casual workers for years in, years out?
It is, I don't have a strained relationship. And for this case, I'm coming to the casual. For this case...
Okay, let's not go to the casual. Let's just go back there.
For this case of the 26, the board is a stone throw away from here. They can actually clarify why they decided to delegate to me.
Are you aware that even the letter that you're having here, it's not Kibi who gave you the go-ahead, it's the chairman?
In the, Madam Chair.
And all the communications, how comes it's the chair?
When the CEO is indisposed.
Why wouldn't they sign for Kibi?
Okay, the board can explain that better, Madam Chair.
Chair, when is the letter dated? Do you have the letter there?
They're there.
It was on 15th November.
15th November. And the samples of those letters, when were they signed? If we can get even one, it will be really good so that we catch them on their game.
But honorable members looking at the trend, you can see it clearly. I don't want us to belabor so much. We still have time to look at all these questions. Not, Honorable Cialo and Honorable Locales, you want to add on something before I make a ruling? Okay. Honorable Cialo, the same?
Thank you, Chair. I know this issue of agriculture is becoming a thorn in the flesh, especially for the Department for Public Service and the Office of the County Secretary. And I think this issue is opening more and more irregularities that's happening between your office and the Office of the Service Board. Now, I want to get some clarification. It was 9 months. Advert was done. People were called for interview. People were already taken. They were almost given their letters. Then somebody says, there is some addition. Can we add? You are a public officer. And as a public officer, you must be acquainted with the law. There is a principle called the principle of fairness and equity. It demands that there should be openness and equity in all engagements. And it is clear in County Government Act, number 66, chapter 66, about the advertisement positions. It requires that you make it public and you make it so public. These are not two positions. This is not one position. These are 26 positions. And this 26 position can be competitively sourced. You advertise some positions. These were 123. People had already applied, went for interview, and some even maybe had known their fate. And now you are coming to pick. Who will tell the people of Baringo that the people you took, the 26, were picked fairly? The 26 people. Because we have information and complaint from the members of public that those 26 were unpicked. Some even did not apply for those positions. Some did not some went for an interview. Some were not shortlisted. Some were even taken from background that's not related to agriculture. Taking people from environment to serve in agriculture, taking even from different backgrounds. And we are aware, some of even these people, there were a lot of nepotism because they are related in one way or the other to the people who are picking them. That is why this issue came from your office, Dr. Chepkony, the office of the governor, to the service board, and I think Kibi, in his own wisdom, saw that he was going to get a trap. And he decided to get unwell. He signed the 123, and then he got unwell, avoiding taking responsibility. And you were left. That was a trap to you. You did not know. And you signed unknowingly. Even if today this case goes to court, I'm not knowingly. Now, even if this case today goes to court, I'm not a lawyer, Sharon is here, is a lawyer. Don't you think you'll be in for this 26 that you accepted to sign? Yet the chair is there, the secretary to the board is there. If somebody gets unwell for a week, he will come back and sign those after 1 week or even after 3 days. You cannot say he was indisposed. So, Mr. Dr. Chepkony, you failed in your position to ensure that there was fairness to the young people of Baringo. The 26 positions that went without knowledge of everybody, we are suspicious. And if today we will do the investigation of the 26, there are already gray areas to suggest that those who are picked were not qualified. Some even did not have prerequisite papers. Some had not completed university. Some had transcripts. We are ahead of you in this game.
Honorable Cielo.
Thank you, Madam Chair. On that matter, I want to inquire from the CS and the director. Was there an advisory from the finance department confirming that there was a budget for the employment of the 26 officers? An advisory from the finance. And if it was there, I think, Madam, they should table. Secondly, CS as a CS, you're in charge of public service, director, you're in charge of human resource, Ayabe in charge of the payroll. You know the HR manual very well, and you know the HR practice. Was it in order for the governor to call for a cabinet meeting and issue directive through a resolution of the cabinet to the public service to employ people directly without following the due process?
Madam Chair.
Because, just a minute, because if the cabinet can sit and decide to ask the cabinet, the public service board to employ without following the due process, is that not a problem? That is unlawful. And finally, CS, do you sit in the cabinet? Just answer me only that question, then I will proceed. Do you sit in the cabinet?
Yes, I sit.
Thank you. Madam Chair, he has confirmed that he sits in the cabinet. Now the cabinet has sat and issues instructions to employ 26 employees without following the due process. And then you went ahead as a member of the cabinet and signed the employment letters of the 26. Is that not a conflict of interest?
Madam Chair, allow me to answer the issues
proceed.
the Honorable Localis and Cial was raised. Madam Chair, I want to say the responsibility of employment and decision to be done lies with the board. The board gives advisory. The executive will make request. That is why the board is not one person. The board is a team. Secondly, the law gives the board to give delegated responsibility. I did not coerce them to delegate to me, but as a responsible officer who want our county to move, when you are given a responsibility delegated and they have done it within their mandate, then I take responsibility to support the process, to sign on behalf. And they cannot delegate to a member. They can only delegate to the CS, who is the CEO or the CEO of public service or the CS on the mainstream, but they cannot delegate to a commissioner. Secondly, Honorable Shiala has asked, the topmost organ in the county, the policy organ is the county executive, which runs this county, chaired by His Excellency the Governor. It doesn't dictate. They give request to the board. And my work at the cabinet is by the law, is to take minutes to communicate the decisions of the executive, that is the cabinet. I take minutes and communicate. So after they have made an approval, even as they make an approval, I want to put it straight. I don't have, because I'm the secretary, I don't have the powers to even second or even propose. It is the elected who? It is the appointed CECs who have been sworn in. Inside the cabinet, we have our county attorney who provides the legal advice. My work is to communicate the decisions, and he's seated as a member. So I want to really say that the governor does not dictate. Everybody has a mandate. When I communicate, if the board felt that that process is not within their mandate, they should have communicated to the cabinet through my office that we are not able. But if they went ahead and saw it fit that it is within the law, and also the board there have a director HR supporting, they have a legal officer supporting them. So, Madam Chair, I want to categorically say I did my work as a CS, the board did their work, and some of the questions which I'm asking here should actually be answered by the board. I want the director HR to respond.
Before you proceed, I've seen your documents here, and yes. I want to exonerate the agriculture CEC. Who raised the intent for the 26th?
The CEO.
Make it clear, because throughout you've said it is the CEC agriculture, and I've read your documentation. It's not the CEC, it's the CEO.
Normally, Madam Chair, in the cabinet, the communication is done by the CEC. But when it comes to implementation, when I communicate the decisions of the cabinet, the CEC does not sign. It is the accounting officer who is a public servant like me who takes the responsibility.
Honorable Engo?
Madam Chair.
Thank you, Madam Chair.
I think it's your question, so that when you proceed to go to the HR, you would have cleared from them.
The advisory from...
Okay, ask that question yet. You didn't get the answer?
I had asked, Madam, thanks, Madam Chair. I had asked if there was an advisory from the Finance Department confirming that there is a budget for the employment of the 26.
And as you confirmed that one as well,
yes.
Are you aware that there was one person who had gone to court about the irregularities done in that department during the employment, and he or she was awarded a position through this employment?
Madam Chair, the director will respond to the budget because he's the AI holder for HR. I'm not aware, Madam Chair.
Thank you. HR, proceed.
We have noted with concern that the 26 extra that you had in the list letter were put in job groups K, L, and M. What is your comment on that, HR?
Thank you, Chair. Let me begin by answering the first question from Honorable Sialo. Yes, for every request, it must start with the department with a letter. Comes the county secretary, we confirm vacancy and budget, and then raise indents to support the departments. They will sign the indents, taken to Treasury, and then taken to the county secretary for forwarding. For this one, yes, there were indents raised and signed by Treasury and forwarded to. Now the question that Honorable Yengo was on.
Please table those documents.
Yes, we will ask the board, because the moment they go to the board, it is no longer our own.
Don't you have a copy?
No, we don't keep a copy.
How?
Because the moment it goes round.
HR, you just love playing games. You want to tell me somebody gives you a copy of a serious document like that and you cannot copy to keep it. Now you're proving a point that the CS says in your registry, you're incompetent.
No, let me explain, Madam Chair.
HR, honestly, a document like that, that is very serious. You didn't keep a copy?
Let me explain. I am not the originator of the indent. And it comes to me before the letter comes for confirmation of budget and vacancy. The moment it leaves my hand.
So you just sign and forward?
I don't sign. I just confirm that there is a vacancy at the budget. That is all.
So what is left with your desk? So how do you confirm that you received that document?
It comes from the office of the Security Secretary. So we can, for every position.
But honestly, it came to your office. How do we confirm that it passed through your office? Because the CS say it's your responsibility to confirm.
Yes, what happened is that the moment the letter comes from the department, the CS marks to me a copy, to me, my office. I would confirm with the same letter that there is a.
How do you confirm?
Through writing, in terms of on the same copy.
And you don't keep the copy? And you appended your signature? I want that document from you tomorrow, 9 a.m. Where you'll find it, it's your business.
Yeah,
bring it to this house at 9 a.m. Proceed, Honorable Sialo.
Thank you, Madam Chair. I think you've ruled on what I wanted to probably comment. Thank you.
Please be on record, HR.
Yes, I will have to come ask the board to supply me with a copy.
I've said, please confirm that you'll furnish it to this house at 9 a.m.
I will, Chair.
Thank you.
Thank you, CS. I want you to confirm, do you know these casual workers in Baringo North by the name Kulej Esrik, Taising Etich, Vincent Kolele Jeptumo? Do you know them?
No.
You don't know?
Yes, sir.
Uh-huh. I know, Madam Chair.
Proceed, Honorable Ayengo.
Madam Chair, when we requested that every sub-county provides a list of casual workers, Baringo North gave us a list of 20 names of casual workers.
Yes, Honorable Ayengo.
During our fact-finding, the person in charge, the administrator in charge of Baringo North, got another extra 3 names, the ones I've mentioned. Who gave her the 3 names? Because she disowned. She's not aware of them.
And even before you proceed, if you look, I want our clerk to look for that document. I think the God spoke through that document. Those 3 names are interchanged. Instead of putting the position on this side, it is on this side. Only the 3 of them. The ID and the thing interchange. So even you are aware very well about those people, and it is your document.
Madam Chair, I earlier on mentioned that when we wanted to get the data, I assigned the CEO Public Service to chair and go around. Madam Chair, I don't work. And then when the information is given to me, and then again further, we went to clean. So I think, allow me, Madam Chair, after the cleaning, because we wanted to get the final details and whether these officers were engaged, that is when the CEO Public Service cleared the document, and then now we put on Excel. But I personally, as the CS, I'm communicating. So when the document is ready, I communicate the board on behalf of.
Honorable Ayengo, because I went with you to that fact finding.
Yes.
And it's on camera. That one point alone. If the sub-county admits that it was you who gave out those names, mbele yako na yeye, are you taking the liability?
Mimi na yeye.
I mean, we are going further to interrogate this issue. I want you to take liability or say no.
Yes.
Because we went to a fact finding, we always do recording. We don't do things verbally.
Okay.
It's on record that the 3 names didn't come from you.
They didn't come from me.
Members, back
So
to you.
you are not aware of such names?
Yes, and Madam Chair, if I give...
Also, you're not explaining about the 3 names.
If I give a request, Madam Chair, I document.
Yes,
yes.
Stop going round to circles. You've just...
Another, we proceed.
You're not taking...
You have denied that you have no knowledge of the 3 names. In Baringo Central, also, we have names here. I want you also to tell this committee whether you are aware of them or not. One by the name Nathaniel Chiriot, Gilbert Chaboiwa, Nancy Jepto, Kibrono, Winnie Limo, Petty Kimaru, Silvano Kibruta Chebi, and Patrick Blimo Ruto. Who posted them to Baringo Central? And what specific duties are they assigned? And then, when were they posted or employed?
Madam Chair, I'm not aware. Maybe I'll work with the Chief Officer to get actually the facts on the same, and then I'll be very candid to come back and clarify.
I want to note it, and I want you to tell us. We have the one for education, civic, the one who was seconded to the national government. Is there anybody who replaced him? Kiprop?
Not yet.
Thank you.
I rest my case, Madam Chair.
Honorable Locales and then Honorable Sharon.
Thank you, Chair. Chair, let me have some 1-2 questions to CEC. I know to the CS. I know these issues. There are really many, and the Baringo needs to know what is happening. Now, you said are you the chair of Chirac?
Yes.
Thank you. How many cases have you received for disciplinary in Chirac?
Quite a number. We've received cases from municipality. We have received cases from Lake Bogoria. We have received cases from Treasury. What Chirac does is the departments, through their DRAC, Departmental Human Resource, addresses the cases first. Then, if the magnitude requires the attention of Chirac, they forward to Chirac. When we sit at Chirac, we determine the magnitude of the case, and the decisions are now forwarded to the employer, that is the service board, to make a decision.
Thank you, Chair. Let me proceed. You have said well that there are many cases from municipality, like Bogoria, Treasury. I want you to tell us, are you able to tell us how many staff in total, since when you came in, have been sent on disciplinary? 1, dismissed. 2, given some time for disciplinary. And how many cases have you sent to service board? Because are you aware that Chirac is not a final decision maker?
Yes.
In disciplinary cases, especially on cases of dismissal?
Yes.
Thank you. Now, can you tell this committee how many people, how many staff are on disciplinary cases and their procedure?
We know the dismissal. The other cases on disciplinary, we only forward the dismissal to the board, the employer. But the other cases on disciplinary, on warning, on the others we finish at Chirac. I can ask Director HR to maybe clarify on that.
Okay, so that Director may also assist you on that one. How many senior officers have been dismissed, or even some have been given some time for discipline? Senior officers.
Chair, I might not have all the total people, all the total staff that have been on discipline, because they're quite a number. And we dispense them as they come, depending on the magnitude of the issues that are raised in the department. But I can confirm to you that we've dismissed 4 from Treasury. 4 from Treasury.
Are they those 4? Are they junior staff or supervisors? Those on a supervisors level? Which level?
The ones which we dismissed are revenue clerks.
So they are the lower cadre?
Yes, the lower cadre. And simply because, Chair, cases are brought depending on evidences that are supplied by the department. We don't make decisions.
Are you able, Bwana Director,
Yes,
to tell this committee at least some examples of the cases? If it is theft of public funds, if it is alcoholism, if it's absenteeism, maybe you tell us something about the cases, not mentioning the name of the staff.
Okay. The 4 dismissed is about contravening the PFM Act. That is loss of finances. We do not dismiss people on alcohol because the law currently, there's a circular that protects them. We recommend them for rehabilitation. And the 4 basically were dismissed on the PFM Act, loss of finances. Nothing else.
Okay. The four clerks who are dismissed, did you follow up the cases further to their supervisors?
Yes, in fact, when cases are reported, the first instance is done by the department and they are sent to HR via the office of the county secretaries.
So you, as a CHIRAC body, you don't do independent decision. You depend on the departments. And these are the departments with the supervisors who may victimize the junior staff because they want to exonerate themselves and give you a report that is already suggestive that so these clerks are the ones leaving them to enjoy the immunity because you depend on their reports.
Okay, let me explain to you the process. When these cases come to us, we write back to the department to hold what we call a DIRAC, Departmental Human Resource Advisory Committee. The officer himself or herself will appear before the committee. They will be interrogated. A report will be generated. That is the report that comes back to HR that we submit to CHIRAC. CHIRAC gives the same officer an opportunity to appear before it. And on the basis of that, remember CHIRAC is made up of all the chief officers. In fact, inclusive of the people who appear is the union, the representative of the union, that they will come with them. We give them a chance. If there are grounds for dismissal, we don't dismiss. We recommend to the public service for dismissal. The public service will move a step ahead and again call the same officer to appear before that board.
Correct. Now, if I will ask that you furnish us with the minutes by CHIRAC advising the service board on the 4 staff, are you able to furnish to this committee?
Yes, Chair.
Now, the 4, let's say the 4, let me use the 4 because that's a common word we have used. The 4, did this case happen once or it was on an interval, different intervals?
In fact, one is from a staff who used to work at the municipality. And our case was actually, the laws happened within the municipality here. The second person is somebody from Tiati. The case happened in Tiati. Two were two cases from the Lake Bogoria Gate revenue collection. Yes.
Thank you. Now let me wait. Maybe some people will had. My second question goes to CS. We are told there are 12 rig operators. These rig operators, there is a need in this county to have rig operators because they are serving this country with the services of drilling boreholes. When the opportunity came, you had 26 staff from agriculture. Why? You had around the money for 26. Why could you suggest that we take the 12 for RIC? Even if, because agriculture, water, already you are taking people from environment and other cadres. Was it a crime to take the 12 and give a recommendation for the 12? That's a question to you. A question to the county secretary. Now, my last question is on the issues of ECD teachers, medical covers. Do you provide? They recently signed their contracts and some permanent pensionable contracts. Do you provide medical covers for the ECD teachers?
Proceed.
Madam Chair, all of us are aware that budgetary allocation is program-based. The retirees were from agriculture, and they need the Department of Agriculture has placed their needs. So it is difficult to say, at my position, to say this money to go to water, because the department is the one responsible, want to replace their retirees. It will not be right. The ECD teachers, I'll ask the director to the position. I think we have covered them, and they're on our insurance cover.
Let me get a confirmation, because I have a question about it.
Proceed, the chair.
Let me begin with the first question on the issue of rig staff. In fact, the issue of the rig staff, we have had a deliberate discussion. We discussed it even in Chirac. And the only thing we wanted the department to do was, where were we getting the resources? Because without resources, then it would have been very clear. In fact, it is documented in Chirac meetings. And we told the department, let us go back to the departmental committee of the assembly to try and secure money to employ. It is true. We have made a serious crime in this county. And in fact, I will combine with Sharon, what Sharon had asked initially, Honorable Sharon, that are we liable if these guys were to go to court? Yes. The law provides that any employee that you engage, at the type of engagement, if they were injured, you are liable to compensate.
And,
now,
and director, still on what Sharon is saying.
Yes.
Are you aware of the 3 million that was to be paid for the remuneration, salaries and remuneration for the operators? Are you aware of the 3 million?
Which operators? Maybe you can
the RIC operators. There was a budget line.
No, because there are two budget, within the budget line, we only manage in HR contract and P&P. If they were for casual employment, it is done at the departmental level. So I'm not aware. Now, as to on ECD teachers.
But what happens?
Yes.
But what happens when there was money in a budget line indicating salaries and remunerations for the RIC operators, and it ended up paying even a sweeper, a cleaner in the same department? And you are telling me we cannot use this money in this county for agriculture to pay the RIC operators. Yet, for the RIC operators, we had given them 3 million for their remuneration and the allowances, and it ended up paying for even a watchman, a sweeper, and others.
If you look at the County Government Act and the structure we have in government, the hiring manager, even the indent that we do, the hiring manager is the chief officer. So without the chief officer making a request to the county secretary that I want to hire these people and there's a budget line, then we cannot even do anything. So we are binded by the chief officer ensuring that they request, and the request will come, we will confirm, we will know the budget line, and we will process. So for us, we warrant...
So let us say this whole issue is back again to the chief officer.
Yes.
So the chief officer can decide to do anything.
Well, I might not answer that because, you know, they are accounting officers. To me, my understanding, if you have a budget line and say, I'm going to payroll teach, it should payroll teach, not John.
So this one for rig operators,
yes,
it is a clear. We have evidence. The line was payment, salaries for rig operators and their allowances. And it ended up paying everybody in that department who had issues of salaries and any other. So are you using any forte to pay everybody?
No, I don't think, because every budget, like now the 34 million, the one we have put for casuals, you cannot change it to something else. You can't, unless you do a budget reallocation to cover for, and it is done by the chief officer through the assembly again, so that you can relocate that money for that purpose.
Thank you. So you see, the rig operators were paid only for 2 months, yet their money was able to pay them for 1 year. Now, they have arrears for 10 months, because they have already been paid for 2 months, the remaining 10 months, no money. Yet, there was a budget line in the financial year 2024-2025 budget. Who are we going to blame on a director?
My understanding is that chief officers are employing and they are the accounting officers. So the chief officer, relevant chief officer, should be responsible for that.
So chief officer, water should take up that responsibility.
Yes.
Thank you.
Now, on the issue of medical cover for ECD teachers, yes, we cover ECD teachers as per the SRC circular. The only challenge I know we have had with TRT is we lack the hospitals that can handle most of our staff. And that is why we even gone ahead to request Kenya Alliance to sign an agreement with our county hospital so that they can use that facility. We've requested whether there are facilities that can accept Kenya Alliance. And I think the last time we had written to Kenya Alliance, there is a mission hospital in Tangul Bay, which we had actually written. And there is a facility in Chimalingot, a private, which actually currently is serving staff again on that insurance.
St. Clara?
Yes, St. Clara from in Chimalingot. Yes, they are serving staff. From
now, Director,
yes,
confirm to me, if these teachers are getting services from this medical cover anywhere in this town, because I'm aware of one who went for a tooth checkup and he was removed one of the tooth, and he was told until they get approval, take a picture of the tooth plus the person plus where the tooth was. Yani piga picha mali hiyo meno ilikuwa, piga picha hiyo meno na utume ikiwa kwa picha. Sasa hii insurance, the insurance you are using, is it efficiently working for our ECD teachers and even other staff?
I think the way the structure is, first of all, doesn't know who is an ECD teacher, because it is, everybody has a number in terms of a membership. Number two is that for every condition, there is what we call prior authorization. When you go for service in any facility, they write to the insurance requesting for approval, because within the cover itself, There are what we call benefits that are for dental, for inpatient, outpatient, all those things. So I don't know that why I'm suspecting that likely the hospital moved ahead, did the service without being approved. Then now you're asking for payment, and that would happen. But I know very well that there must be pre-authorization. I personally receive, when staff get stuck, I get called even at midnight. And I answer, I call the insurance, and they have been providing those services.
How many of the siblings of that staff benefit from the medical cover? Is it individual or some siblings from the?
No. The cover that we have taken is what we call a group cover. It is 5+1. Principal and 5 beneficiaries, that is a wife and 4 children.
Have you that data? Did you collect those data from this staff, all staff, including the ECD teachers? Because I'm concerned with the ECD teachers.
Yes. What we did is that when we renewed the contract for ECD teachers, we went to the ground with the insurer. We held meetings. In fact, we went to all the sub-county headquarters, and we have been working with the ward and sub-county admins. Whenever you request, there was a forms, first of all, we shared. They fill and we forwarded the insurance. And even if when you are not in the list, the moment you get stuck, we have agreed with all facilities that we use that they call the HR, and I normally submit their names and follow it up until it is done.
Finally, what is the amount for outpatient and inpatient for that cover?
We have different, the SRC has provided different covers for each categories of staff. For ECD teachers, maybe specifically talk about ECD. Actually, what the SRC has provided is between job group G to job group K. The inpatient is 750,000. The outpatient is 100,000. Maternity, I think, should be 50,000. Dental is 15,000. I may not be but there is every category has its own. I can submit, I can actually provide the SRC circular that are provided the banding. And it is the same one that when we are advertising, we send to the insurance that these are the categories of staff and this is the benefits.
Now, in Cabernet Town, yes, because it's central town, which hospital do that cover take?
The facility for the consultants, which is in this building called what?
Equity.
The Equity Hub here. We have another one. Actually, most of the hospitals in this town cover NHIF. No, not NHIF, but Kenya Alliance. In fact, all of them except, we have actually even signed an agreement now with our referral.
Yes.
And I don't know whether because what was being waited was the activation of the smart system.
Mm-hmm. So are they using the MTBA or the smart one?
Smart, offline. You can use smart or offline. Both of them are available.
Okay.
Yes.
Thank you. Let me give the remainder of my minutes to Shallow.
Honorable Cialo, proceed.
Thank you, Madam Chair. Honorable CS and the Director and Manager HR. Do we have a Deputy County Attorney Officer in Baringo?
No, we don't have.
There is no such
we don't have
person?
Yes.
Okay. Do you know a lady by the name Judith Yatich Koimugol? So
yes.
What is her designation?
She is the legal officer for the County Public Service Board.
But not
deputy
director?
Not deputy. We had a county attorney, but all of us are aware, God forbid, but when that office became vacant, we had only 2 legal officers, Patricia and the legal officer in the public service. But on the ranking, in terms of, I think Honorable Sharon can tell us that they have their order. So we've told them to all brief, but we have advertised for the position.
Solicitor, who's supposed to be the prosecutor. Now, unfortunately, when the board advertised that position, they advertised it, they called it senior legal officer, but advertised it at job group Q, which was an error. Now, when this thing came to now the right placement, you cannot have somebody, a senior in the legal fraternity is job group M. So there was that problem, and I think because that is a common thing we have, which we are correcting through KDSP2, is that we will equate positions for what is available in the payroll for payment. So those things are being corrected. So she is not a deputy.
Madam Chair, I have serious information here that our designation is Deputy County Attorney. And I don't know, Ayabe, are you aware of this?
Yes, and I want to own it up, and that's why I explained to you. We have had issues with designations, and it's something even we are conversed to the national level, where you will find some designations not available in the IPPD and the IRIS Kenya. We've raised it. Now, when you get, if you go to the IRIS.
HR, you are aware the process where Judy is at the moment. At what designation is she going to be employed?
It is the board now to correct the mistake, and actually she's supposed to be.
I'm saying at this moment, at this point of an hour, you are aware of the process that is happening. Under what designation is she going to be employed?
The process
before
of conversion.
It is corrected.
The process of conversion.
Are you aware the process of Judy is at what point?
Let's be factual here. Let's be factual here. Does the system just pick automatically and gives me to be the director or anything and earns from that job group? Or it is someone that enters these details?
It is done manually.
Yes. So who is this person that gave this lady that designation to be the deputy county attorney?
Well, maybe I leave it to the payroll manager to explain that.
Okay, thank you. I think the director has explained it all. Well, in the payroll, some of the designations are not available in the system, and so long as the job group do not change, or the amount of salary which was given to the officer, the system will pick any designation which does not, so long as it does not change the job group or the amount of the money which was indicated in the appointment letter.
Director, I really want. Now we do not have a substantive county attorney. You know what happened. So what will happen if this lady comes and claim that I've been the acting county attorney and I want to be confirmed, or deputy county attorney and I want to be given that position of the late county attorney?
I think that one will not be true, because
already his details, his employment details shows that she is the deputy county attorney.
What is important in appointment is the appointment letter. So that is just a deployment title, because we have some challenges in the correct designation in the payroll.
So Ayabe, this is my final question, and then if we ask you to provide the payslip for this person, what will be the designation in that payslip?
Well, I may not know now, but it is possible that it can be a deputy attorney. It can be possible. But what I know, the job group did not change. The job group should be Q. So in the payroll, we have some other designation in the payroll, as the director explained very well, that most of those designations are not available. So the norm, we just pick a designation which is almost similar in that job group. So long as the job group does not change or the amount of the money. And for example,
is
like
that happening elsewhere or it's only
all over Kenya in the system? Kenya. For example, let me say an example of mine. My appointment letter is county payroll manager, but it is not available there. So the best designation is deputy director, human resource. And the same thing, like for example, county commissioner. I think that, or OCPD. So there is no such designation. That is just a deployment title. So we check the correct designation.
Honorable Sharon, proceed.
HR, I would really expect you to guide us. You know, I have a lot of faith in you. Employment Act states that requires employers to provide employees with written statements of terms and employment, which includes particulars such as job description or designation. So when Judy came to this county, she applied a job. What is her job description? Who is she?
Chair, according to the advertisement which I saw,
yes,
and the appointment letter, she was appointed as a senior legal officer.
So what is so hard to have him as that in the payroll system?
Within the payroll system, we do not have a designation called senior legal officer at Q. You see, remember what they did?
And remember you had said that these designations are inserted manually.
Yes.
So this payroll thing is not a software that cannot be changed. It's actually you guys usually do it manually.
Yes. And that's why I say, Chair, and I respectfully want Honorable Sharon.
Yes.
The advertisement that was done initially by the board had an error. You cannot advertise a senior legal officer at job group Q. It was a mismatch between the designation you're advertising and the job group. Now,
are you saying the job that the advertisement that was made and then Judy applied for that job?
Yes, job group Q.
Why is it that they did not rectify at that point?
Well, I may not answer for the board now, that one. Now, when it comes to that, and the moment the letter has been issued, what we have actually discussed with IPPD is because this is a system that needed to be corrected all over the country, within the counties, is that we do what we call a comparative. We take the job group and say, if you are in job group Q, which is a valuable designation within the IPPD.
The advert on that, so that we understand you more, what job group was Judy supposed to come in with the advert?
Q, same Q.
And now she's in job group?
She's still in Q. The only problem, there was a mismatch between the designation that was advertised and the job group.
And the CS, are you aware of the process that is happening in Judy, that she wants to be employed under PNP at this point of an hour?
No. Chair, and still on this particular issue. So currently Judy is holding a position that doesn't exist anywhere. Does she?
Chair, I say that the advertisement was wrong. The mismatch between the job group and
I'm just saying the current position
yes,
that she's holding.
It is not there in IPPD. And
it doesn't exist.
It doesn't. And
do you think you're disadvantaging Judy as an employee?
No.
When she applies for a job, let's say she wants to be something, like let's say, for example, this job that the vacancy that we have for, that will work for her. But let's say any other job, and you want to say who you are, and she's told probably provide your pay slips, and then the pay slip come with a different designation. Will that be a problem?
If you ask to provide a pay slip and the appointment letter, then there is going to be a challenge. But normally when HR, when you apply for a job, they would want to see a letter of appointment that shows that you occupy the position. Now, I agree with you, Honorable Sharon, that these are errors, and it is not for Judy alone. We've actually raised it with even what you call Council of Governors to harmonize designations within the systems, because it is giving us problems. Like a very good example, there is a title we are calling it in our establishment GDU. If you go to the system, the IPPD, there is nobody called GDU. So what do? When you have employed as a GDU, which is a deployment title, we look at the job group and say, which is the nearer one, and we deploy you. That is the job that the designation that we give you.
Okay,
for payment only. But let me assure you, I've even written a letter to the CS. We are on the process of correcting all these things through what we call cleansing of the payroll that is supposed to start in July with the support of KDSP2.
Honorable Cielo.
HR, I don't know if you remember, I was the head of GDU. Yes. Do you know what my payslip used to read, my designation?
Chair, I might not remember now, but I know the job group, so let me not mention.
Mine was exactly GDU.
GDU?
Yes. Honorable Cialo, I think that's not true. There's nothing like.
What was my designation? Payroll manager.
I know what I know is only it was something different, not GDU as you.
For that matter, I want you to produce my payslip. For this one, I give authority.
With your
just to confirm what you're trying to.
With your permissions, you know, payslip is a property.
My last payslip. Just produce my last payslip to this committee so that we can. Then finally,
I will do that.
Director HR and the team and CS. If there are these issues, like for the ones we've just noticed, have you taken the initiative to inform this particular staff or this staff that your payslip will come with a different designation from the letter of employment? Or you're just leaving them to wonder, how am I the deputy county attorney?
HR.
Chair, we don't write. Majority of these staff, when they receive their pay slips, they will come to us and we will explain to them. Most of the staff who have different designations within the letter and the pay slips have come and we have shared with them the challenges we have. We do share when somebody comes forward. Because for us, is so long as the job group doesn't change and the salary.
Did she come to your office?
Yes, she's aware.
She's aware?
She's aware.
What if she decides today to claim this position?
Well, for us, we will use the appointment letter, not the pay slip. Because the pay slip is a personal document, but the appointment letter is
So if she produced this in court, and I think Sharon should guide us here. If she, yeah.
Honorable Sharon.
Allow me to be on record on that. You cannot say that a pay slip is a personal document. That is what you as an employer, while it's personal, you're the one providing the employee. She doesn't just pluck the pay slip from the air. It's a document that you give that person. So it's a document that she can easily use to challenge you in the court of law.
That one, the issue of payslip, in fact, we don't even print payslips. It is not, actually it is not a good way of, the officers are getting their payslips online through a portal called CRIS.
We know.
Payslip always, that's why.
Payroll manager, we know that.
That
one is a very basic information.
Yeah, that is why we certify the payslip always for any authenticity. We certify.
Okay, so when you certify, and then probably I'm supposed to even take up a loan. Oh, that is a very good example. Let's say, for example, I want to take up a loan, and this bank wants to know who I am. and then they say produce your pay slip, and then I've said I'm a member of county assembly, kumboko payroll wameniandika mimi ni something else. So don't you think that mismatch can cause some sort of confusion?
Chair, we are cognizant of that, and that is why we have had very high discussion even to the level of Council of Governors.
Okay.
And we have begged them to correct for us because there's nothing we can do. Remember, the payroll system we are using is a national government payroll.
All right.
Yes.
So from July, you are saying that you're going to clean up the system.
Yes.
That is what they are saying, Cialo.
Honorable Cialo, please wind up.
Thank you, Madam Chair. And Director HR and probably the CS, are you aware of 3 employees who were dismissed verbally in the year 2019? And they did not appear in Chirac. Actually, 3 of them come from Goti. One is by the name David Corio. The second one is Nancy Kipkazi. And the third one, I think I forgot the name.
Chair, yes, I'm aware because Corio happens to be almost my neighbor at home. Those 3 officers went through the right procedures in terms of disciplinary process. They were dismissed by the board. However, when they appealed, the question was raised as to how can you appeal to a board? Because the provision was Corio should have appealed to the Public Service Commission and his team, because the board that dismissed them was a legally board that was in office. So they could not appeal to the current board because a board cannot rarely alter a decision of another board. And that the law has provided a leeway to appeal to public service. Unfortunately, I think the officers within the period, they never appealed.
So you have a letter of dismissal for these 3 persons?
Yes, because even the appeal, the appeal letter that they tried to do it for the second time was actually, they came to us and we said, we don't handle appeals, let the board. So the board must be having the minutes and the letter that they gave them.
Madam Chair, I think through your guidance, if we can find the board's resolution to dismiss them, and even those dismissal letters, I think we will address that issue conclusively.
Thank you, Honorable Cialo. I think I can rule on that we write a letter to the board so that we get those minutes. And members, allow us to conclude on this session. Okay, Honorable Sharon.
Chair, I'll ask this question to the HR, will help us understand on the issue of non-practicing allowances to the advocates. I don't know if you're aware of the judgment that was issued in 2020 regarding the issue of non-practicing allowances.
HR, proceed.
Mine is not. Chair, I am aware of the ruling. In fact, the issue of practicing allowance for counties is something we have canvassed. I think even the county secretary, we wrote to the Public Service Commission because we wanted to know a direction. The Public Service, and we had a discussion with them here when they came.
Yes.
The challenge we had is that even the last circular that came only said it is for civil servants. And we were hoping that the county had, because we have never refused to implement. The challenge is that SRC has never given us authority.
Please check the letter that was forwarded to your office. This letter dated 19th May 2025. And the judgment is so clear. The ruling is so clear that you need to pay the allowances. And once you're in receipt of that, payroll manager, please don't take the advocates in circles. Please pay them their allowances. Having said that, Chair, we've had a very long time, and I pray that this process will be meaningful. That is my prayer. Thank you.
Thank you, honorable members, and the the county secretary team, the Sajinata, kindly work them out. We've come to the conclusion of our hearings. We are going back to finish our report and come back to the House officially as the House resumes tomorrow. Members, we've come to the conclusion of this. Thank you. The point is home, don't be labor. As long as you're not coming on that point that he was.
Chair, I had asked, how can the CS do things like confirming an employee, one FRIDA, into permanent and pensionable basis without the approval of the board? And how is the payroll manager paying someone, like whose instructions were you acting under payroll manager? You can answer that and then the payroll manager can tell us if there were proper documentation on that.
Noting on that, Honorable Chepkonyo was moving sequentially, and I know that answer will come. Proceed with that. I want us to conclude on that matter. The executive gave you orders.
For Gurere, we wrote to the board requesting that there's no MD to support.
Honorable Sialo, you're getting your answers.
It's a temporary measure. And actually, as we speak, the board approved it, and we took Gurere to Chemasusu. And he has done a good job. When his contract ended, he had already put a board in place. And now he has been, from 1st of May, Kurere, the board found it better or good to have Kurere continuously advertise for, because the role of advertising for the MD lies with the board of Chemasusu. But by then, there was no board, and we could not advertise, and so we had to second an officer from the Medicine Public Service to support.
Proceed.
Madam Chair, I think just a point of interjection. I want more information, Bonaciers. When was the contract ending for that said person?
Maybe we need to look at the file. I don't remember very well, but by then we had to renew the contract.
So the contract had?
I think it was almost ending.
Yes.
No. Most of the GDU were ending around, I can't remember, but I can provide that information, Madam Chair. So we had to write the board to renew, to have somebody to hold on the organization. And that is what we have done. And Madam Chair, if the honorable members of Assembly from Koipatek are there, they would actually attest that we did a good job to see if that is true.
We are done with Korere. We are proceeding.
Now, on the issue of
maybe, Madam Chair, why not extend the contracts of the other GDU members? Was this person special?
Of course, it's because of the need and the qualifications he had.
How about the others? You know, Honorable Sialo, I was waiting for him. You had almost around 4?
Yes.
Yes, we are still waiting for the rest.
From those who are there by then, the only person who had masters in business management, because that institution.
It's okay now for Kurere. You don't have to belabor the rest. You know, I gave you a very safe. Listen, yes, I gave you a very safe playing ground.
Yeah.
You will not say protect me or do anything.
All right.
You know, this was your co-governor, and as an honest person, what would you have done to his people who have remained in this government? And number 2, the confirmation that you did to your staff, and they were tenual. You will not tell me for Giptis they were tenual. Yours also were tenual. And even yours is more grievous. You put in on PMP without even the approval from the board. So I want you to tell me about what happened to the discrimination of these others who went home.
Madam Chair.
In the powers that were bestowed by this government of Cheboitu.
Madam Chair, let me just be, if you look at the extension of those contracts, It is not me. And I want to ask the members, is there a place where I've appended my signature? You see, I also left office in 2022. And I left
do you see you are the most powerful now than even in that time?
But now when
because honestly,
yes.
if you're able to put your staff on PNP, which is very competitive, everyone is. Do you have those? Can you even confirm first? Did you put them on PNP?
No.
The Frida, the one you're saying, and the three of them.
Madam Chair.
Honorable Sharon.
I think for us to move forward, and I'm seeing that let him just answer one question after the other. The issue of the GDU and his office, he has confirmed that